Hey y'all, I'm AdaKay, and I must confess, I'm a trial junkie. I enjoy viewing trials as if I was the seated juror. So grab a cup of java, get comfy, and join me as we hop into court. And don't forget to comment, like, and most importantly, subscribe. And if you're really enjoying the channel, please join our membership.
Good morning. Good morning, everybody. Welcome to my world. How are you doing? It has been a glorious morning. Good night's sleep. Getting ready to get my first cup of coffee. And we're waiting for the infamous Karen Reed. Excuse me. I need that cup of coffee. Karen Reed to hop up. We are in queue waiting for court to start. Thank you for joining. For those who don't know me, I'm AdaKay, and I just want to say I appreciate you being here today. It was a court was supposed to start at 7:42, it says. The stream, not the court itself. So we are now waiting for the live stream. Yay! Good morning. Good morning. Let me get everything lined up and ready to go. I'll get the court feed up there for us. Yes. Let me embiggen this so we can't till it comes live. Now, Miss Karen is back in the Norfolk Superior Court for a hearing on a new trial date in April and possibly expert testimony. I was so looking forward to this. I am brokenhearted that they're moving it to April. I was like, January is going to rock. We're going to have a good case. Nope. I should have known better. Let me get my coffee going. I am going to try the new Christmas blend. Hope I got it going right. Yep, there it goes. I am enjoying my coffee. And while we're speaking of coffee, I am so blessed to have the Hitchman Homestead Shooter Shack Coffee as my sponsor. So let's hear a word from our sponsor real quick. Hey, y'all, please help me welcome the Hitchman Homestead Coffee. They are fabulous. They have many different blends of freshly roasted, freshly ground coffee. They have a monthly club where you get 4 bags for $40 or a Keurig option. Also, they just came out with a half and half. Oh my gosh, I absolutely love it. So do me a favor. Go down to the link below at hitchmanhomestead.com. Order you some coffee and show them some love. Yes, show them some love because, boy, their coffee just wraps its arms around you. It's like a good big hug in the morning. Saying, I got your back no matter what today brings. I love their coffee. I mean, this used to be a person who enjoyed, let me see how to put this without doing the copyright. The star that you put on top of the tree and the buck that runs in the field. Coffee freak. And I tasted this and I'm all like, I'm done. I still love the tumblers, but the coffee is phenomenal. Okay. Got my coffee. I'm ready to go. We're waiting. We will be, oh, there it is. When this is over, we're going to be catching up on the Joseph for Lazo Palazzo trial. We're playing catch up on that one. And then I did last night the reading of the Sarah Boone documents. I did a reading of that last night. I'm going to do it again. Now that I've read it, oh my gosh, it's so hard to read. Her handwriting just kills me. But I'm going to do it again in a separate live. Hi, Toxic. Good morning. I'm going. Please tell me it's not my microphone. I got to get there. Got to get there. There you go. Sent it. We're good to go. There you go. For once, I have it. Usually I'm the one chasing and begging for a feed. How did that happen? Oh, sissy, you're smiling down on me today. Okay, don't get me crying. For those of you who don't know, my sister passed away, and I want to take this moment to thank everybody for their love, support, kind words, super chats, all of that. Toxic, am I going to get in trouble? Oh, Eddie, I will do that. Oh, God, that would be so much easier to read. Why didn't I think of that? Eddie, do me a favor, because I don't want to screw it up. Are you in our Discord? If you are, I will send you the link, the docket in Discord, and see if you can do it and then repost it in Discord for me. That would be phenomenal. Oh, excuse me. I don't know if you guys heard that, but that was a happy neck. I actually slept good last night. Once I went to sleep, I had a really good night's sleep for the first time in a while. Am I going to get strikes? Because I can cover that information. Once it starts, I'll pull it off for the moment. Put me up there. I can take care of that if I have to. Am I going to get in trouble? I need Toxic this morning to tell me. Oh my gosh, would you please do that? Let me get this stuff done. Live stream. Let me get a hold of Toxic. Or she's typing. Okay. Good morning, Ronnie. Let me see, Eddie, if I can find. Eddie Lawtube, is that you? No. Eddie, is that you? I'm trying to send you the document. Everybody, we are waiting for the Karen Reed. Well, guess what? We's gonna try. There you go. Give it a shot. It doesn't hurt to try. Sometimes it may not work for one, it will work to somebody else. But we're gonna give it a go. Okay. We're waiting for the feed. In the meantime, I'm looking for another source just to be safe. Mm. Y'all, Dick Van Dyke's house was in the path of that horrible firestorm. I wonder if it survived. Hold on. Brandy is working on a Netflix documentary series, but you can't say what case. As a development producer, she'll be on camera. So proud of you, girl. So freaking proud of you. So, um, we're still waiting. I'm just surfing around trying to see who has a feed. A lot of people are looking for a good feed. Oh, guys, we have something too. Sentencing for Gabby, for Chloe Driver. We got that we can watch until then. Yeah. Y'all, we got so much going on today. We have the sentencing for baby girl stabbing murder trial, Chloe Driver. Jury found Chloe guilty of mentally ill malice murder felony, a first degree cruelty to a child after she unalived her 13-year-old daughter, Hannah, in 2020. Remember the one whose husband was a cult person? So we're gonna see which one of these pops off first, but we will. I just realized I didn't put mascara on. Oh, well. That's what happens when you're in a hurry. I didn't put mascara on this morning. Dagnabbit. Um, so, um, oh, well, I have another feed, another stream if you need it, toxic, that are getting ready to start. I didn't mean to do that.
It's unbelievable to me when you hear him talking. He sounds exactly like his father. It's unbelievable. I'm sure. Yeah. I've only met Matt a few times, but I instantly took a liking to him. You know. And Jay was.
Oh, and the other case is going off. We'll do this one till the Karen Reed pops on. There we go. I can't get used to Karen Reed's attorney in a beard. I think he looks better. Okay. Let's see if it works, Eddie. We're gonna pause this one. Don't Karen Reed. Why do I still have that in my ear? Sorry, guys, I'm having a little technical. Oh. Here, we're gonna stop that. We're trying to get everything lined up. So if I'm quiet, I apologize. I'm lining everything up. So for those of you who are joining us, I assume everybody knows, but it's sluggish. Okay. It would be great if I can get it typed, even if there's a minor error here and there. God, that woman's handwriting for me is very difficult to read because it almost seems like every word runs into each other. There's really no separation between the words. And I'm trying to figure out, is that 2 words or 1 word? So, but back to Karen Reed. For those of you who are new, who don't know anything about Karen Reed, which would shock me, that's why I assume you're here. But Karen Reed is accused of unaliving her Boston police officer boyfriend by drunkenly backing up and hitting him. And yeah, it's interesting. Oh, they have it up? Oh, wonderful. Yay. Thank you. I looked there for a second ago and it was not up. Let me see if I can get it up now. I just hate it when I'm waiting and it's not there. I don't see it. You got a link? There it is. Darling, it's the same feed that I have. It's just their logo isn't on it. Give me a second. We're going to do this and big in it. There we go. Gotcha. Thank you very much, love. I can't say it, but we got to be careful. People get picky. There we go. Try it, Eddie. We'll see. Eddie, what if you did it into another language, save it as a whole new document, and then take a whole new document and translate it back to English? Just curious. Copy and paste the new language into Word. Save it as a new doc, and then take that document back into the translator. A little more work, but maybe it will do the job. I don't know. I'm new at this. I got to tell you, it's hot. I got to open the door in my office. I'm toasting. Yes, you see my wheelchair right there. I switch between the two during the day. Oh. It's weird. The back half of the shop gets super hot with the heater on, and the front's still cold. And so it's kind of like, it's very hard to regulate. That is a packed courthouse, y'all. I want to know, how can she afford a whole nother trial? That to me is so insane. Thank God they can. Thank God they can. Well, while we're waiting, that went down rough. An airplane crashed in San Antonio. I think it was San Antonio, Victoria, Texas. On the runway. I mean, on the highway access road. Yep. That was crazy.
The host would like you to unmute your microphone. You can press star. You are unmuted.
Where's the judge? What? Please don't tell me the judge is joining remotely. Wow. Okay.
Did you do it?
Hey, 80s music man. Yay! Okay, let me do this for a minute. We have some birthdays. I have a couple of birthdays.
Happy birthday to you. Happy birthday to you. Happy birthday. Happy birthday. Happy birthday to you.
Happy birthday, Candy, Sheila, and Stacy. Cynthia, yay! All of y'all have a happy birthday. Katie, Peggy, Wendy, Wendy Miller, happy birthday. Rhonda and Licia, yay! All of y'all in my Facebook family, happy birthday. May it be a blessed one at that. I'm making sure all my volumes are up.
Judge, this is 22117, the Commonwealth versus Karen Reed. Can I have counsel identify themselves for the record, starting with the Commonwealth?
Thank you, Mr. Clerk. Good morning, Your Honor. Hank Brennan for the Commonwealth. Along with me is Attorney Adam Lally and Attorney Laura McLaughlin.
Good morning, Mr. Brennan. Good morning, Mr. Lally. Good morning, Ms. McLaughlin. Good morning, Your Honor. Alan Jackson on behalf of Ms. Reed.
Good morning, Mr. Jackson.
Good morning, Your Honor. Elizabeth Little, also on behalf of Ms. Reed.
Good morning, Ms. Little.
Good morning, Your Honor. David Unetti for Karen Reed.
Good morning, Mr. Yannetti.
Good morning, Your Honor. Robert Alessi for Ms. Reed.
Good morning, Mr. Alessi. Good morning, Ms. Reed. All right, so for today, we have our Daubert hearing. I asked through Mr. Clerk the parties to have a proposed scheduling order for me. Were you able to do that?
We've begun the discussions of it. I think we could have it shortly, Your Honor. I have some proposals by the defense. I just want a few moments to reflect on it.
Okay. All right. So during a recess or something, I'd like you to at least give me something so that we can discuss it today. There are some discovery motions and then just some housekeeping matters. So I would like to get started right away. Is Dr. Russell here?
Yes,
For
she is, Your
Dyer.
Honor.
Okay. Oh, good morning, Doctor. Would you come on up to the witness stand, please?
Uh-oh, here we go again. She must be nervous. Oh, I'd be nervous. Eddie, as soon as you can, send that to me. You're amazing. Freaking amazing.
Thank you very much.
Yeah, this is that nice courtroom. The big courtroom.
I do. Good morning, Dr. Russell. Okay, the defense is calling Dr. Russell as a witness.
This ought to be good, y'all.
Jim, can I have the exhibits? Will counsel need the exhibits for examination of this witness, or can I have them with me and look at them?
Your Honor, whatever your preference is, we will abide by that. We may want to publish some at
Sure,
appropriate time.
that's no problem, but I can keep the notebook. That's not a problem.
Oh, yeah, that's
Okay.
intended for your use, Your Honor.
Okay, all right, thank you. All right, go right ahead, counsel.
Your Honor, if I may, a couple of matters
Young
before Dr.
thing.
Russell testify, with Your Honor's permission.
Okay,
One will take 15 seconds and the other will take maybe 3 minutes.
okay, is it something that Dr. Russell can remain in the courtroom for?
It is.
Okay,
And
Sure.
if at any point I'm incorrect in that assumption, I'm sure you will tell me.
okay,
I like
First
him.
of all, the first order
So
is I
formal.
want to thank the court for
Your Honor.
granting my permission to practice before the court.
okay.
And I'll strive to comport myself
He's-
to
he's a
honor the
newbie.
opportunity I've been given.
Thank you.
Secondly, with regard
maybe
to
he's from
the
out of state.
decision that Your Honor rendered
Good
with regard to
morning.
our opposition
Afternoon.
to the motion, the reason I just wanted to raise that briefly is I wanted to make sure that I properly discharge my role in terms of a record. It won't be a long soliloquy, but I just wanted to point out to Your Honor the basis for why I am
Gosh.
having this colloquy with the court.
Okay, is it in addition to what you have in your writings?
It is.
Or is it, okay, so that I'll let you talk about, but,
Yeah, I'm not going to go into the substance of the writings.
Okay.
I understand Your Honor has decided in that regard.
okay,
So, and thank you, Your Honor. The first point is rooted in the Commonwealth versus Downs case, which is 31 Mass App Court 467, 1991. And the short of it for that case, which is toward the end of the case, which it was a matter very similar procedurally to this, where there was a request for reconsideration. The court took on that question of reconsideration. And what happened was the appellate court stated that it would be important, and I'm trying to discharge my duty as an officer of the court, but also for an advocate, to put on the record, right, the decision with the basis for the decision with regard to it.
sure. I know, I have no problem with you doing this. You don't need to apologize
Okay.
for making a record. I have no
Okay.
problem.
Thank you. So I'll get right to it. So my request is in accordance with Downs that there be placed on the record some explanation for the decision. I would appreciate that. And then secondly, the second and last part of it is our expectation coming into the hearing is based on Commonwealth versus Addy, which is 79 Mass Appellate Court 835, 2011. And the short of that case, Your Honor, is it was a Daubert-Lanigan motion, very, very much similar to the procedural posture of this motion, where the court set a Daubert-Lanigan hearing. The party who was in support of the expert testimony then was given the opportunity to oppose the motion, and this is what the court said. The court stated that in response to the motion, the Commonwealth, and it was opposite because the Commonwealth was supporting the testimony, says in response to the motion, the Commonwealth submitted Trooper Sanford's collision reconstruction report. Then I'm going to skip down to the nub of it. At the motion hearing, after reading Trooper Sanford's report and listening to the arguments of counsel, the judge decided not to hold an evidentiary hearing and ruled that Trooper Sanford's opinion was admissible at trial because there was a factual basis for his opinion and it was therefore reliable. The reason I bring that up, Your Honor, is just to state what my expectation was and why I went in the manner that I did. And of course, Mr. McDermott was gracious enough to send an email that said, hey, if you want to change what the court expects the hearing to be, you need an affidavit and you need a motion, and that's what I did. So in conclusion, Your Honor, it is the position of the defense that the papers that we submitted, and I won't get into the argument, would obviate the need for an evidentiary hearing, much in the way that the Addy case obviated, where the party was given an opportunity to make the arguments in terms of the motion. So my main point in raising these two in conclusion is I would appreciate if Your Honor could state a basis for the denial of the what I will call the Addy process, and we will of course respect Your Honor's decision and proceed in the manner Your Honor directs.
Okay. What do you
Woo,
say?
I like
Who's gonna
him.
argue this for the Commonwealth?
Hank Brennan for the Commonwealth.
He's nerdy
Your Honor,
as
we
hell,
have the
but I like
discretion
him.
to make the decision that a Lanigan hearing is appropriate. I didn't have the benefit, but Your Honor certainly had the benefit of a voir dire prior to trial. Your Honor had the benefit of watching the trial testimony. Your Honor had the benefit of appreciating that it wasn't Rule 14 that was complied with prior to that hearing. In fact, a report was provided nearly 2 days ago on December 10th. And that report, if the court has an opportunity to see it, is in conflict in many ways from the testimony of the voir dire, and it's in conflict with testimony at trial. One thing that is constant from the voir dire through the report that we received 2 days ago is that there is an absence of methodology. There is no basis in methodology to support the opinions that have been provided by this witness. And that fundamentally supports a decision that the defense should meet their burden, be compelled to provide a witness so that they can see if they can satisfy the Lanigan document.
Okay.
Your Honor, he delved into the substance. I don't plan on belaboring it, but if I could just be heard.
Sure.
Thank you. Appreciate it. The methodology, and if we're going to go to the testimony, you will, of course, everyone will hear it firsthand, was established the first time. It's pattern recognition. It's well established in the law. And that was what Dr. Russell testified first trial. That's in her report. And as we're to proceed, that's what will happen. That's first. Your Honor, it was a rule, the trigger for the last time was a Rule 14. But Your Honor, in the June 20th transcript, on pages 59 and 62, said, on 59, Your Honor said, you, the Commonwealth, raised Daubert-type concerns. And on page 62, Your Honor said, I have to exercise my role as gatekeeper. So it was clear that it was Daubert. The methodology was established. So I just wanted to respond in that manner for clarity of the record.
Okay. Additionally, after I made the finding that I made, I heard trial testimony. So based on everything, in my discretion, we're having a hearing.
Understood, Your Honor.
There are your findings.
Thank you.
Okay.
Appreciate it.
Okay. All right. So you all set to go?
I am all set to go,
All
Your
right.
Honor.
Go right ahead, Mr. Lessie.
Thank you. Good morning, Dr. Russell.
Good morning.
And you'll keep your voice up. That would be helpful to all. Please state your name, your full name, and spell your last name.
Yes. Marie Russell, Russell.
Now, at a high level, what is your professional background?
I'm an emergency physician.
And is your professional, do you have anything else in terms of your professional background in addition to being an emergency room physician?
Yes, I'm also a trained forensic pathologist.
Your Honor, may I interrupt for 1 second? I'm sorry.
Sure.
Can I have a moment to run with counsel? Thank you for that, Your Honor.
Sure, go right ahead.
How long have you been an emergency room physician?
I've been an emergency department physician since 1987, so that is over 30 years.
How long have you been a forensic pathologist?
I've been a forensic pathologist for about 31 years.
So you've been an emergency room physician and a fellowship trained forensic pathologist, both of those for 30 plus years.
Correct.
Do you have a medical license?
Yes.
When were you first licensed to practice medicine?
In 1988 in California.
And what licenses do you currently hold?
I hold medical licenses in California, New York, Idaho, Massachusetts.
And in California, what are you technically licensed? What is the documentation of the license you had? Your license as a what?
Physician and surgeon in California.
A physician and surgeon, did you say?
Correct.
Your Honors, I'm sure you know, but I want to make sure I get your protocol correctly. We've pre-marked, Mr. Brennan and I have agreed to the exhibits. We've agreed to both the pre-marking and to the admissibility of each exhibit. And I can never either tell you how I understand I'm to go or Your Honor can state it.
So these are in evidence.
Yes.
So use them as if they're in evidence.
Thank you. Appreciate that. May I approach the witness?
Yes.
Thank you. Dr. Russell, I have handed you, which is in evidence as Exhibit 1. Do you recognize Exhibit 1?
Yes, I do,
How do you recognize it?
because I wrote it.
And what is Exhibit 1?
This is my curriculum vitae.
And is that your updated curriculum vitae?
Yes, it is.
It's the most recent one.
Yes.
I now want to get into your educational background with a little bit of sprinkling of experience going into it. Where did you go to college?
I went to college at MIT and Northeastern University.
Approximately when did you attend Massachusetts Institution of Technology?
From 1972 to 1974.
And what did you study at MIT?
I took pre-med courses.
Did you obtain a degree from MIT?
No,
Why not?
because my mother got sick. She developed cancer, and I went back to New York.
And after that experience, did you go back to college?
Yes,
Where did you go?
Northeastern University.
And what years did you attend Northeastern University?
Part-time from 1974 to 1981.
And did you obtain a degree from Northeastern University?
Yes,
And what degree was that?
that was a Bachelor of Science degree with highest honors.
After college, did you go on to receive a Doctor of Medicine?
Yes,
Where?
at the University of Massachusetts in Worcester,
When?
1987.
Now let's go into residencies, internships, and fellowships. Did you complete any residencies?
Yes,
What residencies did you complete?
I completed a residency in emergency medicine, followed by a residency in anatomic pathology.
What is anatomic pathology?
Anatomic pathology is the study. It's a division of pathology. It's a subset of pathology, and it's a division that deals with diseases that can be diagnosed by looking at tissues and bodily fluids.
And what is emergency medicine? Although most all of us have that experience, could you just briefly describe what emergency medicine is?
Well, emergency medicine is the field of medicine that deals with acute injuries and injuries of people.
In terms of the residencies, briefly describe what was involved. What did you do in those residencies? And now let's start out with emergency medicine.
Emergency medicine was a very intense residency. It was a combined internship and residency that lasted for 4 years, and I was at one of the busiest trauma centers in the United States. We would routinely see patients in the emergency room, and some months we rotated outside the emergency room to various subspecialty clinics and areas like the ICU, for instance. In the emergency medicine department, we worked all different shifts. We saw numerous patients because it was a very busy facility, and we saw anything that ranged from gunshot wounds, stab wounds, beatings, down to runny noses.
And where was specifically those residencies? What facility? What is the name of it?
It was at the Los Angeles County USC Medical Center, which people formerly knew as the General Hospital, the 19-story General Hospital from Los Angeles.
And did that have a certain level designation with regard to the type of trauma that would come to those facilities?
Yes, it's a level 1 trauma center, which is the highest level that can be achieved.
And in terms of the residencies, in terms of anatomic pathology, what did you, where was that residency? Which facility?
That was at the same facility.
And how many years was the residency of anatomic pathology?
That was 2 years.
And how many years for emergency medicine?
Combined with the internship, it was 4 years.
Did you complete any fellowships?
Yes.
What fellowships?
I completed a fellowship in forensic pathology.
What is a fellowship compared to, say, an internship and a residency?
Generally, it's a higher level. A fellowship is completed or done, undertaken after someone completes a residency.
What did you do in your fellowship?
Oh, in forensic pathology?
Yes.
Oh, did autopsies. So it was a very organized training program, which included 1 to 2 autopsies a day, mostly 2, and as well as lectures, seminars, interesting case conferences, many things. During that time, I was sent to the FBI for a specific case series. So it was very intense. And in terms of the autopsies, I autopsied cases that were gunshot wounds, stab wounds, many homicides, many homicides. accident victims, car accidents, people hit by cars, people stabbed, child abuse, a wide range. And the goal was to give the fellows the widest range of experiences.
And can you estimate how many autopsies you performed during your fellowship?
Oh, I know for a fact that I performed over 500.
And that was over a 2-year period?
Correct.
So you're performing then an autopsy almost every other day, is that?
Oh, no,
correct?
1 to 2 autopsies a day.
1 to 2 a day.
Yes.
And what at its core are you doing in terms of an autopsy as a forensic pathologist?
You know, the autopsy is just part of what the forensic pathologist does, which is death investigation. So a forensic pathologist looks at a person's, well, just the body is one part of it. The external exam, sometimes, some cases, not all cases, get an autopsy actually that go to the medical examiner's office. But there's a death investigation which involves a detailed external examination plus an examination of the circumstances of how the decedent was found, interviews with police officers and others when appropriate, interviews with their doctors, and examination photos if available.
Earlier in your testimony, you said you have over 30 years of experience as a forensic pathologist. When was the last time you engaged in the practice of medicine pertaining to forensic pathology?
This year.
And have you had a continuous or non-continuous practice in forensic pathology?
Continuous.
And we're going to get to that later on as appropriate. Not as appropriate, we're going to get to it later on. Do you have any affiliations with professional organizations?
Yes.
Can you name them?
Yes, I am a fellow of the American Academy of Forensic Science.
What do you need to do to become a fellow of the American Academy of Forensic Sciences?
Well, you have to be a member for a certain number of years, a minimum number of years. And
Matthew, are
attend
you
a certain
awake?
number of their annual meetings. And it helps if you've given presentations at the annual meetings.
What other professional organizations are you a member of?
I'm also a member of the National Association of Medical Examiners.
Are you a member or a fellow?
I'm actually a fellow.
What do you need to do to be a fellow of the National Association of Medical Examiners?
It's very similar. Be a
Similar
member
to-
for a certain number of years, and they usually ask that you've given at least one presentation.
What other professional organizations are you a member of?
Okay, so I've been a former member of the American Academy of Emergency Physicians, a former fellow, actually. I'm a member of the California Homicide Investigators Association and the California Sexual Assault Investigators Association.
Now let's move to trainings. Do you have any specialized trainings?
Lots of specialized training.
Please name them.
I can't. I have
Well,
too many.
I have specialized training in both emergency medicine related fields and forensic pathology related fields. Would you like me to name both?
Dude, you better, you need to.
Maybe eventually, but
down.
I'm going to try to shorten this a little bit. Give me an example of the type of investigations, apropos to why we're here today, that you would have had specialized trainings for.
Well, I attended a 2-week program in crime scene investigation.
Which is standard.
I've attended and completed programs in forensic photography, bomb investigation, hit and run accident investigation as well.
Dr. Russell, if you need to access your report, do it, but I would prefer that unless you need to, we just have a question and answer. You don't have-
So I can't see whether Dr. Russell's reading from
I'm sorry, you
her.
can't
I
hear me
can't
now.
see. Do you have your CV in front of you?
I do.
All right, so what's typical, counsel, is it will remain closed. If she needs to refer to it, you just ask, and of course,
That's
I'll let her
what I
refer.
understood, yes.
So is that, you have it open in front of you?
It's right here.
Okay, so counsel, why don't you?
I will.
Why don't you leave it there turned over?
Oh, okay.
All right, thank you.
Thank
Well-
you, Your
I
Honor.
can't see from up here whether she was reading or not.
I had that sense, that's why I mentioned it.
I
Thank you.
appreciate it.
Look, when
Do
you
you have
have
any specialized training?
y'all, when you have that much training, it's like, for example, I have 22 FEMA courses under my belt. Anybody know about FEMA courses? Those are hard as hell to do. If you wanted me to list all 22 of them, I could not. Per name. I can group them in
Beyond
what
your
topics
experience
they are.
as emergency room physician or forensic pathology in motor vehicle accident investigation?
Yes.
Describe that, please.
Yes, I took a several-day course here in Massachusetts on hit-and-run accident investigation.
And we're going to get into this a little bit more, but did you also have experience with motor vehicle accident diagnosis and treatment of humans in the emergency room?
Oh, yes, yes.
We'll get into more of that detail. As a forensic pathologist for 30 plus years, did you see decedents and living patients who had been the subject of motor vehicle accidents?
Many.
And in terms of forensic pathology, are patients always deceased, or does the field of forensic pathology also address living persons?
Yes, the field of forensic pathology as a broad field, yes, can deal with living people. Some offices, some government offices will choose to restrict their involvement to deceased people only, but it's a broad field. It does involve living people too.
Now let's move to expert witness experience in courtrooms. You understand what I mean by the terminology expert witness?
Yes.
What jurisdictions have you testified in as an expert witness?
Well, California, Florida, Illinois, Arizona, and the state of Washington.
What topics in that expert testimony did you testify to?
Both emergency medicine and forensic pathology.
So you testified as an expert witness in those cases in both emergency medicine and forensic pathology.
Correct.
And you were qualified as an expert in each one of those categories, correct?
Yes.
Was your opinion ever excluded, your expert witness opinion ever excluded in any of those court cases?
Never.
Let's now move to work experience. What do you currently do for work?
Well, right now, I am reviewing cases, reviewing medical legal cases. I attend conferences, and I've kept up my board certification status.
I'm
It's
retired.
a lot of work to keep up your board certification status.
Understood. In terms of other work, do you do work for any boards in any state?
Yes, the Medical Board of Massachusetts.
And what type of?
Excuse me, Medical Board of California.
Right. And what
So
is your title with respect to the Medical Board of California?
medical consultant.
And describe specifically, you don't have to go into detail, but just describe what it is, the types of things you do for the medical board. And I assume that's in furtherance of practicing medicine. Is that consultancy the practice of medicine in California?
Oh, absolutely. You can't be a medical consultant for the medical board without a medical license. It is the practice of medicine.
Give us some examples of what your practice of medicine is with respect to the Medical Board of California.
For the medical board, I review cases. So the cases are referred to the medical board because of concerns that a physician, a licensed physician in the state of California, is either practicing outside the law or practicing below the standard of care, or a combination of those things. So the cases are referred to the medical board, and I am one of the people that reviews the cases and makes recommendations as to whether there is actually concern.
So going back to my clinical pharmacy days, I believe I understand the standard of care parlance, but we have maybe some different parlance in the medical field. Is standard of care and whether a physician's met it also known as physician negligence?
Yes, if they don't meet the standard of care, it's
Yes.
considered physician negligence, yes.
Describe your role in cases briefly of your expert witness to topics in forensic medical investigations.
The topics actually range from homicide. I've been involved with several homicide cases. Homicide, often stab wounds, blunt force trauma, child abuse are the topics. And domestic violence is also another frequent topic.
Prior to your current role that you've just described as an expert witness and a medical consultant for the Medical Board of California, I want to go back just a little bit to the expert witness. Are you able to state whether you have testified previously mostly for prosecution or defense? Do you have a sense as to where the majority of your testimony has been on whose behalf?
Well, it's been mixed. There's been a lot of prosecution cases.
So you've testified as an expert witness many times in support of the prosecution.
Yes.
And has your testimony in support of the prosecution been only as a physician, or was there times when you, before you became a physician, that you were testifying on behalf of the prosecution, say when you were a police officer?
Yes.
And roughly, how many cases, we're going to get more into your police officer experience, but how many roughly cases do you recall testifying on behalf of the prosecution?
They're trying to
as a
get her
police
out.
officer?
The prosecution does not want her.
25 to 30.
They're going to try and
Now
tear
let's
her
go
up.
to just prior to your immediate role. Before
I'm
being a
anxious to
medical
hear the
consultant for
the
Medical Board
prosecution's
of California, where did you work?
Immediately before I worked at the state of California prison system. It's called the the Corrections Department in the state of California. And I was the chief medical executive for one of the major prisons.
What years approximately did you serve in that role as chief medical executive of the California State Prison?
Sorry if I'm being quiet. I'm really listening.
From 2018 to 2018 to 2023.
What was your role? What did you do?
Oh, well, the chief medical executive is in charge of the whole medical department. And so in that role, I had a lot of duties, including supervising the medical care of all of the patients, the inmates, conducting various.
I got to stop and say this, guys. Okay. I will say this. I do have some knowledge in medical field personnel. And I will tell you, this woman is the freaking bomb. Emergency medicine in a major city. She's seen a lot of dog bites. She has been a coroner. She's done it all. She's done it all. So for them to exclude her would brutally harm their case. She is, I'm like, yes, ma'am.
Committees. I chaired many committees, process improvement, pharmacy therapeutics, death committee. I investigated every single death that occurred at the prison, during that time period.
Let's stop there if we could, please.
Yes.
And
Her case
talk
would be
about
over.
from 2018 to
It'd be really
2020
hard.
is what I heard you say was your time period. Describe what was a death review at Corcoran
Well,
that you performed.
yes. The death review at Corcoran was quite extensive. And so what would happen, well, first of all, let me give you background. Background is that the patients die from a variety of causes in prison system, including suicide, homicide, natural death, overdoses.
And where
wide
are you
variety
at,
of
my
reasons
dear?
People die. So my job was to investigate those deaths. And
Judge Bev.
the way I did that was when these inmates or patients were taken to the emergency area, when they were found unresponsive, taken to the emergency area, if I was there, in the building, that's where my office was, I would go and personally examine these patients from head to toe.
In that personal examination from head to toe, did you ever experience any patients with wounds?
Yes.
Describe some of the wounds.
A lot of
that
wounds,
you
my dears.
experienced that were the subject of your
Oh,
death
gosh.
review.
10 of wounds, I'm sure.
Well, there were a variety of wounds, and some of the most common ones were stab wounds or blunt force trauma wounds, contusions, and or commonly known as bruises. But if it was, for instance, a hanging patient, I would look at the wounds around the neck to see if the ligature mark was horizontal or had a vertical component, because that could differentiate the manner of death or the mode of death.
Trying to do something, y'all.
You have to ever in this process have to determine whether a wound.
I'm here. I got to fix
well,
something.
well, let me back up. Are you familiar with the term defensive wound?
Yes.
What does that term mean in the field of medicine?
Well, typically, what that means is that the victim of an assault attempted to defend themselves during the assault. And one of the common ways they do that is they bring up their arms to protect their face, neck, chest area, head area from the assault. So defensive wounds are commonly seen in the arm, the forearm, the posterior portion of the forearm, or the hands also.
Did you ever have to determine whether a wound was defensive when either the patient was unresponsive or the patient was deceased?
Many times.
Is it many times for both, or is it many times for one of those two?
Well, definitely when the patient was deceased.
So let's stop there. I'm sorry to interrupt you. Let's start. So many times, do you have an approximate number of how many times just at your 5 years at Corcoran you determined whether a wound was a defensive wound on a deceased patient, approximately?
Not very many.
Okay.
Counsel, could we get an answer as to how many death reviews total were done while?
Yes, Your Honor. I will ask that question right now. How many death reviews did you perform? And if you want to do it based upon per year, average month, whatever gives the court the best, most accurate answer.
Okay. Well, on average, we had one death per month. So some of those occurred at nighttime, but I reviewed all the cases, but he didn't personally examine every single case.
Right.
Over 35 got a very intensive exam.
So if I did my math correctly, it's 60, right? It's 12 times 5. You were there 5 years?
For death reviews.
For death
yes.
reviews, and that was the court's question.
Yes.
Right. Was there anybody else at Corcoran doing death reviews?
There was a committee that I formed to review deaths. It didn't exist when I first got there, but it did get formed later on.
Were there any other physicians on the committee that, so you were the only physician on the committee in Corcoran that was performing the death reviews or not?
No, I misspoke. There was one other physician, the person who was my assistant, who also needed to be involved in those death reviews in case I wasn't around.
Did you ever need to consult
I know.
with any medical examiner's office in connection with your death reviews at Corcoran?
I frequently consulted with the local Kings County Medical Examiner's Office.
Describe examples of that consultation and interaction.
Okay, so I would conduct my initial part of the review, and I would call, on some cases, not every single case, but on some cases, call the Kings County Medical Examiner's Office and speak to them to alert them to certain findings or certain things that I wanted them to specifically look for in their examination.
Did that consultation include any consultation regarding wounds and the source and nature of the wounds?
I don't recall.
Now let's go to your emergency medicine physician experience at LA.
This is what I want to hear.
Plus USC. Do you have a shorthand that you'd like to use so I don't have to say that every time?
I don't.
All right. So I'll just say LAUSC. Would that be something that would work?
I say LAC-USC.
I'll say LAC-USC also. So what years were you an emergency medicine physician at LAC-USC?
I was there as an emergency intern, resident, and physician from 1987 to 2016.
So if, again, I did my math right, it's about 29 years.
Yes.
And you've described previously that that facility was a level 1 trauma center, correct?
Yes, it was.
What is a level 1 trauma center?
A level 1 trauma center is the highest level that the trauma center could be. So it means it has in-house neurosurgeon, in-house orthopedic surgeon, an active research program, and obviously in-house trauma surgeons.
What did you do as an emergency medicine physician at that facility from 1987 to 2016? I'm sure it's a lot, but if you could give some representative examples.
Well, we staffed both the major and minor areas of the emergency department where the patients were brought into. So any patient that was brought in with major trauma or, even non-trauma, medical condition, heart attack or stroke would be brought into the emergency department, and we would provide the initial examination, screening, resuscitation, whatever was needed. And then if the patient needed to go to the operating room, we would call the surgeons. And, if they needed to go to the ICU, we would stabilize them and send them to the ICU.
In addition to diagnosing and treating that we've all experienced with the unfortunate, with all respect, having to go to the emergency medicine department, did you engage in any surgery in the emergency medicine department? And if you could describe what you mean if the answer is yes.
Yes.
Describe what it is that you did that constituted surgery at the emergency medicine department from 1987 to 2016. We're going to get into more specifics apropos to the issue at case here, but just looking for what, when we say that you did surgery, want to give an idea of what that is.
Okay, so we did what is considered minor surgery. We sewed up, we debrided and sewed up lacerations, repaired lacerations. We incised certain infected wounds and cut them open.
Dog
Is
bites?
that what you mean?
Yes, thank you.
Animal bites?
Now moving, and we're going to come back to some of that, but now
Animal
moving
bites?
on to the
Get
next
the animal bite in
position,
there, woman. That's
that
why you're here.
you had at
Part of
the LAC-USC Jail Medical Services. Can you describe what the name of that position was?
Yes, I was jail medical director.
And approximately what time period were you jail medical director at LAC USC?
God, this woman has a resume a
before I
mile long.
Answer that.
I'm
I'd like to say
impressed, my
that
dear.
in addition, so we generally had a clinical role and an administrative role. So there were several things going on at the same time. In terms of jail medical director as the administrative role, I was doing that from 2003 to 2014.
And can you describe the in-custody unit that was there that you provided this role that you just described?
Yes, we had an unusual situation where we had, in addition to the regular major emergency department, we also had a specially dedicated emergency, combination of emergency, inpatient, and outpatient area for patients that were incarcerated. So the patients would be brought directly up to the jail emergency department for their injuries if they were hemodynamically stable. What I mean by that is if their blood pressure and pulse were stable, they'd be brought directly up to the emergency department.
And what type of agencies would bring those types of patients to that department?
So the Los Angeles Sheriff's Department, Los Angeles Police Department, the California Highway Patrol, local area, any of the local police departments in LA County were eligible to bring their patients there.
And briefly describe the volume of patients that would be brought into that department.
It was very busy. Just the emergency department alone was 20 to 30 patients a day, just for the jail emergency department. And then the inpatient area depended on the year, because it was about 40 patients, inpatients, and over the years that decreased a little bit.
Did you ever have a role with regard to emergency medicine quality improvement at LAC USC?
Yes, I was chairman of the committee for a period of time.
And do you remember approximately when that was?
I'd have to refer to the CV, sorry.
Would around 2000 to 2003 be approximately an accurate time?
Yes.
What did you do as the director of emergency medicine quality improvement?
So for that role, I was in charge of quality improvement projects and how they were progressing, during the interim, as well as I investigated all the deaths in the main emergency department and the jail emergency department.
Now, the title has in it quality improvement.
Yes.
Am I correct that in order to be a director of quality improvement, you have to understand well the underlying practice to understand what needs to be improved?
Yes.
And did you believe that you had that high level of understanding?
Yes.
And did you exercise that high level of understanding in that role?
Yes.
Now, before that, did you have any experience with life support training at LAC USC?
Yes, I was the director of the Life Support Training Center.
And was that also around late 1990s, 2000 time period?
Yes.
And what was your role? What did you do as director of Center for Life Support and Training at LAC USC?
So we provided all of the life support courses that were taught at the institution, including advanced cardiac life support, advanced trauma life support, which was taught to the surgeons and emergency physicians, and pediatric life support.
Now we're going to switch gears a little bit. Have you ever been an adjunct professor?
Yes.
When and where?
From, I believe the dates were 1998 to 2003 at the California State University at Los Angeles.
And what did you teach at Cal State Los Angeles?
I taught a graduate level course called Legal Medicine, which was part of their master's degree program.
And that's a graduate program, correct?
Yes.
And
What, Dr. Bullbutter?
what were
You're
the
out?
students in the grad program
Why are you
there
out?
for? Was there a certain title that they were referred to as?
Yes, it was a graduate program in criminalistics, and so many of them were crime lab employees or headed
Good
to work at a
morning.
crime lab.
And just briefly, can you give just examples of some of the topics you taught to those that were in this criminalistics program?
Yes, so I was teaching the medical course, and so I had to teach a wide range of topics about forensic medicine to these people who would be going to crime scenes and seeing deceased bodies, etc. So my topics included things like time of death, blunt force trauma.
Dr. B, go to Discord. I have a question.
Burns, wounds. I did teach about wounds and including, so a wide variety of wounds.
Let's focus in on wounds. Okay. Describe in some detail
If you hear me, Dr. Bullbutter, I have a question for you in Discord.
analysis
Please.
and treatment you taught as an adjunct professor at Cal State Los Angeles.
Well, there was no treatment taught to those students, as opposed to the emergency students, emergency medicine doctors. But the types of wounds that I talked about in the legal medicine course included, again, sharp force, blunt force, thermal. I talked about bite wounds in terms of identifying bite wounds on a deceased body. I talked about wounds that people would see in child abuse, domestic violence, elder abuse.
And in your teaching, let's break that down. In your teaching of dog, is it fair to say dog inflicted human wounds? Is that a fair term? Or would
Well,
you,
I
or would you use?
mostly bite wounds in general.
Bite wounds, was that bite wounds from a specific animal or general animals?
No, mostly human. I talked about mostly human bite wounds.
Okay.
With a reference to animal wounds.
And what was the reference to animal wounds?
Just how they can be differentiated from human bite wounds.
So you taught human bite wounds, but you also taught how to differentiate human bite wounds from dog bite wounds on humans.
Yes.
So let the witness answer that. So ask it in a non-leading way, please.
Thank you, Your Honor.
He's so polite.
Describe what you taught the students on the topic of human wounds and dog bite wounds.
Okay. I taught the students to recognize human bite wounds. So I had pictures, images, and slides on human bite wounds, why they would be important, the forensic value of
Versus
wounds.
dog.
I mentioned how they may differ from other bite wounds, such as dog bite wounds. In the emergency department, the focus was a little different.
That's what I wanted to go to next. So describe, well, first, in your many years in the emergency department, and we're going to get to this in more detail. So why don't we just save it until the next category we get to? We'll come back to that. Before you were an adjunct professor at Cal State Los Angeles, and before you were a medical doctor, what did you do for work?
I was a police officer full-time.
And approximately when were you a full-time police officer?
From 1977 to 1984 in Massachusetts.
When you started on the police force in Malden, how many women were on the police force?
Before I started, none.
You go,
So
girl.
You were the first woman on the police force in Malden.
Correct.
Did you go to academy?
Yes.
Did you graduate successfully from the academy?
From the Boston Police Academy, yes.
Before that, did you have any other work experience?
Yes, I worked in an emergency room, actually.
Right, but in terms of from the time period, as I understand it, in Malden, you, if I heard correctly, you said approximately 1997 to 1984 for?
77.
I'm sorry, 77, right. So is it, before that, did you have any other job in the community in Malden?
Well, in the period 1974 to 1977, during that period of time, I worked in the emergency department. I was an EMT and I was an auxiliary police officer.
Let's talk about the EMT experience. What did you do as an EMT?
Yes, shall we?
I did volunteer work in an ambulance.
And just, again, most of us know what an EMT does, but just for the record, just briefly, what did you do as an EMT?
Generally rendered first aid to calls for emergency service.
Now let's go into the category of your medical training and experience specifically pointed at a certain topic. With regard to wounds, do you have
Excuse
any
me.
experience with dog-inflicted wounds on humans?
Much experience.
Let's start and do this chronologically. What professional experience have you had with, we'll call them dog bite, what would you like to call them, dog bites or dog bite wounds? What's your parlance?
Dog bite wounds.
So what's your professional experience going chronologically with dog bite wounds? Your first.
Well, my first experience I recall was during that period of 1975 to 1977 when I attended a training session where I witnessed the training of guard dogs. The training was conducted by some people I know, and I was invited to this professional session. And during that session, even though the simulated criminals were wearing specially designed sleeves on their arms, one of the participants was accidentally bitten by one of the dogs.
And when you say accidentally bitten, what do you mean accidentally? Did the dog have a full bite grip or less than a full bite grip?
You know, I can't really say because I don't remember if I actually saw that bite, but the dogs were being taught how to aggressively bite and hold on to the simulated criminals. And apparently this one bite went out of, the range of where the sleeve ended.
And this was back in the 1970s?
Mid-70s, yes.
Did you provide any care for the wound of the person that was subjected to that dog injury?
Yes.
Yes, I was an EMT, so I provided basic first aid and transported that person to local emergency room.
So you provided treatment on the spot, and then you participated in the transport to the ER?
Yes.
And did you get an opportunity at that point to observe the wound that was caused by this dog bite?
Very closely.
And because you treated it, correct?
Correct.
Let's now move to the LACUSC Jail Emergency Department. And I recall you testify that was approximately 1987 to 1995. Do I have that right?
That was part, yeah, that was the intense part that where we saw a lot of, law enforcement dog bites.
What, did you see any dog bite wounds in that jail emergency department?
Many.
When you say many, can you give, not how much you treated, but just how many of those dog-induced wounds that you observed?
I would say about 60 to 70 cases that I personally observed. There could have been a lot more.
Now, what type of dogs? Well, let me strike that. As part of that treatment, did you learn what type of dog inflicted the wound?
Well, these were trained law enforcement dogs.
So these were canine dogs, right?
Yes.
And
Canine.
is
What?
canine bites an appropriate term to describe them?
Yes.
Canine dog. What does canine mean? You meant police dog.
And how many of these individuals at LAUSC Jail Emergency Department did you personally treat with these canine-induced dog wounds?
Personally, about 40.
And you're saying personally, did you have any other experience in addition to those 40 that was not personal treatment with dog wounds?
Yes, so we worked.
Describe what those additional roles were.
We worked as a team, and so sometimes one intern or one resident would get the case, and another time the other person on the team would get the case. So, but we worked as a team. We saw all the wounds together as a team, and so that's why it's hard to give a hard number.
What was your role as a member of that team when you were not personally treating the wound? What was your role? What did you do?
I would assist. I would see other patients, but we all rounded on all the cases.
What do you mean by rounding?
Rounding is this medical phenomenon where the team of doctors and sometimes other healthcare professionals go from bed to bed and discuss each case.
So you went, in addition to the 40, you went as a member of the team from bed to bed to bed. And in addition to those 40 of dog-inflicted wounds, you saw additional dog-inflicted wounds, correct?
Yes.
Describe the level of bites that you would observe both as personally treating and as a member of the team.
Well, these bites were unlike anything I'd seen before. They were very extensive dog bites with a lot of tissue damage. And there were areas on the patients where the dog would attempt more than one bite. And sometimes there were, completed bites, and sometimes there were what I called partial bites, where there were just some scratches, abrasions, superficial wounds. But so it was quite a different thing than I had read about in textbooks.
What do you mean by partial bites?
Well, a partial bite would be where the dog did not get a full grip on the victim and therefore did not penetrate the skin. The teeth actually slide around along the surface of the skin in the attempt to get a grip.
Could you make that determination, that partial grip, as you've described it, from looking at the wound?
Yes.
And how, in this specific experience at the USC jail, did you determine, generally, that the dog had made a partial grip on whatever was the body part that was the subject of the wound?
Well, oftentimes because they were accompanied by completed dog bites that had full penetration, puncture wounds, and tearing.
Right. And so did you make the observation of the wound? In other words, you saw it and then reached a medical conclusion about whether it was partial or complete?
Yes.
And approximately how many times did you look at the wound and make a medical determination with regard to whether it was a partial or a complete grip by the dog?
I don't really know because we focused in on the most dangerous of the wounds, the ones that had the large gaping lacerations and that needed the medical attention.
So the predominance was the typical canine bite, but then there were also a less number with the incomplete bite, correct?
Yes.
Does an incomplete bite have any, what you observed, have any relationship to a civilian dog bite?
I'm not sure I understand the question.
It wasn't a great question. So
Welcome.
let's go
Welcome.
to,
Thanks for joining.
does a canine bite ever present as a regular community dog bite in terms of the wound?
Ever?
Yes.
A trained canine bite?
Yes.
I haven't seen it.
Was the dog, when they got this dog, please tell me, I can't remember, was it a dog that washed out of police dog training? I don't know where I heard that, but tell me if I'm right or wrong. Because if it was a police dog training washout, that could mean something here.
So in
Could have heard that
incomplete
somewhere.
canine bite, correct, is more tethered to a canine. I'll rephrase. Describe how you would compare an incomplete canine dog bite to a civilian dog bite.
Well, that's difficult. And again, I'm not sure I understand the question.
Okay, well, let's just conclude this way. So the predominance at the LAUSC Jail Emergency Department was canine dog bites. Let me rephrase it. We'll in terms of LAUSC Jail Emergency Department, what was the predominant type of dog inflicted wound that you observed and treated?
The regular emergency department?
Yes.
Not jail. The predominant was civilian dog bites.
Now let's move to the emergency department at LAUSC and specifically your role as an emergency department physician. And as I understand it, you've testified that was between 1987 and about 2016 as an intern resident and physician. Is that your testimony?
And yes.
Now, did you treat and assess dog bites or dog wounds in that capacity in the emergency department of LACUSC?
In the main emergency department, yes.
In the main emergency department. And did you also treat, beyond dog-induced wounds, general animal-induced wounds that were not from a dog?
Yes.
Describe some of the animal wounds, non-dog animal wounds that you would observe and treat in the regular emergency department.
Well, the most common one was the cat. But beyond that, we would see wounds from skunks, rats, raccoons. I recall seeing an opossum wound one time, of course, snake bites and, various other animals.
Approximately how many dog bite wounds did you observe and treat in the emergency department at LACUSC?
So the main emergency department?
Yes.
Well, over the course of all those years, at least 500.
How do you come up with the number 500?
Well, it was an estimate based on seeing, based on the number of years I worked, plus the number of weeks in a year, plus the number of dog bites that I saw per week. And that's how I came up with that number. And I underestimated.
Describe what you did, just briefly, with regard to the wounds. What type of practice of medicine, what did you do specifically with the wounds?
So when a patient came in with a wound.
And I'm talking dog bite wounds.
Okay, well, first I had to figure out if it was a dog bite, because some patients couldn't tell us what kind of animal bit them. Most of the time they could, but some couldn't. Some were young, some, there were various reasons. There was sometimes language barriers. So I had to figure out what a type of animal inflicted the wound. And there was a very important clinical reason for that.
We're going to get to that.
Okay.
So I think you testified earlier about specifically what you did with the wound. What did you do specifically with the dog, these 500, approximately more than 500 dog inflicted wounds? What did you do specifically, so to speak, with your hands?
Okay. Well, I was clearly interested in wounds, and particularly bite wounds. I was very interested in this. So it got my attention all the time. And so what I first do, I had to do differential diagnosis, but physically, if I determined it was a dog bite wound, then I'd render the appropriate treatment. Sometimes there was perforation of the skin and lacerations, and those lacerations sometimes needed debridement, which is cutting away from the edges and the dead tissue, any devitalized tissue, and some were large enough that they actually needed suturing. Many of them needed antibiotics prescribed.
In terms of the facility, I think you've testified that it was a level 1 trauma center?
Yes.
Did the fact that it was a level 1 trauma center have any effect on the number of dog bite wounds you would see?
I don't know the exact effect, but we did get referrals in.
And does the fact that it was a level trauma 1 center mean your estimate was conservative or liberal?
Oh, my estimate was conservative.
Meaning conservative, you say 500, but describe what you mean by conservative.
Conservative means.
Or does it go down?
Oh, I probably saw a lot more than 500.
Does that estimate include the number of dog inflicted wounds that you supervised?
No.
So in addition to the 500 plus, you also supervised. Describe what the nature of the supervision was with respect to dog inflicted wounds.
Well, as an attending physician at a university medical center, of course, I supervised interns, other residents, medical students, PAs, and nurse practitioners. And so frequently had, 3 to 5 people working with me that I had to supervise. So I would see I saw any case that they saw. Any patient that they saw, I would supervise. And when there were wounds, I would look at the wounds personally myself.
How many trainees did you typically supervise per shift?
Typically 3 to 5.
So in addition to the 500 plus, you were supervising 3 to 5 trainees per shift who also were treating dog inflicted wounds?
Yes.
And can you give an approximate number of dog inflicted wounds, just approximate, that those trainees would be experiencing in their role?
It's so hard to give an estimate. But with all those trainees and all those weeks and years, I would say at least another 500.
Have you ever participated, now we're going to switch gears to when you described you were a forensic pathologist in OR. Did you ever have experience with an autopsy which regarded a canine attack.
Yes, unfortunately.
When?
It was in 1995.
And where?
It was in Los Angeles.
And where specifically, which department in Los Angeles?
Oh, when I was at the coroner's office, I was assigned an autopsy.
So this was at the medical examiner's office.
That's correct, medical examiner now.
And what was the subject of the autopsy? Who was the subject?
It was a young boy, I don't remember the exact age, and he was killed by 3 dogs when he entered into a fenced area.
Were they canine dogs or civilian dogs?
I don't know the exact training, but I was led to believe that they were not law enforcement canine dogs.
So you were led to believe there were
Yeah.
civilian dogs?
Yeah.
Not, they just weren't canine dogs.
They weren't, as far as I know, they were not trained canine dogs. They were civilian dogs.
Did you observe any wound patterns as part of that autopsy?
Yes,
Describe the wound patterns that you observed.
I'll never forget them. There were many deep lacerations, avulsions. There was a wide range of wounds, and amongst them there were patterns of abrasions, multiple parallel abrasions.
Were there any other types of marks from the part of the dog that you observed?
Oh, there were puncture wounds.
Any other types of wounds? Any other part of the dog?
Well, I believe that there were some claw marks. They also would look like superficial abrasions.
And were there any bite marks?
Oh, yes.
How many? Approximately.
I don't know.
More
There
than
were-
one.
Oh, many.
Many. Now let's move to studies and publications. Have you ever performed a study of canine dog bite injuries?
Yes.
Describe it.
Yes. My colleagues and I performed a study of over 700 canine dog bites that presented to the jail emergency department over a 10-year period.
When approximately was this study?
In the in the 1990s.
Did that study result in any publications?
Yes, 2.
Were those 2 publications peer reviewed?
Yes.
What does peer review mean?
That means that a group of physicians from the same specialty have read the article, analyzed the methodology, and determined that this was a valid study.
Have you, in addition to that study that was supposed to be peer reviewed, have you ever edited any publications?
Yes.
Describe the publications that you edited.
I edited a 2-volume publication called Topics of Emergency Medicine, Forensic Emergency Medicine.
And were there any chapters in that regarding human bite wounds?
Yes.
Describe briefly what the chapter was about.
Yes, the chapter was written by Dr. Gerald Vale, who was a pioneer, and one of his colleagues, Dr. Anselmo.
Ah! No!
In terms of the publication after editing, was the publication peer reviewed?
Yes.
And were you part of that peer review process?
Sorry, guys.
No, because I was the editor.
Correct. So you were the editor, and then after your editing, it went on for peer review?
Yes.
And then did it sort of pass, so to speak, the peer review?
Yes.
And then it became published?
Yes.
Let's now move on to the topic of publications, seminars, talks, lectures. How many peer-reviewed, well, let me start this way. Have you read any peer-reviewed published articles on dog-inflicted wounds?
Yes.
Can you describe how many?
Loop and scoop, you mean?
Oh, at least
Loop and Scoop
20.
or Scoop and Loop?
Have you ever
heard
attended
that.
any seminars regarding wound identification and bite wounds?
Yes.
How many approximately? Or if you can't recall, describe some of the seminars.
I don't know the exact number of seminars. However, I would frequently attend them at the coroner's office, Los Angeles coroner's office, and at the American Academy of Forensic Sciences annual meeting.
And some people have varying reviews about what happens in a seminar. What happened at these seminars that you attended?
These are high-level seminars, very intense. And I was one of the few medical physicians that would actually attend the odontology seminars because it was a special interest of mine.
And what were some of the topics at these seminars that were discussed on odontology? Sorry, first let's talk about what is odontology?
I think it's the study of human dentition or dentition in general, I believe. I don't know.
And so it can be, it's the study of, back to the seminars. Describe what occurred at these seminars.
Yes, at the LA coroner's office, there would be a lecture every year about, I should say about every year, regarding forensic odontology and bite wounds, bite wounds on humans. At the American Academy of Forensic Science, those were very interesting seminars in which the specific cases were discussed by the board certified forensic odontologists, and principles of bite marks identification was discussed.
Did those seminars involve the topic of dog-inflicted wounds?
Not primarily.
Was there any discussion of dog-inflicted wounds at those seminars?
At some of the seminars, if dog-inflicted wounds were discussed, it was just in means of distinguishing, a human bite versus a dog bite.
You've mentioned Dr. Vale's name a couple of times. Did you ever work in any capacity with Dr. Vale?
Yes, he was the forensic odontologist for the Los Angeles County Coroner's Medical Examiner's Office.
Did you ever consult with or for him?
Yes.
Describe that.
Well, he had a case where there was, it was a dog bite case, and I don't know a lot of the details, but he called me up and wanted to discuss the case and specifically some features of dog bites and treatment.
And was he looking for information from you, or was he just reporting to you his views?
No, he was looking for information.
And what type of information did you provide generally?
I can't really say.
But it
so
was
long
the
ago.
topic. Again, the topic was
dog bites.
Yep. Let's now move on to a different topic. Do you have experience providing treatment to individuals involved in motor vehicle accidents?
Many, many hundreds.
Describe the many, many hundreds of experiences you have involving motor vehicle accidents.
Well, it's difficult because there were so many. I worked at a level 1 trauma center, which was right next to some major roads and major freeways. So vehicle accidents were very commonplace. But the victims would range from mildly injured to comatose and dead. A wide range, a lot of injuries, bodily injuries, head injuries, wide range of injuries. And that's pretty much it. I know what I was going to say. Some of those victims were actually hit by a car. They weren't just motor vehicle collisions. They were actually struck by a car.
That's what I wanted to get to. So before we get to the specific of which you just mentioned, struck by a car, you've described today a variety of your roles from an EMT, police officer, etc. For each one, could you just tell whether or not getting into details, whether or not you observed and treated a human involved in a motor vehicle accident?
As an EMT, yes, I did. As an emergency physician, yes, I did. As a forensic pathologist, no, I didn't treat anybody, but I certainly examined them and took very detailed notes and made some assessments.
So as a forensic pathologist, because I'm assuming, well, as a forensic pathologist, describe a little bit more about what you mean.
Well, as a forensic, I should have clarified a little bit better. As a forensic pathologist in the coroner's office, all of those victims were deceased. However, in my role as a consultant forensic pathologist, I would consult on cases for the courts, for various parties in the courts on motor vehicle injured patients.
Now let's go to the emergency room. Can you approximate how many patients involved in a motor vehicle accident that you treated?
I can't. There was so many.
Is it in the
Hundreds or
tens?
thousands?
I'm sorry, repeat that, please.
I'm sorry, hundreds or to thousands.
And how do you come to that estimate?
I just again, if on a very conservative way, if I just very conservatively said I worked 1,000 weeks during my career, even if I saw one motor vehicle accident patients per week, I'm at 1,000. But certainly I saw a lot more than that.
In a big city, you're seeing at least 2 or 3 or more
Let's
a
move on to
day.
the topic of wound patterns. How do you assess the source of wounds generally?
Well, I look at the skin and I try to recognize if there is a pattern that I've seen before, a pattern that I am familiar with. And sometimes in the past, I had to compare a pattern to an object, for instance. But yes, wound recognition and pattern recognition are very major interests of mine.
Is wound pattern recognition a topic that is taught in medical school?
In residency, for sure.
Yes.
And what is taught in residency about wound pattern recognition generally?
Well, in emergency medicine residency, it's taught to recognize patterns and locations of wounds because the physician has to be able to recognize things like child abuse and elder abuse and domestic violence, which oftentimes are associated with specific patterns of injuries.
Is wound pattern recognition considered a standard of care? You used that term earlier today in the medical profession, in the emergency department. Is that something is wound pattern recognition an area that an emergency room physician is trained in?
Yes.
And how frequently, in your experience as an emergency room physician, do you exercise pattern wound recognition?
I can't tell.
Is it frequent or infrequent?
Oh, frequent.
Why is assessing the source of bite wounds? Well, let me go backwards. Is assessing bite wounds important in the practice of medicine in the emergency department?
Is assessing the source of bite wounds?
Is it important?
Yes, it is very.
Why?
Well, because different types of bite wounds are treated differently.
Does the assessment affect the care and treatment that the patient is going to receive?
Yes.
How?
Okay. Well, certain bite wounds are prone to certain infections. So dog wounds are prone to certain infections, cat wounds, various other animals that inflict wounds cause infections. And the infections can differ from the inflicting animal. Additionally, so there are bacterial infections. There are also viral infections such as rabies. So for instance, some types of wounds, wounds from some type of animals will require a series of rabies shots because those animals are known to harbor rabies. So it's very important to try to figure out what the source of the wound is so you can determine, does the person just need some antibiotics and a tetanus shot, or do they need a series of rabies shots?
Are there circumstances in which you've had to identify the source of wounds without input from the patient?
Yes.
Describe those.
Well, there may be a language barrier, or sometimes with a child will have a bite, but we don't know what bit the child. So yes.
Are there any other circumstances, any other categories that you have to determine the source of the wound, say where you might have a legal responsibility to make a judgment on the source of the wound?
I'm not sure I understand the question.
In terms of circumstances where you have to determine the source of the wound, are there any other examples where you've determined the source of the wound, sort of categories of people, certain types of victims that you've seen and had to make an assessment?
Are you talking about bite wounds?
No, just a wound in general.
Well, yeah, so
wound pattern is the topic. So
yes.
With regard to wound patterns.
Okay. Well, yes. So it's important for an emergency physician, for instance, to recognize patterns because sometimes the victims themselves will attempt to mislead the doctor. For instance, it's not uncommon for parents or I should say caretakers or domestic violence victims to give a different story in the emergency department than the true story of how an injury was sustained. And I'm a mandated reporter. Emergency physicians are mandated reporters. So we have to be on the lookout for certain injury patterns.
Are you familiar with the term posterior surface?
Yes.
And specifically with regard to a limb, upper body limb and arm, what is the posterior surface?
So the posterior surface is the back of the individual. And
hold up your arm and demonstrate what you mean when
yes.
you say posterior.
But first, let me just explain that the anatomic labels are given to the human body, or have been given in the past to the human body, in reference to what they call the standard anatomical position, which is with a person standing upright and their arms down at their side. So anything in the front is called anterior, anything in the back is called posterior, which means that the posterior of the arm is actually here. Because even though it doesn't look like it might be a posterior to somebody, it's actually anatomically the posterior of the arm. So it's this surface right here. And so that's what is meant by the posterior of the arm.
What can, and have you observed wounds on the posterior surface of an arm in your career?
Oh, that's highly indicative of defense wounds.
What do you mean it's highly indicative of defense wounds?
Well, we're taught in both emergency medicine and forensic pathology that if there are wounds to that area of the arm, it may be because the person or victim sustaining the injuries was trying to protect themselves. And so they brought the arm up to protect their face, their head, their neck, chest area. So the wounds to this area, the posterior of the arm, are often defensive wounds.
What is your experience with defensive wounds to the posterior location of the arm?
I have a lot of experience with them.
Describe that.
Well, both, again, in the emergency department, saw many victims, many patients, I should say, that had wounds to that area of the arm. And of course, in the medical examiner's office, again, so many victims that had wounds to that posterior surface of the arm.
Did you, as part of that examination for the posterior surface of the arm, ever determine the wound was from a stab wound?
Yes.
How many times roughly?
10, roughly.
Did you ever in your career determine that a posterior wound was sourced by a dog bite or dog claw wound?
Not that I labeled in the medical chart as such.
In your analysis, in your experience in the emergency room and in the jail with canine wounds, did you reach a conclusion with regard to whether a wound on the posterior surface of an arm was a defensive wound as you have defined it today?
In the emergency department, it didn't really matter if an animal bite was on the posterior surface of the arm, because in the emergency department we focused in on treatment. It did matter in cases of, like I said, domestic violence or child abuse, because those were assaults. But other than that, the wounds were treated as if they were on the front of the arm. No difference.
How about in the canine dog bite wound experience? Did you ever conclude that a wound from a canine bite or any kind of dog bite was a defensive wound?
Yes, some of them were, but again, it didn't matter in terms of the treatment. So, so that determination wasn't really important.
So you made a determination that they were, well, put it this way. Did you make any kind of an assessment, whether it affected treatment or not, that the wound was a defensive wound with regard to a dog bite?
Yes.
Now let's go on to characteristics of dog bites and scratch wounds. Do you know approximately how many dog bite wounds present to the emergency room in the United States on an annual basis?
Yes, it's
ton.
over 300,000 estimated.
And how do you know that estimate?
From the medical literature.
And is that medical literature you have read and are aware of?
Yes.
Which medical specialty, do you know what I mean by medical specialty?
Yes.
Which medical specialty sees the most dog bite inflicted wounds?
Well, I believe it's the emergency physician because we're the gatekeepers, so to speak.
Do you have a conclusion whether emergency room physicians have more exposure to and familiarity with dog bites than other specialists?
Ask it differently.
Thank you. Do ER physicians have more exposure to and familiarity with dog bites than others?
Yeah, sustain for the same reason, but I'll give you a minute to think about how to ask it.
Thank you. Which medical specialty has the most exposure? Well, let me conclude it this way. In terms of the presentation of dog bite wounds in the emergency room, are emergency room physicians trained to recognize and treat dog-inflicted wounds on humans?
Yes, it's a common presentation in the emergency department.
Describe the difference between, well, do you know the difference between a civilian dog bite and a canine dog bite?
I believe I do.
Describe it.
He's using a canine as a police dog.
Well, the canine dog bites inflicted by trained canine dogs tend to be quite devastating. Puncture wounds with tearing lacerations, very big wounds causing injury to muscle, connective tissue underneath, even blood vessels at times. They oftentimes require admission to the hospital and extensive intravenous antibiotics. As opposed to the canine, the civilian, what I call the civilian dog bites, which typically are just scratches or, I shouldn't say scratches, abrasions.
I think he's trying to say is a trained canine versus a non-trained canine. I think he's using canine in the terms of police dog. Because you see canine on the back of their trucks, I guess. I don't know.
Or small puncture wounds and require maybe a little bit of irrigation and a tetanus shot and outpatient treatment.
Dr. Russell, you've been gracious and patient with my questions. Do you need a break for any reason, subject to the court's permission?
So I was going to go just a little bit further if we could, like 15 minutes. But I can't see Dr. Russell from where I am.
I'm okay. I'm okay.
Can you go 15 more minutes?
I could.
Okay.
Yeah. Thank you.
Let's move on to the topic of
Police and the people in that world call them canines. Non-trained dogs are dogs.
dental features of dogs. Do you have knowledge of the dental features of dogs?
Yes.
Describe that knowledge.
Well, I have knowledge of the numbers and configuration of the teeth, the shape of the jaw.
And can you describe generally that knowledge?
Generally, yes.
Not
So
at her
the shape
age,
varies
Haley Mouse.
depending on
She
the
may have a
breed,
medical condition they're
but,
thinking of that we don't
generally
know
there are
about.
42 teeth in the canine mouth, and certain number on the top, a certain a certain number down below, 20 on top, 22 below.
And does that knowledge source from your medical education training, or does it source from the literature, or both?
Both.
Now let's go to an overview of dog-inflicted injuries. Specifically, can you give an overview of the specific type of dog-inflicted injuries on humans?
Yes, they could range from the very minor, which are abrasions and contusions or bruises, to very large gaping lacerations and amputations and avulsions and just about everything in between.
What do you mean by an avulsion?
An avulsion is where a piece of tissue is actually torn away.
Yeah.
By tissue, generally, I mean the skin. And it's...
If you can even call a Chihuahua a dog. I used to have one.
Torn away.
So I can joke.
From where it's supposed to be. But yet,
it's a wannabe dog.
It may still be intact. So it's not completely amputated. It's just a portion of it is torn away.
Are there ever teeth from a dog that are the cause of those types of injuries you just described?
Yes.
Are the nails of a dog ever the source of the type of injuries you just described?
The nails are sources of abrasions.
Are the claw marks the source of any type of injury from a dog? Or are the claw marks of a dog the source of any type of the injuries you just described?
Yes, abrasions.
Let's go to the types of dogs.
When I was a dog groomer for buku years, the dogs that scared me were the Chihuahuas. Because those little teeth, I've had my thumb fractured, split right here from a little Chihuahua. That little tooth broke my bone. Big dogs didn't scare me as much as those insane, old, blind, deaf ankle nippers.
Dog bite injuries. Describe the types of dog
But they're
bite
cute.
injuries with which
Especially
you
when you
have
dress them up.
professional experience.
Well, I have experience with that whole range of injuries and the unfortunate situation of death too.
So let's discuss the components of that range you just talked about. What types of injuries specifically from a dog do you have experience with regard to the type of dog injury from the dogs and the dog dentition?
I don't understand.
I'm sorry, my
the
question is not clear enough for you. Are there words or names that are associated with the type of injury from a dog?
Other than the medical terms like abrasions and contusions, lacerations.
Is there a certain action of dog teeth that occurs that they have a name for the type of injury that they present?
Okay, so one type of injury can be what they call the tear and the puncture and tear and pull injury, where the canine teeth, which are the longest ones, and the dogs have 2 canines on the upper jaw and 2 on the lower. The canine teeth actually puncture the wound. And what happens, and which I haven't described yet, is that generally a person's not standing still while they're getting bitten. They're pulling, the dog is pulling. And what happens is a lot of these wounds are caused, especially the extensive ones, by the relative pulling away of the victim and the dog. The dog, some dogs hold on and pull as well. So this pulling, the puncturing and then pulling will cause these hole and tear lacerations.
Now, you've discussed previously wound pattern recognition. You've used that term. How would you describe the wound pattern characteristics of dog-inflicted wounds on humans?
There are a number of different patterns.
In a spectrum of characteristic, from small to medium to high, what one of those 3 categories would you describe is appropriate for the characteristicness of recognizing a pattern from a dog?
Well, if there is a certain combination of wounds, a certain pattern of wounds, being parallel lines and puncture wounds, etc., if that is present, that combination, that is highly characteristic of a dog-inflicted injury.
So I just want to make sure we understand the type of dog-inflicted wounds that are, as you just called it, highly characteristic of a dog wound. What is the observation that leads you to conclude in certain instances that a wound is highly characteristic of a dog-induced wound?
Well, if I see a combination of punctures or incomplete punctures, as well as parallel abrasions, so striations, scratches would be the civilian word for that, that combination is highly characteristic.
Are you familiar with the term with regard to dog bites and dog wounds, an incomplete dental impression?
Yes.
What does that term mean?
Well, dogs don't generally bite with their entire mouth when they are biting a human. They bite with the front of their mouth. So, so you get a partial dental imprint. Additionally, depending on the type of, the amount of force and the grip, so to speak, that the dog gets on the skin, there may or may not be a complete impact of the teeth.
So would it be, so when it's not a complete impact of the teeth, have you observed that incomplete impact of the teeth in wounds to humans from dogs?
Yes.
Describe those observations, including how frequently you've made those observations.
In general,
Jack
they're more
Russell's?
frequent in civilian dog
Oh.
bites because the civilian, well, I can't
Don't
say
like 'em.
why, but anyways, they're more frequent in civilian dog bites, the incompletes. And the pattern is as I just described.
Is your experience greater from your entire career with dog-inflicted wounds from canine bites or from civilian dogs, as you've used that term?
In terms of overall numbers, civilians.
Your Honor, I would be going on to my next topic, and if you would like me to continue, I can, or if Your Honor prefers a break, I can do that as well.
Oh, I don't need a break, but I understand if people want a break. But what I want to know is how long, I'm not rushing you, but just to figure out how long we're going on the direct.
My best estimate, Your Honor, is 40 to 45 minutes.
Okay, so you say this is a good place to stop?
I do, Your Honor.
Okay, then we'll stop. So
Thank you,
we'll take
appreciate
a
it.
20-minute break and be back out here at 11:30.
Oh,
I just read off his lips. I don't.
You are muted.
I think they're happy with that. I would be. I think that that is doing well. Guys, this is my plan for the day. We have a lot of things popping today. So here's my plan. We're going to stay here and finish this because nothing happens in 20 minutes on all these other cases that we have floating. The next thing we're going to go to is the sentencing. Please, no spoil alert of Chloe Driver. Then we're going to go to the accused Jared Brigand killers appeared in Duval County for the pretrial hearing. Then we're going to get to the trial we were watching the other day. I understand other people are watching multiple things at once. Please, no other court spoilers. I'm going to scroll that across, add the banner, get that up and going. That's important. I don't want to know. Please, no spoilers and comments. Oh, I want to mute. I could handle the bigger bites more than I could the little ones. God, those little ones hurt much longer than the big ones. And they're so fast, they shred you. It's like, damn. Oh, don't do that. Okay, that's where we're going. All right. So what do y'all think so far? Some people don't find her credible. Some people feel that she knows too much, or she may be overly experienced and over tooting her horn. I don't know. But I will say, after hearing her in the first trial and then hearing her now, I do feel she's a little more prepared. With the first trial, she came in last minute. As a hotspot, she notified them that she had expertise that could help them in this case, and they permitted her to come in. Pisses me off that they are trying to get her disqualified, but you know what? They do what they got to do. They're doing what they feel is best, and I understand that for their trial. I'm clearing some notifications. Forgive me. The bouncing back and forth on all that. That's red. She knows her field, and when you've had the expertises that she's had and the experiences that she had, and some people go, well, you know, she knows a lot about a little about a lot of things, but you've not been in the medical field and she's done everything that she's done. I would believe her over some Joe Blow off the street any day. And when I first saw the wounds, I thought, well, maybe they are dog bites. But then I saw the glass and I thought, well, maybe they are glass. But excuse me, I have since gone back and looked at it, and in my opinion, I can see where they could be dog bites, but I'm not an expert, so that's why I'm not testifying there. Oh man. So that's a good thing. There's so much going on, but there's not enough time to get. How long is this going? That's over an hour. Are they done? We'll start the accused Jared. We'll start that one because that one's not a full hour. And we'll speed it up.
The file that was shared across is the defense in possession of that. The reports that were initially done that you all filed the motions, are y'all in possession of that information?
Yes, we are. There are multiple versions.
Why am I having problems with sound?
Was given complete, unfiltered access to this information. Do you have that?
Are y'all having a problem with the sound, or is it just me?
You need, what, Mr. Greiser, you need to look behind you. Wait, why don't you just answer? You don't have to tell me.
Is it me, or is it just? Is it me? Go to my live. I hate it when I have that.
Okay, so what was the file that was shared across the defense? Like that, I believe it was Mr. Fernandez's information that was somehow shared potentially inappropriately with Ms. Gardner's team.
Yeah, it's in and out, and it's low.
Don't open those. What return is that?
Is it intermittent, or is it just low? Why am I struggling?
I think that the amended order that I put into place for Detective Simmons is a better version of what I put into place initially. So what I ask is that you all review that and not review it like in the sense that this is the final word, because we are working through.
I need someone to tell me, is the sound intermittent or is it smooth? Because in my ears, it's cutting out.
Have the same resources / laws, okay? So if you all see something that needs to be changed without exposing information that is not appropriate to the state of Florida, I'm open to that, is what I'm saying. So you all can talk as much as you want to. My suggestion would be that you include Detective Simmons with all sides present so that whoever you all are thinking about, that we don't get ourselves in this situation 30, 60 days later. Second thing is that as far as what Mr. Dreister is proposing, it may be a very short-term solution. I don't think it is a solution in totality. Ms. Gardner.
See, I have everything 100% gained, and it's cutting in and out.
Like saying, I just want text messages within that date range for either side, in my mind, is dangerous because if you isolate just that.
Okay, we're not going to do. Let's try this and see how it is. See, that's smooth to me. Maybe because it was so low, it was hard. Yeah. Well, my roadcaster was not able to pick it up well, and it was gained 100%. Mm-hmm. So yeah, let's try this again. Let me try another feed. We're gonna get back over here. Let me try another feed. Oh, let me go back over here real quick. I need to go to subtitle. Font size 100. It's fine. This one. This is style. Okay, let's see how this works. Okay, we got a feed back in this court. We'll just share this for now. The other court, I'm going to try and find another feed for this hearing because it's not a good feed for me. Try to find that. Nope, that ain't gonna work. We'll play with it later because the only feed that I'm finding is the actual feed that I currently have, and it's intermittent. So we'll look at it later. No biggie. No big deal. We got everything going. Well, I apologize for that, guys. Ronnie, go to our Discord chat. I have a question about a link. Okay. I have a question about a link. So what are your thoughts so far? I want everyone to chime in on this woman. Do you think they should allow her or should they not allow her? Oh, no. Allow her? Yeah, definitely. I think they should. I think that it's important. I think it's important that they should allow her. I think that it's not like she's somebody with no medical experience whatsoever. I think that the defendant should be able to put on their case. And if that person is who they want to testify on their defense, then they should be able to. She has enough medical background. The only issue is whether or not the jury believes her. And that's up for the jury to decide. It wouldn't be like someone like me who has minimal experience coming in and trying to be an expert. So I think she definitely has enough knowledge to be an expert witness for that side, whether she wants to believe it or not. In my ill humble opinion. I'm looking at something. Okay, so yeah, I'm looking for something in Discord. By the way, speaking of Discord, you guys, we have a fabulous partnership with As the Gavel Drops. We thank you so much for all of your mods' hard work in providing documents for us that we can use as a part of our trial feeds and that we can enjoy sitting and reading and diving into the cases of our choice. They are covering approximately 500 cases. So if you love to read court documents and want to find out the truth for yourself of what they say, go over to As the Gavel Drops. Be sure to validate your account before you can access the documents in Discord. Thank you so much for your partnership, and we really appreciate all your mods' hard work. So, do we just want to? No, I want to hear this stuff, and I don't think we have time. No, we don't. Okay, I'm going to mute myself for. I'm going to do a comfort break. I'll be right back. Okay. My camera decided, Discord decided it did not like my camera. Sorry about that, y'all. Appreciate y'all holding. Okay, so let's see what we have here. I'll be back shortly. Gabby, the picture in the frame. You like the hold music? You keep thinking that the stars are at the top of the courtroom. Oh, I get it.
Dog-inflicted human dog-inflicted
Let's go.
diagnosis. Come back.
Okay, I get what you're seeing now when they have that pulled away.
My apologies.
That's okay. I didn't realize when I came in. Do you want to wait for co-counsel?
With the gold trim.
I'm sorry.
I'm ready.
Okay. All right, go right ahead, Mr. Lessing.
Thank you, Your Honor. Welcome back, Dr. Russell. We've mentioned briefly the term differential diagnosis, and you have defined what that term means. In terms of assessing and treating dog-inflicted human wounds, do you invoke differential diagnosis?
Yes.
And could you describe how do you invoke the concept of differential diagnosis with respect to assessing and treating dog-inflicted human wounds?
With any wound
This is
that I
interesting.
see, and with any condition that I see in the emergency department, I usually get an impression what I think it is, but it's important to think of what else it could be. So you don't focus in on your diagnosis right away or your first impression, because sometimes it's not accurate. And so it's very important to have what we call in medicine a differential diagnosis. This is what I think it is, but this is what it could be, and why isn't it this second thing or third thing?
The host would like you to unmute your microphone. You can press star 6. You are unmuted.
Okay.
Should I wait, Your Honor?
No, I think you're all set. All set, Mr. Clerk?
Yes, thank you. Sorry. May I continue, Your Honor?
Yes.
Thank you. How important or unimportant is the application of differential diagnosis with respect to pattern wound recognition regarding dog bites on humans?
It's important in a lot of conditions, including pattern wounds and dog bites, because you need to know, or at least I as a physician need to know what it is. What it is I'm going to be looking, what is it that I'm looking at, and what is it that I'm going to be treating? And I need to make sure that I'm not treating the wrong condition.
Let's now go to the topic of the materials you have considered in this matter. Without stating what it is, have you been able to form an opinion as to the source and nature of the wounds that were inflicted on the decedent?
Yes.
What materials did you consider in forming your opinion?
Well, I looked at the appearance of the wounds, and with my training and experience, I took that all into consideration. I did do a differential diagnosis on what those wounds could be. You know, could they be caused by an assault? Could they be caused by a motor vehicle? Could it be caused by, self-inflicted? I went through that whole differential before I came to my conclusion.
Did you look at any photographs of the decedent from Good Samaritan Hospital?
Yes.
Did you look at the autopsy report of the decedent?
Yes.
Did you look at the grand jury testimony of Dr. Scordi Bello?
Yes.
Did you look at the trial testimony of Dr. Scordi Bello?
Yes.
Did you look at autopsy photographs of the decedent?
Yes.
Did you look at the photographs that were taken by the Massachusetts State Police Crime Lab?
Yes.
Did those photos include a sweatshirt or what's sometimes referred to a hoodie?
Yes.
And were there photos of that sweatshirt or hoodie that you looked at?
Yes.
Did you look at a letter from Tracy Kennedy with the town of Canton with a report regarding a German Shepherd owned by Brian Albert?
Yes.
Did you look at the photographs of dog bites and a certificate of vaccination for Brian Albert's former German Shepherd dog?
Yes.
Did you look at the forensic DNA testing report by the UC Davis Veterinary Genetics Laboratory?
Yes.
Did you look at the UC Davis Veterinary Genetic Laboratory case report?
Yes.
Did you look at a report from a Paul Mikowski, a licensed private investigator, on interviews regarding Brian Albert's German Shepherd dog?
Yes.
Do you have an opinion with regard to the nature and source of the wounds on Mr. O'Keefe's right arm?
Yes.
What is that opinion?
Those wounds were inflicted by a dog attack.
Do you hold that opinion to a reasonable degree of medical certainty?
Yes.
I would accept
How
her.
did you form that opinion?
Well, I utilized my many years of training experience with wounds in general and dog bites in specific, and went over the materials quite a few times. And with that, and plus did read up on some literature that I had read in the past and reread again. And that's how I came to the opinion.
Now, to get a little bit more specific, did you invoke your pattern recognition methodology in coming to that opinion?
Objection.
You have to ask it differently.
Thank you, Your Honor. Did you employ a methodology in coming to that opinion?
Yes.
What was the methodology or one of the methodologies in coming to that opinion?
Well, right away, it was apparent that there was a pattern. So I used my the pattern recognition methodology, plus my many years of training experience to come to this conclusion.
And with regard to the pattern recognition, do you have a level of certainty with regard to the pattern that you have recognized in the decedent's wounds on his right arm?
Yes.
What is that level of certainty or certitude?
Those wounds are highly characteristic of a dog attack.
How frequent in your experience do you find in wound care that a wound pattern is highly characteristic of a certain source?
I object to a percentage type question.
Can you answer that question, Doctor?
I'm not sure I even understand it.
So ask it differently.
Thank you.
please.
When you use the phrase highly characteristic, what do you mean by that phrase?
Well, it's very high. If I were to give a percentage,
Please continue.
I would say almost, almost pathognomonic, 90, very high 90s.
Now let's go to differential diagnosis. Did you perform a differential diagnosis in coming to your opinion?
Yes.
What other considerations did you take into account as to possible other causes of the injuries to the right arm of the decedent?
Well, given the pattern, there were certain things that came to mind right away that I had to rule out, and so I ruled out self-inflicted as an etiology. I don't think he self-inflicted those. The pattern was not characteristic of being struck by a motor vehicle. The pattern was not characteristic of those wounds in particular on the arm of being inflicted by another person.
You mentioned
They had a bite
motor
pattern.
vehicle accident, and earlier in your testimony, you spoke to your experience with observing and treating a lot of motor vehicle accidents. Why did you rule out motor vehicle accident as a potential cause of the injuries to Mr. O'Keefe's right arm?
Because he was found outdoors.
And what other reasons? Was there anything about the nature of what was presented in what you reviewed with regard to his injuries that caused you to rule out motor vehicle accident?
I think I misunderstood the previous question.
So, yeah.
Yes. So.
Let me start over.
Yes.
Because I am going to take what you said. So let me ask it this way. What caused you to rule out a motor vehicle accident as a cause of the injuries to Mr. O'Keefe's right arm?
Got it.
There were several reasons I ruled it out very quickly. One is that the wounds were not characteristic of anything that I could attribute to a motor vehicle, a certain part of the motor vehicle, the underneath part of the motor vehicle. They were just not characteristic of any particular part of the motor vehicle. Secondly, there were no bruises from the neck down on
Ding, 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 ding.
Hand, which I think I have an explanation for that.
Please.
Which was not a motor vehicle, but I didn't see any bruises or fractures or other blunt injuries that were characteristic of
a
person being struck by a motor vehicle.
Exactly. How many of us have said that from day one?
We, at the coroner's office forensic pathology program, was specifically trained on how to recognize not only
impact.
If someone was struck by a vehicle, but to even recognize further about what types of vehicles would inflict, what types of wounds.
Yes.
And the locations that we should look for on the body for wounds for someone that's struck by a motor vehicle.
Thank you for clarifying that training.
Have you ever taught in all your career that you were discussing earlier today how to assess whether an injury to a human has been caused by a motor vehicle?
Yes.
Describe how you taught that in your career.
Well, again, it's oftentimes a pattern. So, for instance, a wound on a certain part of the leg, certain number of inches up from the foot of the leg, could be the result of a bumper, for instance. So we were taught to look for certain patterns and locations of injuries. Also, injury from
and the shape of the bruise.
Glass, has a certain pattern on automobile glass, and road rash has another pattern. So,
what are the features of glass from your experience with regard to motor vehicle accidents?
I like this attorney.
Injuries?
I like his questions.
Well, they often cause what we call dicing injuries, which are another pattern of injuries and lacerations.
Have you made that diagnosis that you just described as an emergency room physician?
Yes.
Have you made
Yes.
that diagnosis as a forensic pathologist?
Yes.
Yes.
Describe how you've made that diagnosis as a forensic pathologist with a post-mortem individual.
So again, it's pattern recognition.
What the hell?
Go ahead.
Thank you, Your Honor. Do you need the question
No,
repeated?
no,
Please.
it's pattern recognition.
And can you give an approximation of how many years of experience you have had with that pattern recognition that you just described?
Longer than you've been alive.
At least 30.
And how often in the 30 years, by year estimate, have you made that assessment?
Oh, I don't
Weekly.
know. Maybe once every year or two.
So would it be correct 30 to 60 times? Let me
No.
rephrase it. How many times would you, based upon what you just said, estimate that you've made that assessment?
At least 15 times.
At least.
Your Honor, may I approach the witness with exhibits?
Sure, just show counsel what you're showing.
Counsel has all the
Just tell him
exhibits.
what
If I
you-
could just tell Mr.
Yes, you
Bennett?
can approach, just show it out as you walk up. Yes.
I understand he's he's acting like a young lawyer, or he's a lawyer from another state and is unsure of their procedural for this state and county.
May I
Each
proceed?
jurisdiction does run things
Dr.
slightly
Russell,
different.
I have just handed you what is marked as Exhibit 2 in evidence. Do you recognize it?
Yes.
How do you recognize it?
I've seen it many times. It was a part of the records that were provided to me, the photos.
Is that true and accurate?
This, yes.
Well, okay.
Of what I've seen, yes.
So what I'd like to do is, Your Honor, may I publish that exhibit?
Yes, is it ready to come up, Ms. Gilman? Or they're going to do it? Okay, sure.
No, I don't want to. I want to flip this.
All right, so okay.
I just want to make sure we have, because Mr. Brennan.
Yeah, the numbers seem to be different. So Diane, I'm going
That's
to
it.
need from you the list of. So what is this?
He
Can I have
got
a moment,
new
Your Honor, to make
shoes
sure I'll
on.
get it
Sure.
right in order?
My numbers are different, so I'm going to need to see the list of the exhibits so that I can remark what I have.
Right. So what I wanted to do is to go to 4. That's the one I wanted to go to.
Okay.
And
Y'all.
Are 4 and 2 the same?
no, they're different, Your Honor. And if I could I approach the sidebar, please? Your Honor, to get this?
Sure.
Thank you.
Mr. Brennan?
Ooh. Yeah, we ain't going to go do that. I'm going to put it down lower. Y'all. Excuse me. I didn't mean to scratch in front of you like that. I don't know. Let's talk about this a little bit. I really like this dude. I don't know who he is. I don't even know where he's from, but I like the dude. Definitely like him. And I would definitely consider, I definitely enjoy seeing him actually in the trial. Do we know anything about this man by any chance? Anything at all? Do we know anything? Ding. Y'all, I'm excited. I need to tell you what I've done. I forgot to share with you. Y'all, I have lost 12 pounds. I know, right? I've lost 12 pounds.
So for purposes of an appellate record, we're now going to look at what's been marked as Exhibit 5.
That's correct, Your Honor.
Okay.
And I appreciate Mr. Brendan's cooperation in getting to this point. May I proceed, Your Honor?
Yes.
Dr. Russell, do you recognize what is now depicted on the TV screen, which is marked as Exhibit 5?
Yes,
How do you recognize it?
because I see a very distinct pattern of wounds.
And have you reviewed this exact photograph before?
Yes,
You have mentioned the various types before characteristics you called highly characteristics of a dog wound and dog inflicted wound. What I would like you to do, please, do you have a pointer?
I do.
Can you please test to make sure it works?
Okay. It works.
Oh, I like him.
What I'd like you to do in your own words and with the court's permission, I would like you to use the pointer and go through with whatever method you believe is appropriate to describe each of those wounds and how you assess them.
Okay. So we will go from the shoulder area down to make it easy. So, first of all, the overall impression is there's numerous abrasions and that they have a pattern to them. One can see that many of them are parallel in nature.
Can you use the pointer? I'm not.
Yes,
maybe
so-
yet. I wasn't seeing it. Thank you.
Okay,
Those right
so
there
for
and these
for
right
instance,
there?
The set
One bite.
of wounds closest to the shoulder up here. And these, by the way, are all on the posterior surface of the arm. Posterior.
Got it.
And
Got it.
maybe this
That
part
explains
is a
it.
little bit towards the medial, the lateral portion.
When you're new to a new county or area, you got to learn the judges' preferences and how they run their trial. I'm really liking this guy. I think he probably needs to be the lead or the one who does most of the examining.
Portion of the arm, but
Love his way of
they
questioning.
all have so they're parallel. They're linear, meaning they look like a line, or they're not round. Or these are not round, and so these
Puncture here.
Do you want me my
Drag.
interpretation, or do you want me to just describe?
Puncture, drag. Puncture, drag.
Is who you've described them. You've said linear.
By the way, she hasn't said this, but I'll say it. If you were to look at a dog's tooth outside of their mouth, any canine on an animal, some are more so sharper than others. He is the lead attorney. Oh, thank you, Jesus. They're almost shaped like a teardrop. And on the inside of the canine is a little ridge, and it's sharper on the inside of that canine versus the smooth outside of the canine. So like with my monkey, for example, which is similar to a dog's canine, just a lot smaller. In all canines in animals, but I didn't know this till I got the monkey, that it's it's much sharper on the inside of the mouth than it is on the outside. So that is way they're designed. I'll do a diagram later.
Have you completed your description of them before you get to how you reached a conclusion as to the source of that area you just did a circle around? Have you completed your description of them?
Yes, I've completed my description. How I came to the conclusion involves all of them.
Okay, so now let's then move, before you get to a conclusion, let's move to, in whatever manner you would like, the next wounds and how you assessed those.
Okay. So, and by the way, on this first set, there's a very, very faint linear abrasion
Hello,
between these two
Esmeralda Highlander
prominent
99.
linear abrasions. Okay. Proceeding down the arm towards the elbow, we have another
I don't like this
set
because the prosecution is
wounds,
getting a heads up.
which consists of parallel abrasions. This time it looks like there's two in the more anterior portion of that lateral aspect of the arm, and then another linear
Show us.
abrasion down below here, as well as
Cameraman.
a superficial
Cameraman. We want to
punctate
see.
or round tiny lesion.
We need to see the
below it.
exhibits.
Punctate, I
I'm gonna
mean
get
small
you.
and round. And there may be another punctate lesion right there. So that's this group. Proceeding down the arm, there is this irregular group here of multiple 1, 2, 3, 4, 5 linear abrasions at least, and then 2, possibly 3 punctate wounds below them. And this is right over the elbow area. And there might be, yes.
You mentioned irregular with regard to some of those wounds. Why do you describe them as irregular? And is there any significance to them being?
Yes.
Don't go to your conclusion yet. Just you use the term irregular, and I want to make sure the record's clear what you mean by that.
Okay. Well, so a few of these individual wounds have some linear or line-like component, but then as you proceed further down the arm and just below the elbow, there's a couple of wounds here that do not look like a line. So that's what I meant by irregular. So that's this pattern here in total around the elbow. Then further down the arm, there's 2 punctate wounds again, right here.
Go slow and say this is punctate wound number 1. This is punctate wound number 2 with circling the list.
Okay, here's one, punctate wound number 1, and here is number 2.
Why is each of those a punctate wound? Because they look to have a slightly different shape.
Oh, very good question. Because there was movement. There was movement of the either the dog or the the inflicting teeth,
Or the
either
human.
dog or the victim. There was movement. Okay. Then there is this group, which are again irregular, because then I'm calling them irregular because they're not shaped like a line. And it appears that there's also some what we call movement artifact on those.
When you mention irregular, does that mean it's uncharacteristic or characteristic of a dog?
It means neither of those.
Good, thank you.
Okay. And then finally, the furthest down the arm is this grouping of linear, I'm going to call them linear because they're line-like, But so linear abrasions, which appear to have a somewhat semicircular appearance, a configuration. And the direction is slightly different. The angle of these linear lacerations are just ever so slightly different than the ones above the elbow.
Is there a medical term that is used to describe the location of those wounds that you just spoke about?
So they're on the posterior forearm.
And is there a medical term for the forearm location down here? Or is it just, you just refer to it as location? No special.
Not that I'm aware of.
Okay, so please continue.
So those are the wounds of the arm, which is above the elbow, and the forearm, which is below the elbow.
Can you now proceed with regard to each of those wounds or categories of wounds to describe what aspect of dog dentition caused those wounds?
I believe that the ones closest to the shoulder, the two large linear wounds, were caused by the canine teeth, the upper canine teeth of the dog.
What are upper canine teeth of the dog?
Well, the canine teeth are the ones that seem to be most prominent when you look at a dog's mouth. They're the triangular, the sort of triangular shape. We humans also have canine teeth.
Okay.
But they are the teeth that, for the most part, grab onto an object.
And the long fang look
In terms of describing the dog dentition with regard to each wound.
long fang looking teeth.
I'm not sure exactly what teeth made these. They could, one of them could, one set of these could be canine, one part of this, and then an adjacent incisor tooth, but I'm not sure on the second set. So this is the set that's just above the elbow. However, what is interesting and certain is that there's an upper set and a lower set. So this mark
I
was
want
an upper tooth.
to see
This is a lower
the photo.
tooth.
So even though you may not be able to identify the specific aspect of the dog dentition, you're able to identify that it is from some aspect of the dog dentition. Is that what you're saying?
Yes.
Please proceed.
This one this is the most complicated one, because I believe that this set here I believe that those linear wounds and the irregular wounds are from upper teeth, and the punctate wounds are punctures or incomplete punctures from lower teeth. And the reason this whole configuration looks irregular is because the elbow may have been in a different position than it is in this photograph.
What do you mean by a different position? Describe it using your own forearm.
Okay. Well, the elbow was.
Sorry, Your Honor. This is for the court. Can you see it here, or would you prefer she stands up?
It's better if you stand.
Oh, okay.
Well, you know what? I'll come to you. You stay. Okay. So.
Yeah, I would like you to describe what you just meant of the location you believe that the decedent's arm was in when those wounds were suffered. Please stand up. Thank you.
Yeah, she's getting up there in age. She does have a little bit of mobility.
So in this picture, the elbow is, for the most part, somewhat extended. It's not bent as much as it could be, and it is not bent as it was likely as he was protecting himself from the wounds.
So you're saying, just so we understand,
Strike the second.
I'm going to strike that.
Oh.
Just describe the placement of the arm.
Okay. Well, so the elbow bends, as we all know. And so the skin of the elbow
It's going to,
is in a different location depending on whether the elbow is bent or not. So
Right.
anything that's inflicted will depend on the position that the elbow was in when it was inflicted.
so if it was here, then it opens up
hope
here.
that
It's going to be distorted.
yep, please proceed.
It distorts as.
So this is one set, the ones around the elbow. Then there is going a little further down the arm.
And she can see it better
There's
standing
another
up.
Set of wounds. The two punctate and punctate and irregular wounds halfway down the forearm.
I'm sorry to interrupt. You may sit down if it's more.
Hold on, wait till you choose.
Yeah, yeah,
Oh,
yeah. Oh, for them to put the chair back, madame. It may be easier because she's kind of looking around at that beautiful desk.
And then
That's a beautiful.
finally,
Whoa.
There's this
Sorry. Yeah. Whoa.
area down
beautiful
here, which
courtroom.
is the closest to the wrist. And there are at least 3 or 4 parallel abrasions there. And it looks like a
Beautiful
punctate
carving.
wound down here. These, I believe, were inflicted by the front of the arch of the dog.
Have you completed your articulation of the assessment of each of the wounds on the arm?
I think so.
In some of your answers, you said irregular, could be. If you use those terms, are you still nonetheless able to conclude whether there is a pattern wound here?
Yes. So the individual marks are characteristic of, possibly more than one cause. However, the combination of the overall series of patterns is highly characteristic of a dog inflicted.
So are you saying that one specific wound could be indicative of a dog-inflicted wound, but the whole pattern itself is how you reach the conclusion?
Yes.
Sustained.
Describe how you conclude. Well, let me go walk backwards. What do you conclude from the pattern of all of these wounds collectively?
These were inflicted by a dog, and this was a dog attack.
And why do you say it was a dog attack?
Because there are multiple bites here.
Do you observe any claw marks with regard to the injuries?
It's possible that this set immediately above the elbow could be claw marks. However, I don't think so on further examination because I see some punctate lesions which suggest that those are also teeth.
In forming the opinions and conclusions you just testified to as to the nature and source of this pattern of wounds, did you apply any techniques or analysis that you would use as an emergency room physician?
Yes.
Describe how.
Again, I looked at the wounds and I looked to determine if there's anything else that could inflict that pattern of wounds that were inflicted around the same time. And there is nothing else that I am aware of that could do that.
How did you, did you determine that those wounds occurred approximately the same time, each of those wounds?
Yes,
How did you determine that?
by the appearance of the wounds, the color, yes.
Anything else about the
Color,
appearance?
the fact that there's no healing, yes.
In conducting your differential diagnosis, how did you rule out a motor vehicle accident as a cause of those injuries?
Again, I did not recognize the pattern as being inflicted by any particular part of a motor vehicle. The motor vehicle accident would have caused injuries to other parts of the body, such as the chest and the, other parts. There would be bruises. Motor vehicle accidents cause bruises, fractures sometimes. There were no other injuries like that.
Did you reach any opinion or conclusion as to when these injuries were suffered, meaning pre-mortem or post-mortem?
She's too prideful
They're
for that.
pre-mortem wounds.
How did you determine these wounds were pre-mortem wounds, and specify what you mean by pre-mortem?
So pre-mortem means before death. They occurred before death. And the reason I can tell that they're pre-mortem wounds is because they have what we call a vital reaction. Post-mortem wounds, so vital reaction means that there was life in the body at the time that these wounds were inflicted. And a post-mortem wounds look very different because there is no blood flow that occurs post-mortem, so they don't get this vital reaction.
Is it an accepted methodology in the practice of medicine to observe a post-mortem photograph of wounds in reaching a conclusion as to the source and nature of the wounds?
Yes.
And why is that an accepted practice?
Well, first of all, it's realistic. The wounds appear the same. And
We're going to do something real quick. Okay, we're going to share this. If you take this arm and you bend it, these two holes here are the canines, and these holes here are the canines. And they, if you put them together, they drag inward. They drag towards each other. I don't know. I think if for those we really didn't get a good look, we're getting a good look. Thank you, Ronnie, for this. Yeah, she won't throw out the case, but I'm worried about the testimony. I know this is the most compelling testimony, I think, of the entire case. But if you look, there are multiple bites here. And this 1, 2, 3, 4, yeah. That could be definitely, to me, that is definitely definitely a dog bite, in my humble opinion. And that's where I'm going to stand on it. And here we go. Thank you, Ronnie. I'm getting there.
I
So-
believe
Sorry,
they were all
I thought
post-mortem.
it clicked. I may have unclicked it. Let me get back. Here we go.
Those are also teeth.
Yeah, me too.
Informing
Chris, I
the
think is his name.
opinions and conclusions
Brian
you
Higgins.
just testified
Thank you.
to is to the
I'm so
nature
bad with names.
of this pattern of wounds. Did you apply any techniques or analysis that you would use as an emergency room physician?
Yes.
Describe how.
Again, I looked at the wounds and I looked to determine if there's anything else that could inflict that pattern of wounds that were inflicted around the same time. And there is nothing else that I am aware of that could do that.
How did you, did you determine that those wounds occurred approximately the same time, each of those wounds?
Yes,
How did you determine that?
by the appearance of the wounds, the color, yes.
Anything else about the
Color,
appearance?
the fact that there's no healing, yes.
In conducting your differential diagnosis, how did you rule out a motor vehicle accident as a cause of those injuries?
Again, I did not recognize the pattern as being
I
inflicted by any
wish.
particular part of a motor vehicle. The motor vehicle accident.
No
would
man
have
likes all
caused
this.
Injuries to other parts of the body, such as the chest.
Been single
and
for
the,
13,
other
14
parts.
years.
There will be bruises. Motor
14
vehicle
years?
accidents cause
Yeah.
bruises.
No one likes
Fractures
this.
sometimes. There were no other injuries like that.
I had one hit
Any
and he
opinion or
sucked.
conclusion as to when
I got rid of him real quick.
these injuries were
Sort of.
suffered, meaning pre-mortem or post-mortem?
They're pre-mortem wounds.
How did you determine these wounds were pre-mortem wounds? And
Because they had blood.
describe what you mean by pre-mortem.
So pre-mortem means before death. They occurred before death. And the reason I can tell that they're pre-mortem wounds is because they have what we call a vital reaction.
Blood coagulation.
Post-mortem wounds, so vital reaction means that there was life in the body at the time that these wounds were inflicted. And a post-mortem wounds look very different because there is no blood flow that occurs post-mortem, so they don't get the vital reaction.
Is it an accepted methodology in the practice of medicine to observe a post-mortem photograph of wounds in reaching a conclusion as to the source and nature of the wounds?
Yes.
And why is that an accepted practice?
Well, first of all, it's realistic. The wounds appear the same in this case and in many cases. And then the other thing is
I'll be right
because
back.
autopsy is a finite period of time, 1 or 2 hour period of time on a certain day, and other physicians can't always be at the autopsy.
So is it common or uncommon for forensic pathologists to use photography to determine the source and nature of a wound such as this?
Common,
How common?
very common.
This may seem like an obvious question, but did you use photographs in forming your opinion?
Yes.
Did you use any ante-mortem photographs of the decedent's right arm in forming your opinion?
No.
Did you observe any hospital records of photographs of the decedent ante-mortem?
Antemortem?
Yes.
I don't believe so. I
So-
believe they were all postmortem. They're right after the resuscitation attempt.
Is it an accepted practice in the emergency room medical community to also use photographs in assessing the nature and source of wounds?
Well, usually the emergency physician's right there.
But in terms of your, understood, and is that the best way to assess it?
Yes.
But is it an acceptable way to look at a photograph to assess the source and nature of wounds?
Yes.
And do you remember the COVID world we all lived under?
Yes.
In the COVID world that we all lived under, did physicians sort of accelerate or increase their use of photos in diagnosis, or did they decrease their use of photographs?
I cannot comment.
Let's go to whether, let's go to these wounds. Did you make an assessment as to whether these wounds would have changed at any time from when they were incurred to when that photograph was taken?
Well, I certainly took that into account, and I decided that because, well, basically the answer is no, they wouldn't have changed because the decedent was found in a very cold condition, which was 80.1 degrees when taken. And even at the autopsy, the medical examiner commented in the report that the body was cold to touch. And cold delays postmortem change. So there was really no significant postmortem change of the skin.
Your Honor, may I approach Ms. Gilman for the next photo to make sure we do this efficiently with Mr. Brown?
Sure.
Thank you.
Okay, I thought I lost something. Let me ask y'all, do you like the background lit up like that? Or do you like it dark? I turned on my office light, my big light.
Exhibit 4.
Yes.
Thank you, Your Honor. Dr. Russell, do you?
You know what? Actually, take it down for just a
Oh,
minute.
that's right. Yes, I'm sorry.
Take it down, Ms. Gilman. Thank you. I'll see counsel.
Crap. I don't know. You like it better this way? When I don't, this, unfortunately, not UV, but the other kind of lighting, the tube, iridescent, whatever, can give me migraines. Hi, Carmen. Yay. Can give me a migraine. So I have another light on here to help counteract it. I just put a heating pad on my back, my hips. Thank you, Doug. I think they're very, let me turn that down. That's her father. I think they are very happy with this testimony. No, Carmen, we appreciate you being here. I didn't know you back then during this trial. What do you think? Do you think this is a dog bite or is it not? What do you think about this testimony?
So, Dr. Russell, I understand that it was inadvertent, but we're not going to publish that photo. Did not allow it published during the trial. Jurors is one thing, but also the dignity to Mr. O'Keefe. So you can look at the photo. It's unfortunate that it was put up and published. So you will have it in front of you, okay?
I'll have
What
You'll
photo
have it in front
are
of
they
you, just
talking
not up
about?
on the
Oh,
screen.
okay.
What photo are they talking about? Are they talking about the arm? Because they had the photo of the arm up in trial.
All right, go ahead, counsel.
Thank you, Your Honor.
I don't always. I'm doing good today. I'm actually doing great today physically. As far as I got a lot of sleep last night. I've already cried this
Dr.
morning
Russell,
once.
in
I had my
coming to
tear.
your opinion,
Hopefully I won't cry again.
did you examine
This is a shirt she
an
gave.
autopsy report?
She gave me a black, white,
Yes.
and an off-white one.
May I approach, Your Honor?
Yes.
My last gift my
And I'm
sister gave me
approaching
was these
with
shirts.
Exhibit 3.
Oh, they showed that in trial. The the prosecution showed that in trial. That's bullcrap because I screenshotted it.
May I proceed, Your Honor?
Yes.
Thank you. Do you recognize Exhibit 3?
Yes.
What is it?
This is a report of autopsy on Mr. John O'Keefe, medical examiner number
Tracy's shirt.
2022-1697.
Okay,
Did
no
you
crying.
consider
No crying.
that medical examiner's analysis in Exhibit 3 informing your opinion?
Yes.
And how did you consider Exhibit 3 informing your opinion?
Well, there was a description of the abrasions of the forearm and arm.
I'm sorry, which forearm and arm?
I'm sorry, right. Right forearm and arm. Yes.
And what about the autopsy report did you consider in that analysis of that part of the autopsy report?
Hi, Kathleen.
The Dr. Scotabelli description of the wounds.
And what was Dr. Scotabelli's description of the wounds? And feel free to read from the autopsy report.
Okay. Do you want me to read the descriptions?
Whatever it is you considered with regard to the injuries to the right arm of the deceased.
Well, she described what basically I just described, although she had some measurements.
Your Honor, may we republish the correct?
Oh,
photo
this feels so good.
on the screen so the doctor can
Yes.
refer to it?
Heating pad feels so good right now.
It's gonna be number 5.
Your Honor, may I publish Exhibit 5 photo?
Yes, Ms. Gilman's doing it, I believe.
Ms. Gilman, are you all set with what you, thank you. And thank you for putting that back up on the screen. May I proceed, Your Honor? Dr. Russell, in reading from the autopsy report, can you read it and then determine whether there's any relation to what is being discussed in the autopsy report to what is in that photo?
Well, the doctor
I think he was asking her what she based her opinion on the reference to the medical exam report So I have an objection to simply reading through it and trying to interpret what the ME thought.
So rephrase your question.
Sure, thank you. Please read from the autopsy report the relevant portions related to Dr. Scordi-Bello's analysis of the right arm.
Again, I object. It's not the MD's opinion. It's whether she relied on the information and how so.
I'll repeat. Did you rely upon what is in the autopsy report to support your opinion as to the nature and source of the wounds in the right arm?
Yes.
What did you rely upon in that report to support your opinion with regard to the nature and source of the wounds?
The description of the wounds at autopsy.
And what was that? What is that description that you relied upon?
It says here, multiple abrasions from 2 to 3 millimeters and up to 7 centimeters.
What page are you on, Doctor?
I'm sorry, page 3.
Okay.
Under the area that says injuries.
Okay.
And then in the subsection that says extremities. It's the second bullet point there.
Okay.
Multiple abrasions from 2 to 3 millimeters and up to 7 centimeters on the posterior right arm and forearm.
Roughly how many autopsy reports have you authored in your career?
Authored?
Yes.
Over 500.
How many autopsy reports that you have not written have you reviewed?
At least 100.
At
What
least.
conclusions do you reach from that description that you just read with regard to whether that is a description or not of a pattern in the report?
I object.
So you ask it a little bit differently.
Dr. Russell, what do you conclude from reading that section of the autopsy report with regard to the nature of the wounds, the total wounds depicted on what's up on the screen?
Well, it substantiated my observation based on the pictures.
What is the observation first? And then second, how did it substantiate your observation?
I'm not sure I'm understanding the question.
Did you, make sure I understood your answer, did you state that that section of the report substantiated your conclusions as to the nature and source of the injuries?
It substantiated my observations.
And
yes.
okay, what observations did it substantiate?
Well, there are, as the doctor wrote, multiple abrasions and in certain measure between 2 and 3 millimeters up to 7 centimeters on the posterior right arm and forearm. That's exactly what I see there.
So is it your judgment that Dr. Scordi-Bello made the same observations of these wounds as you did?
Multiple objections.
Yeah, the objection sustained.
With regard to well, we've covered what we needed to cover with regard to that aspect of the autopsy report. Was there anything else in the autopsy report that spoke to the nature or source of those wounds?
Not that comes to mind.
So, did the medical examiner, Dr. Scordi-Bello, in that report reach any conclusions about the nature and source of the wounds that are depicted on Exhibit 5?
Not in this report.
So, not in that report. Now we're going to now move on to the next topic. Did you consider DNA evidence in this case?
Yes.
How, if at all, did the DNA, well, what DNA evidence did you consider in this case pertinent to the injuries to the right arm of Mr. O'Keefe?
I considered the reports from the UC, University of California at Davis lab regarding the DNA evidence.
What training and experience do you have with regard to DNA evidence?
Not very much.
With regard to what you, well, describe what your DNA experience is.
Well, I'm aware that you have to maintain continuity of evidence. So you have to sample the appropriate area. And then you have to maintain continuity of evidence until that evidence gets to the laboratory for analysis.
How do you have experience, training, or knowledge with regard to the topics you just testified to?
Well, several ways. One was that I took a course when I was a police officer in crime scene investigation, and that was stressed, continuity of evidence. Secondly, I was sent to a course as the rape officer, the rape investigator, I should say, in the Malden Police Department. I was sent to a course in Brockton entitled Rape Investigation, and they stressed continuity of evidence that was obtained from victims. And then finally, of course, as a emergency doctor and forensic pathologist, I received additional training.
How, if at all, did the, well, let me ask you, did you review the UC Davis Veterinary Genetics DNA report in coming to your opinions and conclusions with regard to the wounds on the decedent's right arm?
I did.
And what conclusions did you reach?
The same conclusion.
And what is that?
That those injuries were inflicted by a dog.
Are you aware of the results of the DNA testing of the UC Davis facility?
Yes.
What are you aware of?
I'm aware that DNA was not found.
And
excuse me, let me clarify that. I'm aware that dog DNA was not found.
Pig was. And what do dogs chew? Oh my gosh, y'all. I want them to get this in. What do dogs chew a lot of? Pig's ear dog treats. A lot of dog treats are made from pig.
In your opinion, determine whether or not those wounds were caused by a dog.
No.
Why?
Because I don't know anything about how the specimen was sampled. First of all, none of the samplings came from the arm of Mr. O'Keefe itself.
What do you mean by sampling?
The samples, the swabs that were performed and sent
from
to
the
the laboratory, none of them came from the arm of the decedent. Secondly, I don't know anything about how the samples were actually obtained from the evidence and what the state of the evidence was, if they actually sampled the correct area. I don't know if there was any continuity of evidence. And then finally, any test can have a false negative result. So the absence of canine DNA does not mean that the canine DNA did not exist. It just means that they didn't capture it.
To your recollection,
oh,
did the
woman.
autopsy report
That needs to come into trial. That was not in trial. They did not get that testimony in trial from anybody. They sampled the shirt and they found pig DNA. And I want someone to get up there and say, most dog treats are made from pig.
The autopsy
Pig's
report,
ear,
no.
Is there
pig
any
skin.
mention whatsoever in the autopsy report about dog DNA testing for analysis?
No.
Do you have any
Ding, 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 ding,
information
ding,
that the
ding,
medical
ding,
examiner assessed dog
Is it me or am I looking
DNA
slimmer?
in the autopsy report?
I'm looking
I didn't
snatched.
see anything like that.
That's what 12 pounds will get you.
Yes.
I need to retrain my bangs. It's only my first week with them. Maybe a week and a half. They're getting better. My hair's not used to laying this way. Y'all, this is great testimony. If they get this woman in and all of this testimony in, sorry, I'm crooked. Maybe I'm making it worse. If they can get all of this testimony in, I think this is good. Don't you hate it, ladies, when it's crooked, twisted? Men don't have to deal with that. Oh, y'all.
Your Honor, with the court's permission, I would like
I like
to
this guy.
start with publication. And I'm going to have several exhibits that I would request your permission to publish. And I would appreciate starting with the Commonwealth's Exhibit 8. And I want to make sure Your Honor is aligned with the exhibit book with the numbering. And I'll
Lost
do
12
that
pounds.
in any manner. If you want me to put 8 up, or you want me to come sidebar and show you what we have.
If these are all in order from the Commonwealth's photos, go ahead and put it up. And if you do know the number, let me know.
Number 8.
Okay.
And I believe Mr. Brennan and I are aligned on the numbering. This
The
is what
prosecution, now
is-
they get their chance. The prosecution is arguing and they're going to cross her and they're going to be tough. Let's see how well she holds up. But they're asserting, the prosecution, that this is not dog, but the glass from the vehicle. First of all, it's not glass, it's plastic. Second of all, if it did cut and scrape him in the manner in which they're saying it did, the arm would have had hit it. There's blood on the arm. There would be DNA and blood on the taillight.
Is 8.
Where's the DNA on the taillight?
Okay.
May I proceed, Your Honor?
Yes.
Guys, I'm listening. I've got to get something in my stomach. I have medicine without food. I'm going to go put a piece of toast on.
How do you
I'm listening. I'll be right back.
Because I've seen it before.
And have you seen it before in your assessment of the nature and cause of the decedent?
No.
Well, how have you assessed Exhibit 8 before today?
Before today?
Well, have you assessed Exhibit 8 at all?
I've seen that picture.
Do you have an assessment as to what you observe in Exhibit 8? Do you have an observation about Exhibit 8?
Yes.
What is your observation?
They appear to be blue jeans. They appear to have certain stains labeled with a small ruler. And I don't know the nature of the stains.
Is there anything with regard to Exhibit 8 that you believe is pertinent to assessing whether or not any injury from Mr. O'Keefe was sourced from a dog attack?
I can't tell.
Can we go to Exhibit 9, please? And if we could just, I'm sorry, Ms. Dianne, if we go back to 8. Is there anything in the autopsy report of the medical examiner of the Commonwealth that speaks to Exhibit 8 in terms of the assessment that the medical examiner made in the autopsy report?
I don't recall seeing anything in the autopsy report regarding that, but if you can direct me to a certain area.
Oh,
I can look at it.
that's fine.
Okay.
So, thank you, Ms. Green. We could go to Exhibit 9 with the court's permission?
Yes.
Thank you. Do you recognize Exhibit 9?
Yes.
How do you recognize it?
Well, I've seen that image many times.
And what is that image?
Well, it appears to be a hoodie, sweatshirt, hoodie-style sweatshirt. It's got multiple dark stains on the sweatshirt. There appears to be a large tear through the middle of it, which I believe was probably caused in the emergency room, because that's
why do you believe it was probably caused in the emergency room?
Because I've made those kinds of cuts in clothing before, having to get access to a patient.
Right. So what is the
that's
purpose of
commonplace.
making a cut like that on a piece of clothing, given your understanding of the nature of the injuries to Mr. O'Keefe?
He was in a very emergent situation, and they needed to get access to his body right away.
Okay.
So that's why they didn't have time to undress him. They just did the fastest thing, which is cut the clothing.
Do you have any other observations with regard to Exhibit 9 pertinent to your analysis?
Yes, there are multiple areas, particularly in the right sleeve.
I'm sorry to interrupt you, but Your Honor, may she use the laser pointer?
Yes.
Thank you.
There are multiple areas, particularly in the right sleeve,
I don't think your laser has yet hit. There we go.
that are labeled with triangular white signs, which are pointing to individual holes in the sleeve. And there were 11 of them that I saw on the sleeve, and there are 2 others on the chest area.
Have you, in your experience, assessed changes to clothing in determining the nature and source of those types of changes to clothing?
Yes. So
describe how.
Oh, clothing is important sometimes to determine more information about how a wound was inflicted. So for instance, it's used in determining gunshot wound, entry, exit, direction, etc. I've used it in stab wound cases where, again, determining where the stab wounds were and if they were offensive or defensive type wounds. So yes, and in this case, they have significance.
And what is the significance in this case?
Well, these wounds are primarily on the right arm, which corresponds to the injuries that were on the decedent, the right arm. And furthermore, most of those wounds, when you enlarge that photograph, are small puncture wounds, very small. And what's interesting about them, to me, is that in many of those wounds, the fibers, the clothing fibers, are actually headed out of the wound.
And what significance, if any, is it to you that the direction of the fibers are coming, as you described it, outside?
Well, it's very significant because, in training, we learned that we had to look at direction, for instance, of tissue and fibers to determine if a gunshot wound was an entry or an exit. Now, gunshot wounds, they only do one of those two things through the same hole. They either enter or exit. But in this case, we have fibers exiting the wound, which means that the offending object exited the wound. So the teeth exited the wound.
Objection.
Sustained.
You mentioned the word offending object. How did you, without stating what it is, did you eventually determine what was the, as you call it, offending object? You mean offending object, what caused this change to the clothing? Is that what
I
you
love
mean?
it. I
When you
love
say
the word.
offending object?
Yes.
I won't remember it, but I love it.
How did you assess what was the offending object that caused the change to the clothing as depicted in that right arm of the hoodie?
Maybe get to the form of the question.
Sustained. Just ask it differently,
Okay.
please.
Did you have a methodology to determine the cause of those changes to the hoodie sweatshirt?
Yes.
What was that methodology that you deployed?
So I looked at the location of those holes. I looked at the location of the wounds on the decedent. And although they're not exactly in the same location because clothing moves,
Mm-hmm.
they are generally in the same location of the wounds on Mr. O'Keefe.
Okay, with that, we're going to recess. I know that this is taking longer than you anticipated. Do you have any idea how much longer? And
Oh.
I'm not rushing you, Mr. Alessi, just do you know how much longer you might be?
Your Honor, my best estimate is 30 minutes.
Okay.
Oh my God.
Mr. Brennan, do you have any idea how long you might be?
At least a few hours.
Jim?
This woman deserves a gold medal if she's going to be up on that stand all day. Wow.
All right, I'll see you at 2 o'clock.
2 o'clock, Your Honor?
Yes.
So they're taking an hour break. So we're going to go to the other trial.
You
Stay down.
are muted.
Boy, he is still studying up. I like him. Lay down. Down.
Number 2
Down.
of your exhibits. This is what my list looks like.
Can I look at that?
Embarrassed to go to the judge. Pick the pins. Pick the
I'm cause of you being embarrassed and I, let me get,
Yeah. Move the mic. Wow. Okay. So we're going to keep that on hold. Now we're going to go over to the baby girl stabbing. You won't believe who gets on the stand, and I'm not going to tell you who. Here we go. Sentencing. Hey, out and about with Dianne. How you doing, love? We are doing sentencing. Hallelujah. We turn the volume on.
Case number 21CR0314, State of Georgia versus Chloe Alexis Driver.
Once again, it's low. Y'all need to tell me if it needs to go up because I'm almost 100% gained.
Court for purposes of sentencing.
All right. Defense ready to proceed?
We are.
Does the state have any evidence in aggravation of punishment?
Your Honor, we'd like to present a victim impact statement by the victim's father, and then everything else will just be proper.
The father shows up, y'all. Oh my gosh. I thought it showed.
State is
He didn't show up in court for the hearing, but he shows for this. I bet she is nervous.
Your Honor, the state's position is that
A lot.
counts 2 and 3, the felony murder count.
They're on
those
lunch
will be
break.
Vacated by operation of law based upon the jury's finding of guilt on the count 1 malice murder charge. The state would be asking for a sentence on count 1 of life without the possibility of parole. The state's position is as to count 4, the aggravated assault charge, that would merge into count 1. And the state's position is that as to count 5, cruelty to children in the first degree, that carries a penalty of 5 to 20 years, and that would not merge. So the state's request is going to be life without parole.
Do y'all think she's going to get life with or without parole? Life with
Does the
or
defendant
without?
have any argument about the
merger
and vacated counts as stated by Ms. Robert?
Yes, we do. We would be arguing that count 5 would merge by operation of law as well, with alleges the exact same conduct that is contained within count 1 that serves as the basis for the malice murder. The way the state charged it in this particular case is that it unlawfully caused the death of Hannah Nicole Driver.
There's a weird noise on their end. I cannot fix it.
Which is the exact wording, Judge, of count 5, by causing cruel, excessive punishment, physical, mental pain by stabbing Hannah Driver in the neck. So it is our position that.
And if you know, don't say it.
Underlying felonies and the felony murder.
Just guess.
A case that you would not be able, that would merge and would not be able to sentence.
No. No, I don't think so.
Okay.
I don't think so. Other than drugging her up. I don't know.
Does the defense intend to introduce any
What the heck is up with the white and black with the white glasses?
We're going to argue and then Ms. Driver.
Okay.
is gonna speak.
Let's do a little looky-loo. He's got a suit on. He's got a business shirt on. And under that, he's got a hoodie. And then kid glasses. What? He's already looking like a character.
All right, Ms. Crawford.
And he's got Legos. What? What?
Yes, Your Honor.
He's carrying a little thing of Legos. Kitty Legos. Let me show you. See?
Crawford, if you'd like to present.
I don't dare ask what that is. Ronnie,
And would it be acceptable for him to
wait
look
till you
at
see a
the
picture of him when he wasn't cleaned up.
I would prefer the witness stand.
Okay.
please.
That may be. And the Legos may be hers too.
Come on.
That's true. But he was an absent father. He wasn't there.
He doesn't need to bring anything up.
Oh, don't bring anything up.
You need to leave it back there, sir.
He wanted to bring his daughter's toys. What?
Can you raise your right hand? Do you solemnly swear or affirm the testimony you shall give will be the truth, the whole truth?
I agree. He needs mental health. Yeah, those look like,
You will move the
those are awfully, awfully big for kids, but
You have to talk
okay.
on the microphone, so it'd be better to sit so we can hear you.
Please sit, sir.
Can you state your name?
Benjamin Eliav Ben Michal.
Okay. And can you spell that?
B as in boy, E as in Edward, N as in Nancy, Y as in yellow, A as in apple, M as in Mary, I as in igloo, N as in Nancy. D as in boy, E as in Edward, N as in Nancy, hyphen, M as in Mary, I as in igloo, C as in cat, H as in hotel, A as in apple, E as in Edward, I as in igloo,
What an ass.
L as in Lucy.
Oh, I already don't like him.
Yahoo, I left out. E as in Edward, L as in Lucy, I as in igloo, Y as in yellow, A as in apple, H as in Harry.
I would be so irritated.
Can you tell us what your relationship was to the victim in this case?
The victim was my daughter, Hannah Nicole, driver Ben Michael.
And Mr. Benjamin, I want you to, or Mr. Ben Michael, I want you to tell the judge about what Hannah was like in life.
645 days ago, I had the most beautiful living daughter on Monday, the 5th of December, 2020.
Quit playing with the damn mic.
She was dressed in a tiny, prescient little pea coat that was also colored pea, curry yellow. We were at a rest stop in McDowell, North Carolina, and I brought her toward her favorite thing, the arbors, in the middle of the rest stop where the grass was green and the trees were tall and the roots were
You
old
lay
and
down.
ripped up. I like to call her Naima, which means pleasantness, and she was pleasant to all she came and encountered. The most pleasant.
What was her disposition and demeanor like?
While we stood at that tree, she counted every layer of the roots. She was 13 months old. She had had a penchant for trees since she was a month and a half year old.
Oh, bull.
She was sweet.
What?
There are babies that are planned. We know what the opposite of that is. But then there are babies that are planned.
Oh my gosh. Y'all get your BS meter. I want a BS meter I could pop up. 1.5-month-olds propensity to trees.
Child
What?
was deliberate, intentional, and the mental work of 2.5+ years prior to her 9.5 months in utero and her entrance into this world.
He's not
There are
that ugly, but not my
a
type.
very special sister with 3 babies. And by the last one, Eliana, we came up with a term. There are forward-facing babies and not forward-facing babies. I have an older daughter who's estranged, who you've heard about here, named Eiley. She was not a forward-facing baby. Eiley cared about mommy and daddy. You put her head in your armpit and you were wherever you were, and that was not Hannah Nicole. Hannah Nicole was a forward-facing baby, meaning when you carried the baby, she needed to see everybody and smile at them, everybody in the room, as if she almost had an innate nature of knowing that she had very limited time. She had to see everything, and she'd get really, she'd let you know.
Rachel,
She
be
needed to
careful
turn
with
around
that
if you were not holding her
C-U
face
word.
forward-facing babies.
Space
My
it,
sister's little
abbreviate
Eliana
it,
was like
change
that,
it,
a little bit
please,
older
next
that way.
time so I don't get in
She wanted
trouble.
to be taken around. She wanted
Thank
to
you,
count
love.
everything. And she was looking at those roots that day in her little coat, and she had her little curls that came over her hair. And that's my last really strong, close memory of holding my daughter, playing in those roots, those trees. Her disposition was just the sweetest baby. And I'm not saying that as biased dad. I've been around a lot of children.
It's on the naughty list.
It's like she was hosting everybody she met. We would run. I wanted to bring the little Legos. We would run. We would play. By the time she was
Hence the
13 years old,
Legos.
she had a real thing for little cars. We'd chase them around the room together. I'd crawl with her. Beautiful. She was really weird looking. And some babies have this and some babies don't. Between like 4 months and 7 months, they're like.
I'm
growing,
going to
some things
delete
are
it so
growing
we don't
fast,
get in
some things
trouble,
are growing
okay?
slow. By 13 months old, she was
Don't be
so
offended.
beautiful. I would like to, please. Yes, Katie. Please. Please, the court. This is me and Hannah together.
It's okay.
About a few months.
That's why we
This
don't
is
get you
at
out on the
really
first offense.
beautiful, inexpensive hotel room in Clinton, Connecticut, and they have massive floor space for a hotel room like this. And we were chasing those little cars around all day, these little rev-up cars. So this would be the second week of August of 2020 when we were down with my family, as will be depicted more clearly in better photos coming. And my brother-in-law.
I deleted her comment
Danielle Lewis, and
because
my
it had the
sister,
C
children. We're all here.
blank,
You
blank
can
T
present.
word.
This is in May of 2020. This is the San.
He's in a skirt.
Siesta Key, Sarasota.
He's in is that a skirt? And where's the little curls? Oh, don't worry. We'll let you know. I don't know where to, I have a list, but it's huge. She has no curls.
And we were spending a lot of time there. We were spending
And
time
see?
in Nokomis,
Down.
in Venice Beach, the adjacent smaller beaches, and we would come in her wagon. And
Down.
you can see what she's doing. See, she's not a passive baby. She would grab the handle of the wagon and look at me like it was the most fun thing to get and smile at Daddy at Dover, just to smile into my eyes and say, look, I'm leading the wagon. She'd do it every day. She'd take hold of the handle and say, I steer this.
Go potty?
This is my wagon. And this is in Clinton, Connecticut again. And you can see, if you want to see her nature, that's her nature. That's her nature. She was excited and happy and engaging, and she'd come up to you and want to just learn everything. She'd want to touch you and smile. She'd want to get inside you and let you know that you should be happy too. Grandma threw a tennis ball a little too fast. What? Yeah.
Get inside you? What? I have a problem with his language. That's creepy as hell.
Grandma threw a tennis ball a little too fast. What? Yeah, that's a picture from, you know, a little bit of the weirder period where some of the eyes are growing, things are growing a little too fast and out of line. And I know this
Weirdo
is the
period?
thumbnail for the court, but you know, since she was looking a little silly. So that was probably back at about April of 2020. This is my parents' living room, where she would come up to this piano over here, and she had a knack, and she would start. I'd be playing piano. I've been playing piano since I was 3 years old, and I would ensconce her and encompass her in all my music, and she would come in the middle, near the middle C, and she would start doing things that actually made sense. And then she'd look at you and she'd show you she could have a beat. My older daughter, Eiley, has an immense amount of musical talent, but she could never keep a beat, but she would come up with things. But Nim, naive.
Why are you
and
comparing
she
your
knew
children?
where the beat was. She knew where the beat of life was. She knew where to enter the room. She knew where to look at you. She knew where the camera was.
And are those the cars that you spoke of she enjoyed playing with?
No, these are very little cars that you'd pull and they'd zoom around the room. This is actually a toy that I had going back to when I was a child, and it has a revolver inside, like a revolving scoop, and it goes around, and it's funny, it like collects toys into its dump truck. This is a xylophone that was my sister's over here. Little cup. She rode that little Pumobile behind her everywhere in my parents' house, and she was amazing because sometimes as a mother you wanted to sleep a little bit more. Chloe would go over, Kui would go over, and she would open the bedroom door and lay back down, and she'd thunder down the hallway. She'd just crawl down because we had this whole area on the second floor, safe, the dogs in the kitchen, the stairs over here blocked, and she had this living room up the hallway to the bedrooms, and you'd hear her. My mom still imagines the beauty of her grandchild thundering down the hallway, crawling thunderously. She'd come and she'd play, and my Eiley couldn't leave her for 3 minutes, even when she was 12, 11 months old. Constant attention, not Hannah Nicole. Hannah Nicole, she got in the living room with her stuff. She'd make a story. You could leave her playing there for 20 minutes.
Anna,
she'd make up a world.
Nicole.
She'd put the dolls.
Oh,
she
God.
had things that 11 months old, 13 months old, she'd be piling cars. She'd be making a whole story and happily playing. And somebody comes, smile, go over, pet the dogs. This was her world. Everything here, Grandma made the entire house her world. That's why we were there.
Sir, the purpose of this hearing today is to give the court.
Look at that look. Pure evil.
Sort of the impact of the actions of.
Nobody can weigh the potential of the impact. When you lose Grandma and you lose Grandpa and you were not estranged, you have a life, a rich life lived. You have memories. It's painful. It's a natural process and cycle of life. When you lose a baby, when somebody entitles themselves by whatever precipitation, you can get into the moral philosophy if it is okay or not okay. Do you own your life? Can you take your life? But when you entitle yourself by whatever precipitations,
13 months.
by whatever precipitated your mind, without getting into the weeds, to decide you are entitled to take somebody else's life based on your opinion of whatever kind of mental illness, lack of mental illness, acting, pretending you're in mental illness, overlaying, masking, it doesn't matter. There is no wiggle room where you are entitled to take somebody else's life because of your impression or opinion. They are there to live life and discover what life is for themselves. The impact of losing Hannah Nicole, driver Ben Michael, cannot be measured. We sat around in the waves of some luxurious beach somewhere for 2.5 years, speaking tenderly to each other, dreaming our daughter. Before she was born, buying her the highest level, best things, doting on her. Nobody knows. Dianne doesn't know. Jeff doesn't know. Your Honor, you don't know. Nobody knows. She could have grown up and given humanity cures to things we don't even have diseases for yet. How can you measure the potential? How can you look at a father and say, the image I
He
have
didn't
of
show up to
5-year-old,
trial.
kindergartner, I lost the potential, I lost the view. The most unplanned child, to the most unprepared parents, is a travesty and a tragedy of the highest order that the parents may never be able to even articulate the pain and loss of.
Unprepared?
Now you're talking about a baby
No
who was not
parents that
planned,
prepared.
planned. A baby who was meant to put their best foot forward. A baby who was taught to have a moral and cultural consciousness that would give to humanity whatever she could possibly find as her niche and knack in the world. To measure the impact and loss privately, I'm a very hard individual. I've lived a very particular life in countries that are not here to get knowledge and find things. I'm not a good model for initial reactions. In other words, I'm extremely stoic. That doesn't mean there wasn't 13 months after, and every private moment when I screeched like a frightened 7-year-old girl. Where I sat for
what
3
about
months in a
boy?
van just screaming and screaming and screaming
Oh God, here we go.
that this woman believed that she was entitled to take my daughter's life out of this world because she stopped believing in having a moral consciousness.
I wouldn't want
and
you
the
to raise
duty
my
help
daughter.
Humanity, because she believed the girls who were with us, not that she didn't believe in polygyny. She didn't believe in the girls who were with us. She believed they were reprobate, second class. She believed she put in more energy and people did not reciprocate to her, and she quit around June 3rd, 2020, and planned Hannah's death because she planned to exit the world and take her daughter with her. She may have even abused her and felt that there was some issue on a phone call between
Oh, look
taking
at
the
that
girls to
look.
Connecticut when she said, if you don't get your ass back down here to the South as quickly as you possibly can, I will throw this baby on the floor because I'm tired of her screaming and I can't get her to go to sleep the way you do, which was a beautiful segue that I love spending time with my daughter, putting her to sleep. It was
I
like
bet
my
that's a
job
bunch of
to put
BS.
her against my heart. We spent lots of time rocking and going into sleep, and Chloe just had triggers from being raped and abused as a child, suffocated and jumped on by a drunken Eric
Thanks for
driver who
demonetizing
caused
me, you
her to
jerk.
be triggered by sleep. And she doesn't
Maybe
even know
not.
it herself. I apologize. I'm very emotional. And this is the impact on me.
You're not that emotional.
Nothing that actually happened to her would ever change her. I don't know that no sentence, maximum sentence, could ever get through to her in a way that she won't build a new identity, a new mask, change who she is, manipulate the next party. Chloe Alexis Driver wasn't a victim. She had the most power in our group. It was called her fits. I don't know what kind of a sentence would help her. I mean, the inclination to say death penalty, maximum. She believed she could take the life of a baby out of this world, a baby, any baby, and this beautiful baby who had this much potential to help the world, an impact that can't be weighed. Nearly unlimited potential. Can we see the others? Yeah. There's a whole nother email with the ones with the family. She didn't send that.
Your Honor, I have nothing further.
Mr. Hathaway.
I have no questions for this witness. You can sit down.
Thank you.
I need to play that part again.
You can sit down.
Thank you.
Oh, he's like, I got to get out of here.
All right. Mr.
I'll be
Hathaway.
right back. I got to grab the door.
Judge, I just want to be clear, and from what we talked about the entire 4 years that this case has been pending, what we talked about at trial, what we're here to talk about again today, is that Chloe Driver has never once disputed the events that occurred on December the 8th of 2020. We've always all agreed that this was nothing short of a tragedy. She's never denied or disputed that she killed Hannah. Never been any dispute either, but it seems to be all on the wayside that Chloe also stabbed herself in the neck 5 times and once in the chest to try to kill herself based on her mental illness. From the very beginning, this case has always been about Chloe's mental state at the time of the crime. That's it. It has always been about a young 17-year-old
That's as loud as I can make it.
individual with pre-existing mental health issues involved in an abusive, both physically, mentally, by a man more than twice her age. It has always been about years of abuse, coercive control, and living in this cold mentality that only exacerbated these mental illness. It is clear from the evidence that came before this court by both the state and the defense that clearly showed that Ms. Driver was suffering from severe mental illness at the time of the crime, that she suffered from the delusions that overwhelmed her and told her repeatedly for months that she needed to kill herself. There's been a documented history of mental illness in her teenage years and prior to the incident that occurred. We also heard about eyewitness testimony from individuals that were with her and experienced her during this time about her conditions and her subsequent deterioration. And that she had been asking for help and communicating this to those immediately around her because she was just getting worse and worse. During the trial, it may not have appeared at first glance to the court or to the jury that this case was about Hannah. It's always been about Hannah. We never disputed what happened with Hannah. But the only issue we were here to decide was to talk about Chloe's mental health. She's always acknowledged what her actions were, but it is also about Chloe. As Your Honor is aware, I have been involved in this case since the day that Chloe was discharged from the hospital. I met her on December 22nd of 2020 in the book-in area of the jail on suicide watch in a turtle suit in a room where I had to speak to her through a mail slot. She had nothing in her room. She had but a mat and a styrofoam cup for water. At that time, she was still suffering from her severe self-inflicted injuries, still suffering from her ongoing psychotic episodes, and grieving over the death of her daughter. Over the last 4 years, I have had the opportunity to watch Chloe not only battle her mental health demons and try to grieve and properly observe everything that had happened, but I've also noticed that she has also grown up and matured. I have watched Chloe grieve for 4 years over the loss of her child at her own hands, but also endure the loss of her own family, physically and emotionally, both her mom and dad, and any of the life that she had before December the 8th. There has never been a time since I've been involved in this case that Chloe has ever said, I am not responsible for what happened, or any attempt to deflect that. This case has always been about mental health and her mental state leading up to the event. It has never been about blaming anyone else for Hannah's death, but simply an explanation to how Chloe got to this point. It has always been about seeking justice for Hannah and for Chloe, asking the state to take all of this into consideration in resolving this case. As Your Honor is aware, we worked extensively with the state for years in an attempt to work out this case based on the facts and the circumstances and the extent of the mental health issues. And also in an attempt to explain exactly what Chloe, along with other individuals, have endured in a relationship with Mr. Benmichael. We ask for consideration of those very facts and not to treat Chloe just as any other criminal defendant charged with the crimes. That was what we were asking of the state. Ms. Driver sat down with the state, provided a substantial amount of information in an interview to the state in an attempt to explain everything that had happened to her. This past Sunday was exactly 4 years from the incident. Monday was exactly 4 years to the date that her parents found out what happened to their daughter and granddaughter. Mr. and Mrs. Driver had originally indicated that they wanted to speak on behalf of their daughter today. But every year at this time, the events of what happened on December 8th of 2020 hits them especially hard. They do support their daughter. Ms. Driver came to trial and indicated what she observed and what she felt. So we don't want to twist court to feel because they are not here today that they don't care, they don't support her. This is just an especially hard set of scenario and facts, but also around the time of the anniversary of the incident. There has not been a single day that goes by where Chloe does not think about Hannah, that she does not regret what she did, and would do anything to go back to that time and change everything. There's not a day where Chloe doesn't think about how this affected the very people she loved, and especially Hannah, the one person she knows she was supposed to protect. There is not a day that goes by where she does not wonder what her daughter would be like now at the age of 5, or what her life would look like if she had managed to get away from this cult and treat her mental health issues, which is what her parents had begged her to do. Chloe is, and always has been, remorseful for her actions. She takes responsibility for her actions and has had 4 years to be able to see and have insight now that she is medicated and diagnosed and away from that relationship. We are asking this court to consider everything we presented at trial and the hearings leading up to trial. We are asking this court to recognize, as the jurors did, that this was never a case in which Chloe did this crime to have Benjamin to herself. It has never been a case about selfishness or anything else like that with respect to the relationship. This case was always about being a severely mentally ill woman with significant trauma that fought and fought against her own mind until she was no longer able to do so. We heard testimony from all the experts and the witnesses about her deterioration in the months leading up to this. We heard about her behavior and the delusions from those who interacted with her during that time. This was never a situation where she was feigning or faking mental illness. 3 experts told us that. Witnesses told us that. There were evidence that she was experiencing these overwhelming psychotic symptoms and delusional compulsions, and that this was something that she fought every day and was very real. There was significant evidence that showed she acted in ways that showed she was losing her mind. She communicated that to the people who supposedly loved her. We all remember the testimony of Jason Spillers. We all remember his testimony about
Y'all, I have no idea what just happened. That is a little cray-cray. I apologize. I don't know what's going on, but that is a little irritating. Don't know. Me don't know. Everything just went. But let me get this back up and we'll be good to go. We're going to Zoom. This will go on for hours. I'd rather just hear her statement. There you go.
relation to the days we were watching her daughter die on video and reviewing the autopsy photographs. That is the reason the state brought that information before you. So I'll just like to make that clear.
All right, Ms. Trethewey and Mr. Kessler, if you want to approach as well, Ms. Jobber, you can come to the lectern and make any kind of statement that you'd like to. If you will place her under oath, please.
Want me here? Yes, I will. Okay. All right, Chloe, for the first thing I'm going to have you do is I'm going to have you raise your right hand. Do you swear the information testimony you're about to give this court will be the truth, the whole truth, and nothing but the truth, so help you God? I do. Okay. You're going to have to speak up. I know that you're fairly soft-spoken, so will you able to get that? All right, go ahead.
I appreciate the opportunity to be heard during this whole process. I am terribly sorry for many things in my life, but most of all for who was lost, and I always will be. Every single day I live with my guilt. I have drowned in sorrow and regret with such an acute awareness of it for so long, I never imagined there would be anything more than that for me. Quite frankly, I didn't believe I deserved anything more than just that. In the past, I genuinely believed I had to die every day for my daughter, to hate myself for my failure in protecting her. But I know now that life goes on whether I suffer or not, so I need to stop taking from it. I know now that I must live for my daughter instead and do the best I can to be kind and loving and giving, because that's exactly what being with Hannah taught me. I see her everywhere, in everything. She lives on and shows me that beauty can be found anywhere, even where I'm going, because I can feel her in my tears. I feel her in my friend's embrace. I see her in a stranger's kindness, in someone's undiluted joy at seeing their loved one. I hear her in people's laughter, and I know her most of all in my family's loyal love for me, even still. No matter how bad our losses, life can be good again, and this is not my end. I accept my punishment with peace, and I want it to be known for every person that has prayed for me, that our Father has heard you, and I have been given a contentment that the world cannot take away. My daughter's memory rests now, so I am able to as well. I want it to be said that no one ever plans to lose control of their own mind. This trial was only a snapshot of my life in mind. It's easy to review the past and say what could have been done differently. It's even easier to say what someone should have done. But that's just it. In the midst of a terrifying situation, you can't actually think. The horror and fear you feel clouds your thinking abilities and disconnects you from reality. So though I may not legally meet the definition of insanity as of today, I know in the bottom of my heart that I was, because I never would have done what I did had it not been for my decompensation.
Yeah.
In the end, we can't go back and undo the bad, no matter how much we want to, but we can learn from it and prevent it from happening again. I will continue to seek help for my mental illness because of this. I read once that suffering is cheap as clay and twice as common. What matters, though, is what each man makes of it, and I promise I will make the best of whatever you give me, Your Honor. Thank you.
Yeah, I'll stay. Yes. I have continued to think about this case after the verdict, as I am sure all of us have. I have been aware that based on the law, that my only real discretion in this case is whether to sentence you to life without parole or life with the possibility of parole. I am aware, as Mr. Hathaway
Jury found
pointed
her
out,
guilty.
that the parole eligibility in this state would dictate that you would serve 30 years of a life sentence before you were considered for parole. this was a heinous offense with evidence that was so graphic and traumatic that I began to do research on what kind of support and help we could give the jurors who were having to consider it.
It was.
A parent killing a child is something that just offends us on the deepest level. It is a wrong that just is unfathomable. It just cannot be understood. And it scares us because it is so contrary to just fundamental moral behavior and what we expect of the bonds between human beings. And I have all those thoughts. I have had all those thoughts in this case. I noticed throughout the trial and considered it as part of the tragedy, quite honestly, that there were really no family members here to support you, and that Mr. Ben Michael was not here interested in the outcome of what was going to happen to his child, the person who
Good for you, Your Honor.
killed his child. That was a very interesting dynamic to me. So I'm glad to see him here today. You don't need to speak to me at this point, sir. Your opportunity to speak has come and gone. Although the response I just heard doesn't do anything to make the whole situation any less tragic.
Did he?
But as I said, I'm glad to have heard from Mr. Ben Michael and to
I want to go back.
honestly,
Did y'all see what
try
he
to
said?
give
What
him
did he
some
say?
benefit of the doubt, understand
What did he say? I'm going to try and hear it.
as part of the tragedy, quite honestly, that there were really no family members here to support you, and that Mr. Ben Michael was not here interested in the outcome of what was going to happen to his child, the person who killed his child. That was a very interesting dynamic to me. So I'm glad to see him here today. You don't need to speak to me at this point, sir. Your opportunity to speak has come and gone.
Ooh, we're going to zoom.
Naive enough to suggest that you're
She goes on forever, y'all. She really does. She's so slow speaking.
I believe everyone acknowledges that, or at least based on the law and the testimony we heard in this case,
Oh, well,
that
you shouldn't have gone to jail.
borderline personality disorder, for example,
Wow.
is a deep sickness that is not treated just by medication, for example. You were treated in order for you to gain competency to be able to actually go to trial. I don't think anybody who's dealt with anybody with mental illness is naive enough to suggest that you're cured. And I know I don't mean that as a criticism or a punishment. It's just reality. You did a horrible thing. based on the evidence at trial and based on the particularly the mental health testimony, the court will impose the following sentence as to count 1, malice murder, life in prison with the possibility of parole.
There you go. She got the possibility
Count
with
2
parole.
and count 3
Hmm.
are vacated as a matter of law in that you cannot be sentenced to more than one murder count when there is only one victim.
I can't move the.
Count 4 merges into count 1.
I can't. I'll move it
I
up here.
agree with the state that count 5 does not merge into count 1 as it contains a
Gabby, that's what I had
an element,
yesterday.
that is that the victim is a child under the age of 18. That is not an element of malice murder specifically. So as to count 5, the court imposes a sentence of 20 years to serve in the state
I don't
prison
know.
system.
What's number 9?
Count 1. You have a right to appeal this conviction. You have a right to file.
Okay. I just cannot listen to someone who talks this slow in a courtroom. I am struggling to do that. This, I can't do it. Just absolutely cannot. Cannot do it. Never gonna do it. Never gonna do it. Can do it. Yes, you're right. It will be, Carmen, the Georgia Department of Corrections who will be responsible for addressing the mental illness and needs while incarcerated. But do we know what that entails? Group sessions, maybe counseling for a little bit, and meds. I don't think they have enough resources to properly handle it. And in fact, it is saying, and correct me if I'm wrong, Carmen, that prisons are becoming more of mental institutions than they are actual prisons, because the majority of the people in prison have mental issues. Hearing impaired, that word better come out of somebody's mouth. That is a cuss word. That's a 4-letter word in the deaf community. What's hearing impaired? What? You said Netflix, right? I'm going to go look. Come on, where's the number? Show me your top 10. And I don't have a top 10 right now. There it is, way at the bottom. Hearing impaired is not it. It's called the star. It's the donkey. Where did you see that? The star with the donkey. Number 1 they have right now is... Oh, you said Max. I'm sorry. I'm looking at Netflix. Did you say Max? I don't remember. Gotta go look. Hearing impaired is going to piss me off. No, what are you talking about? I'm lost because I pulled it up and 1,000-pound best friend. Let me relook at this. HBO Max last night. Okay, well, it's not top right now. Hard of hearing. Hearing impaired is like the N word. You don't, that implies they're broken and non-fixable. What? ASL Beetlejuice? There's ASL Beetlejuice? What? There's an actual ASL Beetlejuice? You gotta be crapping me. Oh, they have a woman interpreting it. Wow. Okay. I'm putting that down. I see their back. I see their back. They're not back yet. Holy crap. Are they doing in that more? Mm. It's either, I'm going to mute this. It's either deaf or hard of hearing. A lot of people don't like the word impaired because it's like visually impaired means that you cannot see, but that means when you get to a visually impaired state, it's like you got to have people drive for you. You got to have help. You're dependent. Impaired means dependent in a lot of people's eyes. Disabled is acceptable, but in the deaf community, impaired means broken, dysfunctioned in some way. Yeah. I'm sitting on a heating pad, toxic. Oh, no. I'm not preaching. I'm just explaining. Sorry, Ronnie. Didn't mean to go on. So the bad thing I think about incarcerating people, well, there needs to be places for inmates that have mental illness and need incarceration, but the bad thing is they get thrown in with general population. I'm not saying they need to be put in a, hospital situation where they don't see anyone and put them in a lockdown, but I would like to see them have facilities that's not a state hospital, but is a prison that caters to the mentally ill people. And then you have prisons that don't cater to mentally ill. I don't know. There needs to be a place that the inmates can be housed that really focus on the mental illness, really mental illness. There are hospitals in jails, but you have to be a certain level of mentally ill. And some people aren't that level, like borderline personality. Borderline personality disorder may not fit that mold, where someone who's actively in a schizophrenic state would be. I just don't think that the prisons have become capable. My shirt's rolling up. Sorry, it's with this heating pad. I don't think our prisons are capable of handling them, and I think that they need a lot of training and more professionals. Yeah, and just because somebody has a mental illness doesn't mean that they can't function. They just need to be medicated. They need to learn how to manage that mental illness. They need to be educated. I don't think she's educated. I don't think she knew how to handle any of it. And I think a lot of what affected her mental illness was the man that we just saw. Mm-hmm. Yep, we do. We do. The more we learn about mental illness and what's going on with our mental illnesses, the more we need to look at what we do and change it. Well, it's the deaf perception, and the word that they're looking at is damaged, broken. And you're right. You're right. Weakened, damaged, you know, just for safetyness, just to not have, if you ever come up to a deaf person, don't say, "Are you deaf or hearing impaired?" Just HA, hard of hearing, deaf, deaf, or deaf, hard of hearing. Yeah, I agree. I think, though, after 30 years, if she does her time right and she does what she needs to do, she'll get some freedom at some point, I hope. I have to say, I think that this young woman was groomed and is a victim herself. And that's where I think our laws need some adjusting. Our laws are not accommodating for victims of criminal activities who commit crimes because of what they've been brainwashed to do. I may be wrong. Carmen, correct me. But the laws don't take, and a lot of laws don't take that into account. It's either black or white. There's no gray. Well, for a long time, I used hard of hearing because without my hearing aids, and I got it, this ear's driving me crazy. Without my hearing aids, I could hear a little bit. I could hear something. So that was hard of hearing. But when it got to the point that without my aids, I'm legally deaf and I really can't hear, and I rely solely on lip reading, I now identify as deaf. But I know fully deaf people who identified as hard of hearing because they don't want the stigma of deaf. So each to his own. Yeah. I think that if you are found guilty with a mental illness, that you should not be forced into maximum punishment. And I think it needs to be case by case basis because obviously in this trial, it was made very apparent and clear that this woman was groomed and in a CU blank blank T. And she was in a bolt. And in that bolt, why is my... And in that situation, it got desperate and she lost her mind. And does she need to take accountability? Yes. But to the extent, I don't know. I don't know. There needs to be something different because throwing them in the jail and locking, oh, snap. Oh, look at her face, y'all. Something's happened. Are you kidding me? Okay, let's look back. I'm going to watch this. Again. Looks like somebody died. Not really. I hope it wasn't the woman we just saw. She's in disbelief. Are you serious? What are we going to do? She needs to cover her mouth. I can't read that. That's too far away. I think that's what she said. I'm not 100%. Dang. Ooh. I'm just saying that if you want to sentence her to life in prison with the possibility of parole, that's fine. But I would like to see her spend 10 years of that, or however long it takes to get her balance in a facility that deals with the mental illness. Do a combination of treatment and jail or prison in this case. Just throwing them the way that they are doing it is not okay. Put them in a facility where they can get treatment and then let them serve out the rest of their time, not additional. Count the time in the facility. I don't think that had anything to do with it. That would have been funny though, but I doubt it. I think it has to do with her case because they still yakking.
I got it.
Yeah, no. But what I'm saying is that's the gray area. Maybe not life in prison, maybe 50 years, 30 years in prison with 10 years of that in a mental institution, or until they deem, or let me get the sound off, 30 years in a mental institution until they deemed her well enough to go into a prison environment. Get her counseling, get her therapy. She's so young. Let her discover who she is. Let her mature. Let her grow up. Yeah, exactly. Actual treatment facility, therapy, the whole 9 yards. Hey, K-Swan. Yeah, but who's going to fund it? Who's going to build it? Our prison systems are so dilapidated right now. We're not building new ones, and the ones we have are falling apart. Prison system is very old. The buildings, the facilities, and they're falling apart. I'm sure.
Great, thank you.
That's the whole society. Yeah. Society is like that. Okay, I'm going to make a comment that may piss some people off, but this is my channel, and if you don't like it, I apologize. I hope you can give me grace. But all the money that's being spent on people that should not ought be living here or not living here legally, and I'm not getting into that debate, but there's a lot of money spent on a lot of stuff that doesn't need to be or shouldn't be, that could be put into other programs like improving our prison system and maybe building wards and hospitals for mentally ill and improving that part of our nation instead of just throwing money at all these other countries and all over the place. I'm not going political, but I'm just saying. I think the money is there. It's just nobody wants to spend it there. They rather spend it in other places. Am I in trouble?
Dianne, where's the best location for you?
There's too much money being
Is
spent.
it like okay where I've had it? I don't want to be
It's
too
like,
loud.
who gave?
Oh, don't
I'm sorry, this heating pad, I love it, but it's crinkling up. I'll turn it off for a minute. I don't care who you voted for. I'm not going into the politics. But when you have one person who ran for president who had or spent over 90 something million dollars to run for president and owes a lot more money additionally, why aren't these rich people putting money into the system to help? Yep. I'm in the process
Tell my
of
family that.
my papers on this stuff. It's okay. I accept that, but no politics. Pineapple. I know I said something that kind of hinted, but my thing is, if people truly cared about fixing the system, then put your money where your mouth is. Yeah. Wait, is that the Livingston or Bastrop? Which one are you talking about? Huntsville? I know the Bastrop one quite well. Been to Huntsville too. Oh, y'all. Even with the AC, you walk in there and it is like the worst locker room you've ever smelt. Yeah, every town and city has them. Polunsky. Oh. They're going to ask, what did you talk about with the lawyer? How much you want to bet that the prosecution's going to ask her, what did you talk about with the lawyer during your break? How much you want to ask? Polk County? I didn't know there was over there. I hadn't seen it. I hadn't seen it, love.
You are unmuted.
Judge, we're back on the record on 22117.
That's hot up there and humid as hell.
I'll remind the witness you're still under oath.
All right, doctor. Thanks, Joe.
I need to come visit you, Carmen. We need to have a girls' weekend. Excuse me, I got to stand up.
Thank you, Your Honor. May I have Exhibit 10 published, please?
Oh, I'm in blue jeans today, and sometimes they, you know, you got to stand up.
Dr. Russell Wood has been published on this.
Wow.
Is Exhibit 10. Do you recognize it?
Yes,
How do you recognize it?
because I've seen it before.
And please describe what it is.
So it is a hoodie, a picture of a hoodie sweatshirt with multiple defects in the arm area.
And
That happened here too.
those multiple defects in the arm area.
Yes, I've looked at them carefully.
And what is, please describe your assessment.
Well, there are multiple small holes in the fabric.
Number one seems to be the
sweater, in
biggest.
arm. And I believe I said earlier 11, but it's a total of 11 for the whole
Sleeve.
shirt. So there are 9 holes here in the arm, and then in another section there's other holes.
Does what is depicted on Exhibit 10 constitute a pattern in your judgment?
Not Specifically, no.
Because the sleeve is loose and movable material.
If any, conclusions do you draw from Exhibit 10 pertinent to your testimony here today?
Well, with that image, in conjunction with the picture of Mr. O'Keefe's right arm, my conclusion is that he was wearing that article of clothing when he was attacked.
And how do you reach that conclusion?
Well, again, the holes, the holes are rather small, which would correspond to holes created by a tooth, or in this case, maybe multiple teeth. And they are in the area of the arm, or the area of the body that corresponds with the wounds.
Have you ever in your career, either as an emergency room physician or a forensic pathologist, ever had to assess wounds in which the victim was wearing clothing?
Yes.
How many times would you estimate that you had to, or that you did make an assessment of wounds when the victim was wearing clothing?
Probably over 200 times because the clothing examination is part of the examination conducted by the forensic pathologist in the Los Angeles County Medical Examiner's Office.
And did you, in fact, as a forensic pathology in Los Angeles, make assessments of wounds in forensic pathology with regard to a victim that was wearing clothing?
Yes.
Did you ever make that assessment in connection with dog-inflicted wounds of any kind?
No, I don't think so.
Are you familiar with whether, or strike that. Did Dr. Sporty Bello, in her her autopsy report, make any assessment of the clothing?
Yeah. So I'm sustaining it. You can ask her differently. You can ask it differently.
Dr. Russell, do you recall any discussion in the autopsy report of the assessment of the clothing that the deceased was wearing?
I don't recall.
If we showed you the autopsy report, would that potentially assist you in your recollection?
Yes.
Do you have it with you still?
I do.
Go ahead, you can take a look at
Yeah.
it.
Thank you, Your Honor.
Bless you.
Thank you.
Let me see. Is there a particular location you'd like me to?
Your Honor, I am not able to answer that question because I can predict what the response may be. So I would
just-
like to. but I-
Go ahead and take a look at it. And if you can't answer the question, you can't answer the question.
Yeah, I do recall what she meant. She said that the body is clad with a pair of socks.
Right. Did she make any other assessment of clothing in the autopsy report, particularly with the arm of a hoodie? Take your time.
Yep.
Since the report's in evidence, if you want to suggest a page, you can.
I might be suggesting a negative, Your Honor.
Okay.
I'll proceed with whatever way you.
Is there any objection to just answering this question? Okay. Okay. All right. Go ahead and suggest the answer to her.
Is it correct that the autopsy report does not contain any assessment of the clothing as being relevant to a nature and source of the wound of the deceased?
I reviewed
Oh
the autopsy
my
report
God,
very
Ronnie,
thoroughly,
that kitten
and I don't
is
recall any
so cute.
description of this.
Thank you for the leeway.
I love it.
Your Honor. Now let's, if I could, Your Honor, publish Exhibit 11.
Okay.
Thank you.
Bye, Carmen. Hey, contact me. I wanted to see if you were free for Sunday night. Are you free Sunday night?
It's the back portion.
Love to have you. We got a lot
Same
to
hoodie.
talk about.
Same hoodie. Did you assess the back portion of the hoodie as depicted in Exhibit 11?
Just by the photograph.
Yes.
Yes.
Did you reach any conclusions with regard to Exhibit 11?
Nothing.
Was there anything relevant that you determined from Exhibit 11?
Not that I recall was significant.
And was
Yeah.
Exhibit 11, in your judgment, necessary,
Oh,
assessment of it necessary to
okay.
render the opinions and conclusions?
Maybe we'll
you
do it
had
another day.
testified to
Maybe
here today?
Tuesday night, Wednesday.
Well, you should. I mean, the person should look at all the evidence, yes.
Right. And so after having looked at Exhibit 11, what is your conclusion as to whether it informs the question of the nature and source of the injuries?
It doesn't help.
With regard to number Exhibit 12, Your Honor, if I may have
Okay.
that published. Do you recognize Exhibit 12?
Yes.
What is it?
So this is a close-up of one of the holes that is on the right sleeve of that hoodie. In the, in the part that you can see from the anterior view.
The anterior view, but is it the anterior or posterior of the arm?
It could be it could be posterior because you only get it depends on how it's worn basically and how the material lies, way it's photographed. So I meant anterior view meaning the picture, the first picture we saw, which was generally the anterior view of the hoodie.
What assessment did you make, if any, with regard to Exhibit 12?
Well, it's a small hole. It is consistent with a puncture created by a small.
Okay. Remember I told you that the back of the teeth have a little sharpness? See the hole and then the tear? That looks like a dog bit into it and it tore.
Objects such as a canine tooth. And it appears that some of the fibers are actually pointed outward. Some of the clothing fibers are pointed outward from the wound, from the hole rather, from the hole.
And did you draw any conclusions with regard to this exhibit?
This exhibit plus close-ups of some of the other similar holes with the fibers pointing out means that whatever inflicted that hole also came out of the hole.
You say whatever inflicted that, did you reach a conclusion as to what inflicted that hole, or as you've referred to it as defects previously?
Yes, these are consistent with dog bites.
Mm-hmm. Or puncture.
If we could publish, Your Honor, 13.
Okay.
Thank you.
They did. Well, after this, the
recognize
dog did
13?
attack two women and a
This
dog,
image?
Yes.
and
Yes.
then it got
What is it?
gone.
Similar to the
Shortly
other. It's, just,
after.
it's in a different location on the arm.
Did you make an assessment of what is depicted in Exhibit 13?
Yes.
What assessment did you make?
I believe this was inflicted by a dog tooth, a canine tooth.
Once again, you have that hole here, but this could have been the tooth next to it. Or because you got fabric in between. So this does look like the canine and a tooth next to it.
And again, the fibers are pointing outward.
How did you make
I'm getting the afternoon yawny.
Well, it's generally small and round. So
Oh, 1 and
and
up.
the canine teeth are the teeth that stick out the most. when a dog bites. So this is consistent with a canine bite.
I think if she testifies, Karen Reed
Your
has a
Honor, may
good
I have
chance of being a free woman.
Yes.
Do you recognize what is depicted on Exhibit 14?
Yes.
What is it?
It's a similar wound on the arm area of the hoodie.
Similar
But this
pair.
wound had this, hole, similar hole, except it's a little larger in one dimension, and given that cloth has some stretching capabilities, and there was movement between the victim and the dog, the stretch was caused by the tooth.
How did you determine there was some movement in the victim and the dog?
Because he was alive, and
Who stands still when they get attacked?
And it is normal behavior to move, and also just the configuration of the wounds we discussed earlier. There was some movement around the elbow area.
Your Honor, may I have 15 published?
Yes.
Thank you.
I so want a nap.
Do you recognize what's depicted in Exhibit 15, Dr. Russell?
Yep, there's another little hole there.
Yes.
How do you recognize it?
Well, how do I recognize it? Because the
First of all, if it was a car piece of plastic glass, it wouldn't have a straight puncture. It would be more of a cut. Punctures, tears, and cuts all react differently.
clothing pattern is very similar to all the others. I saw this previously. And again, it is a picture of the sleeve of the hoodie.
Dang it.
Which sleeve, right or left?
Right sleeve.
Please continue.
And it has a hole. This hole is longer than it is wide. And, but yet it still is consistent with a
puncture
tooth entering through there.
And what conclusions, if any, did you draw from what is depicted in Exhibit 13?
That this was part of a dog bite.
And just so the record is clear, are all of these holes or defects, as you've referred to them as in the hoodie, are they all on the right arm?
Yes.
Okay. So let's go to, or excuse me, Your Honor, may I have published Exhibit 15?
Yes.
Thank you.
I appreciate his professionalism. I really do.
Do you recognize that?
Gosh,
Yes.
I'm ready to go to sleep.
No, it's the same one.
May I have 16 published, Your Honor?
Yes.
Dr. Russell, do you recognize what's depicted as Exhibit 16?
Yes.
What is it?
So it's two holes. Generally,
I'm sorry to interrupt you, but you say there's two holes. Is there anything that is a marker on this picture that shows you that are two holes?
very good. Yes, there are two holes, one labeled number 3, one labeled number 4. They're in close proximity to one another. And number 3 is round, number 4 is a little irregular, but generally round.
Thank you. And what
Not
assessment,
if
any, did you make with regard to what is
toxic. I love you. But girl, what does a cop and familiar with canines have to do with playing devil's advocate and him have it stay still? Anytime a dog is going to aggress, the first thing you do is this, which is the safest thing for them to bite, would be your elbow and arm because it's really thick and heavy bone. Number 1. But number 2, you ain't going to stand there still. Girl.
depicted
I saw my
in
grandma.
Exhibit 16?
I saw my grandma and I almost started saying, My grandma got ran over by a reindeer. I just, yeah.
I believe that
I'm
this
so
is
sorry to hear that.
consistent with two canine teeth penetrating the fabric.
How do you reach that conclusion?
Because they're separate. Unfortunately, they're in that image. There's no ruler.
I'm sorry.
Yep.
There's no ruler.
I know where
No
you're going,
centimeter-
Toxic. I'm being
centimeter
a
ruler in
snot.
that particular image, but
He got in that.
But they're reasonably close by, so
Guard
it
the
could be.
body.
And,
Give him the elbow.
Could be
inflicted by two canines in the same bite.
Yes, thanks. And what conclusions, if any, did you reach with what is depicted in this exhibit?
I think I just said it. Yeah.
May I have published, Your Honor, 17?
Yes.
Thank you.
Please.
Do you recognize what is depicted in Exhibit 17?
In this exhibit?
Yes.
Yes.
What is it?
Again,
My
it's a
honey
close-up of the
pots.
hoodie, the sleeve of the hoodie, and there's a defect in the fabric, and there's a label on it indicating it's number 4.
And did you assess Exhibit 17 before today?
Yes, I did.
What conclusions, if any, did you reach with regard to what's depicted in Exhibit 17?
I believe it's consistent with a puncture of the sweater.
And did you reach any conclusions with regard to the cause of the puncture?
Well, taken in totality with the other images, I believe that these are all the result of multiple dog bites.
Your Honor, may I have published 18?
Yes.
Thank you. Do you recognize 18?
Yes.
What is it?
It's another defect in the sleeve of that article of clothing.
And if I could impose upon you, could you go back to 17, please? Your Honor, may I go back to 17
Yes.
quickly? Thank you. Do you know which arm of the hoodie?
I did love.
This
You're right.
defect, as you call it, occurs in, right or left?
Right.
That's what we're trained.
Your Honor, may I go now to 18?
Yes.
Thank you. Please continue with your assessment of what is depicted in 18.
It's another defect of the arm, of the right arm of the hoodie.
Another
And
inclusion.
it's generally circular in configuration. This seems to be fabric fibers exiting the wound.
And any further assessment you made with regard to what's depicted in Exhibit 18?
No, similar to the above, previous.
Did you reach any conclusions as to the source of the whole defect, as you referred to it in, as what's depicted in Exhibit 18?
I believe it is from a tooth of the dog.
May I have, Your Honor, published 19?
Yes.
It could be a wolf. Could be a coyote.
You recognize, Dr. Russell, what's depicted in
Could be a big monkey.
Exhibit 19?
Yes.
What is it?
So it's multiple defects in close proximity to one another, circular defects generally, but there's at least 1, 2, 3 in that image.
Did you make any further assessment of what is depicted in Exhibit 19?
I believe these are from the teeth of a dog.
Are you able to tell which teeth of the dog made those defects?
Not exactly.
How is it then you come to the conclusion it is from a dog's tooth when you say that you're not able to tell which tooth?
I didn't understand the question.
In your experience,
Mhm.
are there times where you conclude that a wound is from a dog, but you don't know which specific tooth of the dog that caused it?
Yes.
And do you, okay, thank you. If we could, Your Honor, please publish 20.
Okay.
Thank you. Do you recognize what's depicted in Exhibit 20?
Yes.
What is it?
Again, the a picture of the right arm of the hoodie.
And what is your assessment of what's depicted in Exhibit 20?
I see a small defect near, and it's labeled number 6.
And what is your conclusion as to the nature and source of the defect?
I don't really have a conclusion on this one.
Your Honor, could we please publish 21?
Yes.
Do you recognize Exhibit 21, Dr. Russell?
Yes.
What is it?
There are 2 defects in the right arm of the hoodie. And there's a ruler. They're about 3 centimeters away from.
And had a bloody nose, black eyes, a big bump on the back of the head, and all the blood went down the shirt and down the pants, which means he was vertical for a little bit after he bled. If he was hit by the vehicle, he would have gone back. Where would the blood go? Back. Blood flows in the direction of gravity. So if you're vertical, it's going to go down. If it's horizontal, it's going to go down.
From one another.
Hope that made sense.
Did you reach any conclusions with regard to what is depicted in Exhibit 21?
Yes.
What conclusions did you reach?
They're from dog.
And how did you reach that conclusion?
Because they're consistent in appearance with a defect that would be caused by by canine teeth.
May I have published, Your Honor, 22?
Yes.
Thank you. Dr. Russell, do you recognize Exhibit 22?
Yes.
And did you make an assessment as to what is depicted in Exhibit 22?
Well, it's a photograph of the right arm of the hoodie with the number 7 label pointing to a particular area.
And
a lot of weighted things that could have caused that. Yep.
From what's depicted in Exhibit 22.
On this particular projection,
I think the possibility that there was a fight because the men were fighting, the dog got involved, which is not uncommon. I've seen that happen because they're trying to protect their owner. And then somebody grabbed a weight and hit him on the back of the head. There's just there. That's all she wrote.
Projection.
They
I
moved him
can't
outside.
Really
That's
see the
plausible.
defect. So,
Your Honor, may I just quickly go back to Exhibit 20 and 21 for one
Okay.
question with each? Thank you. Which arm of the hoodie is depicted in Exhibit 20?
the right arm.
And if we could please, Your Honor, go to 21. Which arm of the hoodie is depicted in 21?
The right arm.
And if we could go to Exhibit 22.
And
You
the
answered,
son
the record clear,
was
please.
never
Are you able to
investigated,
which arm
looked
of the
at,
hoodie?
photographed, or interviewed.
Exhibit
He just so happened to be forgotten
Well,
and was out
yes,
of the
because
picture.
I know that the only labels placed on this article of clothing were in the right arm area and the chest. And this contains a label, so this is the right arm area.
How do you know that? How do you know
Because we
that the only labels were placed on the right arm?
Because we saw the overall picture.
May I have published, Your Honor, 23?
Yes.
He's good.
You recognize what's depicted in Exhibit 23, Dr. Russell?
This one?
Yes, do you recognize that?
Yes.
What is it?
So it's it's a close-up picture of the right arm of the hoodie. And there's a number 7. And number 7 is pointing to a defect, small defect, several millimeters in length on that fabric.
If he had, you would have seen.
In these pictures,
That's where I have issue with the responding PD. If he had crawled, you would have seen it in the snow. To a certain extent, they did not protect it. Yeah. They got a blower and blew it everywhere. I blew the snow to Kingdom Come. There was no evidence of
Well, they
crawling
give an
on his
overall,
clothes, right, or in the grass.
measurement of the wound of the holes, the defects as they currently were when the photograph was taken. But we have to keep in mind that fabric stretches, and when it dries, it contracts. So that has to be kept in mind when making assessments. So the size right at the time that picture was taken could be.
If the glove doesn't fit, you must acquit. Remember OJ? The glove? Why did it not fit? 2 reasons. 1, they had him put a rubber glove on. You try putting a rubber glove on and then putting a tight-fitting leather glove on top of the rubber glove. It's not going to work. Number 2, it was saturated in red liquid, and so it would have contracted. So there is no way that in the condition it was in court, it was going to fit. Now, prior to it being soaking wet with red liquid and not having a latex glove on your hand, it might be able to be worn.
Be different than when
Yep.
The injury was inflicted.
That's why if I was on the jury, I'd be going, not lip.
in this
Don't believe it.
photograph or any of the photographs.
I'll be right back. Comfort break.
In determining whether or not a given defect is from a dog.
Yes, they do.
How?
Because there are several of them. The configuration of the collection of the defects are in a certain area, and actually it's the area that corresponds with the area of the decedent's arm where the injuries were. And they're significantly smaller than, for instance, what you would see in a gunshot wound.
Your Honor, may I please have published 24?
Sure.
Thank you. You recognize what's depicted in Exhibit 24, Dr. Russell?
Yes.
What is it?
That's another defect in the right arm, closer to the sleeve or cuff of the arm of that particular hoodie, and it's labeled number 8.
What assessment, if any, did you make of what's depicted in this exhibit?
It's consistent with the dog bite, and fabrics are pointed outward.
Why is it consistent with the dog bite?
Again, the size.
I'm sorry.
The size.
The size
Yeah.
of the hole?
The size of the hole, yes, taken in conjunction with all of the rest of the holes.
All the rest of the holes in the other photos?
Yes, that we just discussed, yes.
Your Honor, may I have published 25?
Yes.
Thank you. You recognize what's depicted in Exhibit 25?
Yes.
What is it?
So it's again the right arm of the hoodie. It's down by the edge of the sleeve towards the wrist area would be.
It definitely
and
would.
It shows 2 defects, one of which is labeled 9. The other one I don't know the number, but it's labeled.
What conclusions, if any, did you reach with regard to what's depicted in Exhibit 25?
Dog bites.
How did you reach that conclusion?
Again, those holes are consistent with the other holes on the sleeve. They are present on the right side of the body. Now I know, and one has to keep in mind that when someone is wearing an article of clothing, as the person moves, the clothing can move in relation to the arm. So even though that is the cuff area, we don't know exactly where it was on the arm when the bites were being inflicted. I don't know if that made sense.
It did to me.
Okay.
Your Honor, may I have published 26?
Sure.
Thank you. Dr. Russell, do you recognize what's depicted in Exhibit 26?
That appears to be a similar photograph to the prior one, just the exposure appears to be a little different to me.
Which arm of the hoodie is depicted in Exhibit 26?
Right on.
Could we briefly go back, Your Honor, to Exhibit 25?
Yes.
Thank you. Which arm is depicted of the hoodie in Exhibit 25?
Right on.
Your Honor, could we go back to 26, please?
Yes.
Thank you. What assessment, if any, did you make of what's depicted in Exhibit 26?
That these were inflicted by the dog.
How did you make that? How did you make that assessment or conclusion?
Because they're similar in general appearance to the other ones on that right sleeve, and they're smaller
Including
size.
the dog DNA.
And this is the right arm of the hoodie.
Correct.
Your Honor, may I have published 27?
Yes.
Thank you. Dr. Russell, do you recognize what is depicted in Exhibit 27?
Yes, I've seen that before.
What is it?
It's a defect in the chest area of the front of the hoodie.
What assessment, if any, did you make of the source and nature of what's depicted in that exhibit?
Yes, let me describe it a little bit better. It's labeled with number 10.
Yes.
And adjacent to it, of course, there's this big defect.
Can you use your, I'm sorry, Your Honor, may the witness use the laser pointer when she says this?
Oh,
Thank you.
okay. So this is the defect in question, labeled number 10. But adjacent to it, there's this huge defect right over here. It's going this way. And as being an emergency room physician, I recognize that as that large defect as having been caused by the emergency room personnel when they opened up the sweatshirt to have access to Mr. O'Keefe.
So are you saying that there's two different sources of what's depicted in this exhibit, or is it just all from one source?
I believe that they're two different sources.
Can you, with your laser, identify each one and what your conclusion is as regards to the nature of each one?
So this large one here, I believe, is from the scissor wound, the trauma scissors.
In trauma scissors of a medical professional in the emergency department?
Yes, or it could have been EMS personnel also. That's another
Understood.
possibility.
Please proceed to the next.
Yes, but then this other defect is different and it's separated. There's actually solid tissue, fabric between the two defects. This is separate.
I don't necessarily disagree with her on that. It is very close to this, and I have cut close, and then when it opened it up, we have double cut because it was folded, you know, like it's like this, and I'm cutting up, and then you open it, and you have two. But that does have a rounded and then a point. The shape is what makes me question if it was caused by the scissors. I wouldn't definitively, I would say possibly.
And it appears to have a little bit of a tail type
does.
configuration. So this
I'll give her that.
could have been inflicted by the dog.
You say could.
Mhm.
Is it could or is it consistent with infliction by a dog?
It is consistent with, however, there were no chest.
I'm sorry.
Okay.
There's a competing noise out there.
Yeah,
now.
yeah.
Just trying to see if it was going to die down. Thank you.
There were no chest wounds caused by a dog in that area. So it could have been that the fabric was loose, and as the
Dog grabbed it.
victim was pulling away from the dog's
Yep.
teeth caught it, but he didn't make contact, or didn't make contact with the skin. So I can't say for sure that this is a dog
Possible.
bite.
Right. So
A dog related tear.
So is it correct to say it's inconclusive whether this is from a dog, or is there no conclusion to be reached as to whether it's from a dog?
I don't know the difference.
Okay. I believe your answer is sufficient for the record. Thank you, Dr. Russell. If, Your Honor, we could please have published Exhibit 28.
Okay.
Thank you.
I like
Do
this
you
guy.
recognize what's
He's
depicted
so
in
calm.
Exhibit 28.
I've seen this image before, yes.
What is it?
It's
That's a scissor.
Front part of the hoodie. And there are two large defects. The one that's closer to the top of the image appears to be similar to one that would be made with trauma seizures by emergency personnel. The one that is below that, that's labeled number 11, I can't.
Stop your laser, because I just want to make sure I understand where you're pointing. You said below that. Can you just hold your laser as to where that is?
On the laser, you want to see what I'm?
If you could point, you said right
Yeah,
below
this
that.
one, yeah. So this is, the top one is what I believe is caused by trauma seizures.
Yes.
Below that in this image.
That's true too.
And labeled number 11
Yes.
is a very irregular defect. That's this one right here. And it's labeled number 11. I can't say for sure what caused it.
What causes you to use the parlance irregular? What is irregular about it?
Well, irregular means that it's not a straight line. It's not a nice circle. It doesn't have a nice edge to it.
Are you able to reach any conclusions with regard to what is depicted in Exhibit 29?
No.
Your Honor, if I could have published Exhibit 30.
Okay.
Thank you.
I think they were referring to 28.
Yeah, I think that last one was
I'm
28
sorry.
and 27 before then. I just thought I might have missed it. So,
No, you didn't. I did. That was my error. Thank
so
you, Mr.
29.
Brennan. I believe we are now on 29. It appears 29 is up, Your Honor. May I proceed?
Yes.
Thank you. Dr. Russell, do you recognize what's depicted in Exhibit 29?
Yes.
What is it?
It's an area of the front of the hoodie that is in the front, the interior of the hoodie.
Now,
And,
wait a
has
minute.
two
Do you remember?
labels, and-
Do you remember when I said if the fabric is kind of curled like this, and I'm starting to cut, and I grab some of it, and I keep cutting? That's what that looks like to me. That looks like the fabric. That's a rush, because when you're cutting, that's what that looks like to me. I may disagree with her.
Showing you
She
two
thinks
different
this is a dog.
defects, 12 and 13.
What assessment, if any, did you make with regard to what is associated with number 12?
Number 12 is a long defect, and by itself, I can't make any assessment.
Can you
But-
make it- I'm sorry, please continue.
Yeah, so, but next to, adjacent to number 13, which is another defect that's much smaller, The two of them in combination are suggestive of teeth marks.
Can you put your laser up and down? You said two. I think I understand.
Yeah,
what
so
you mean. There's one,
Yes,
and then where's two?
right here.
Understood. And why do you believe it's suggestive of dog tooth marks?
Well, dogs have multiple teeth. And so multiple teeth can cause individual defects. And the fact that there are two defects in close proximity to one another and oriented in the same direction makes me consider that it's possible that they were caused by teeth.
But not probable. Possible, but not probable.
And are you able to?
And once again, she is right. And we were talking about it. If someone is sitting there and they're moving and the dog is driving, he could get part of the hoodie, not on the sleeve. Don't disagree, especially if you're bending down and he's coming up. I can see that. It's possible, but probable? Nah, I'm not going to go that far. And I don't think she is. She's not ruling it out.
Location of where this is on the hoodie.
I might be wrong. I think it's the. I think it. No, I can't really say for sure because I don't know if this picture is upside down or not.
So the nature of the picture
Yeah.
does not allow you to make a conclusion that you're comfortable with regard to the location on the hoodie?
Yeah, individually.
Objection sustained to the form.
Understood. Are you able to reach a conclusion with regard to what part of the hoodie is depicted with reference to the 12 and 13 on this exhibit?
Not from this image only.
In combination with any other image, are you able to reach a conclusion as to what part of the hoodie is depicted by 12 and 13?
If we went back to the overall picture, I could try.
Do we need this answer from her?
We do not, Your Honor.
Okay,
I was actually going to the next one. Thank you.
Thank you.
Your Honor, may I have published 30?
Yes.
Thank you. You recognize what's depicted in Exhibit 30?
So this is a close-up of the previous picture of the anterior portion of the hoodie.
Previous picture meaning Exhibit 29, the one we were just looking at?
Yes.
Thank you. And how can you determine that from what's depicted in Exhibit 30?
Well, because there are two defects that are close together. They're labeled 12 and 13. And unfortunately, the ruler covers one part of one of them, but still I can see enough of it.
And what's your assessment of what's depicted in Exhibit 30?
They are consistent with being caused by a dog teeth, by dog teeth.
How do you reach that conclusion?
Well, because they're oriented in the same direction and they're close by.
What do you mean by they're with the laser? What do you mean they're oriented in the same direction?
So they're going, this 12 is going up and down in this image, and so is 13.
And why is that notable to you in reaching your conclusion?
Well, the teeth causing a defect would
Right back.
tear
Break.
along the same plane, the same, they'd make tears in parallel. That's same direction.
Any other assessment you make of what's depicted in 30?
No.
Your Honor, may we publish 32?
Okay.
Thank you, Your Honor. Do you recognize what's depicted in Exhibit 32?
Yes.
What is it?
This is a wound, a partially healed avulsion wound of a person's hand between the thumb and the index finger.
Do you have knowledge of whose hand that is that's depicted in Exhibit 32?
I do.
What is the person, do you know the name of the person's hand who's depicted in Exhibit 32?
think it was Lisa, not Lisa.
Do you have knowledge of how that wound occurred?
Yes,
How do you have knowledge of how that wound occurred?
because I read a report regarding a dog bite incident.
And what did you learn from reading that report about what is depicted in Exhibit 32?
That a dog named Chloe attacked another dog, and in the process, the woman whose hand that was bitten by Chloe.
Can you describe what is shown with regard to Exhibit 32 in relation to dog Chloe?
Well, this is a partially healed avulsion laceration.
From your experience, have you seen these types of avulsion wounds either as an emergency room physician and or a pathologist in your 30 plus years of practice?
I've seen them not infrequently in the emergency room.
Did you say not infrequently?
That's correct.
Is that another way of saying you've seen it frequently?
I've seen them many times in the emergency department.
Is this a wound of someone who is antemortem or postmortem, or are they alive?
This person's alive. This is an ante-mortem wound, and it shows many, many days of healing, maybe even much longer.
How can you tell that what is depicted in that exhibit, that wound, has, as you described it, many, many days of healing?
That might take years of medical school to explain, but there's the edges. First of all, it's not bleeding. Second of all, there's what we call granulation tissue in the wound.
What is that granulation?
Well, that's tissue that the body builds up. Oh, yes. So first of all, this most likely did not appear like this when it was first inflicted. What happened was the flap, there's a flap here, that skin was over here to begin with. But then what happened is that it became detached, and that's called an avulsion wound, where a piece of skin is detached, but not completely. So it still remained intact down here. Now, that area in between, so that, of course, skin contracts as it dries, and that area between here and there heals. The body heals itself, tries to close itself off. So it builds up this, what is called granulation tissue, which is basically new tissue to cover the defect so that infection doesn't set in. And that takes weeks, usually.
What is it that takes weeks?
That healing, that extent of healing.
And so is that wound the same as when it was initially made, or is it different from when the wound was initially made?
Very different.
How is it very different from when the wound was initially made?
When it was initially made, this edge here would be sharper. Right now, you can see there's rolled up tissue here, what appears to be rolled, and that's because it's healing. So this would have been sharper, and the tissue down in here would have been bleeding, or it would have had a crust if the bleeding dried.
Are you able, from this Exhibit 30, to give a range of when this wound was first made in terms of days or weeks?
Well, I think I did already. I think that it was at least weeks.
At least weeks? Alrighty, thank you. We can remove that. Thank you very much. Dr. Russell, today you have given various assessments and opinions.
Here we go.
Those assessments and opinions been based upon, among other things, your 30-plus years as an emergency medicine physician.
Yes.
And with regard to the same assessments and opinions, have those been based on your 30-plus years as a forensic pathologist?
Yes.
What I want to now move to, and I'm almost at the conclusion of my questioning for this point, do you recall testifying previously in the first trial with regard to rendering an opinion on whether the source of the wounds in Mr. O'Keefe's arm were caused by a dog or a large animal?
Yes.
And do you recall what your answer generally was in respect to a question of were those wounds consistent with a dog or animal bite?
Yes.
And do you recall what your answer was?
Generally, yes.
And generally, what was your answer to the question of whether the wounds were consistent with a dog or large animal?
Your Honor, maybe be a reference with prior testimony. I have no idea what specifically we're referring to as far as that.
Transcript, date, where it is.
Happy to give it, Your Honor. May I have a moment to give it?
Yes.
Well, we have a moment. I also add, I don't understand if this is.
And to know exactly where it is, dang.
The prior consistent statement. There should be some foundation.
So for what purpose are you offering this?
Your Honor, I would first like to respond to this preliminary hearing where, as you know, the rules of evidence are not strictly. The purpose I'm giving this, Your Honor, is not for impeachment. It's exactly for her to state, and if you would allow, Honor would allow me to connect up with the questions, it will allow her to state with regard to her testimony today, whether or not the opinion she has formed previously is the same opinion as she has formed. Is it the same?
Okay, so why don't you ask her what her opinion is today?
Yes.
And then just ask her whether it was any different than before. You can pull the page up if you have it. I have it here, I think, so just,
You don't need it?
so do you need it, Mr. Brennan?
Please.
I'm happy to provide it. Mr. Brennan, it is the June 21st transcript. Let me just double check on that.
Really does.
Your Honor, I don't want to take up the court's time. If I could hit an end.
Sure, I think co-counsel should be able to find it for you. So why don't you come on in and just ask her the question and sure Ms. Giannetti can pull it up.
Thank you, Your Honor. I'll let you support for that.
He's having to learn from system. He's nervous. This is huge.
Are the opinions that you have given today consistent or inconsistent with the opinions? Well, let me ask it this way. For the opinions that you have given today, how do they compare to the opinions that you've given previously?
I'm not oblivious to the attempt here. I object. It's not the proper form of questioning to go back and try to explain potentially inconsistent statements in today's testimony.
Is that what you're attempting to do?
No, Your Honor, it's not what I'm.
All right, so the opinions today, and I guess it's a matter of argument, right? I can be told with the previous, it was attached to the motion that's before me today, the transcript was attached, can see what her previous opinion is, and then I ultimately decide whether it's consistent or not. Right?
I agree with that, Your Honor.
I want y'all to see something. I want you to see. Now, this isn't to the extreme, but I want you to see something. Not to the extreme. Really? Why can't I see the window? There it is. Now I can see it. Let me get it up. Okay, look at this. Does that right there not look like a lot of John's bites? Right there, look at that. Look at that. There you go. That's a lot of what his look like, in my humble opinion. Just saying. Just saying.
So if you've got a site, I'm happy to look at the page to see if I might be able to figure out where you're going, or you can come to sidebar.
Can I come to sidebar?
Sure.
With it, Your Honor?
I mean, dog bites all look differently depending on if it's a smooth bite, if it's a ripping bite. It depends on the size of dog. It depends on a lot of things. Some people's skin is thicker, some is thinner. But dog bites look, you can't sit there and say yes because they all look like this. They don't. But what the heck? Oh, man. Some of these people's pictures, you have to really look close to know exactly what you're looking at. Dang. So what are y'all's thoughts on that? Mm-hmm. Yeah, she knows where that camera is.
If I may have a moment, Your Honor, I'm going to see if I have in fact concluded the questions for
Okay,
this moment.
sure.
Thank you.
Jim.
Hurry up, dude. Doop, 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 doop.
Your Honor, if I may have a point of order question with the court?
I'm sorry?
May I have a point of order question with the
Sure.
court? Thank you. As you know, she has prepared a report. And different jurisdictions do it different in Daubert hearings. Is that something you believe needs to be marked? I was just going to do a brief foundation that she has in fact prepared one. Sometimes courts require-
Is there an objection to me receiving a report and evidence?
If the court would find it helpful, I won't object, but I do not believe it's admissible or relevant. But if the court would like to reference it, I won't object.
So why don't we mark it for identification, and then the two of you talk about it. We'll see how the hearing goes. And if there is, I may well want to see it, but we'll mark it for identification, Mr. Alessi, and then later see if it comes in, okay? We're clearly, I think, going to have to come back another day. So,
Ah,
need some time.
snap.
Yes. A for identification. You're welcome.
Thank you. There, Jim, thank you. Jim.
Do you need it? Yeah. Sure.
Yes.
I am handing you, Dr. Russell, what has been marked as Exhibit A for identification. Unlike the other exhibits, it is not evidence, not yet. Do you recognize Exhibit A?
Yes,
What is it?
it's the report that I wrote.
How many pages is that report?
Sorry.
Are they not numbered?
They are numbered. I just, the CV is attached as well. Okay, it's 11 pages.
Dr. Russell, did you prepare that report?
I did.
Your Honor, I just would like, if I could please note for the record that that report was filed and it's on file with the court as part of our opposition motion. I know Your Honor knows it, but I would just like to note that for the record.
Sure.
Thank you. At this particular point, Your Honor, I have no questions, and I appreciate the court's patience and gracious allocation of time for me to go through these questions with the witness.
All right, thank you very much. So I intend for us to go until 4 o'clock today, so we'll see how far you get, Mr. Brennan, okay?
Thank you. May I?
Please.
Talk fast, dude.
Just want to look. Sure. And
Boy, this is loud today.
You all set?
I'm all set, Mr. Brennan. Thank you.
Good afternoon, Dr. Russell.
Good afternoon.
My name's Hank Brennan. We haven't had the pleasure of meeting before.
Oh, somebody new on their
Good afternoon,
side.
Mr. Brown.
Not my fault, y'all. They went down. Don't get mad at me. I got it though. We got it. Got it. I'm getting it. We're good. We're not going to miss anything. I promise. Let me get this back on stage. And
And looking at all of these broken bones, that doesn't make you an expert in orthopedics, does it?
Emergency orthopedics, yes.
Oh. Have you ever been qualified as an expert in orthopedics?
No, I've
Isn't
never.
orthopedics a specialty in medicine where there is specific training?
Yes,
And people who become orthopedics or orthopedic surgeons, they go through rigorous education specifically to be an orthopedic, right?
well, orthopedics involves more than just setting fractures or diagnosing fractures. Orthopedics involves things like bone tumors, bone cancers, a lot of other parts of orthopedics, not just trauma. I am an expert in emergency orthopedics, I believe.
So you have decided that you are an expert in orthopedics?
Emergency orthopedics.
Emergency orthopedics, is that a specialty that you get a fellowship in, or somehow you are
it's a part of my emergency fellowship.
deemed an expert in any way?
It's not a specialty that has a fellowship that I'm aware of.
I see. So you are proclaiming that you yourself think that you're a emergency room orthopedic.
I have expertise in emergency orthopedics, yes.
Are you an expert in orthopedics?
The whole field of orthopedics, no.
And you don't have any specialized degrees in orthopedics, do you?
No.
You would agree that somebody who's gone through the rigorous requirements of being an orthopedic and qualified, they'd have much more experience in that than you, true?
In general orthopedics, yes. I have a lot of experience in orthopedic trauma related to emergencies.
Have you ever been in any court where you've ever been qualified as an expert in orthopedics?
It was never an issue.
But I'm asking you, have you ever been in any court, state, federal, this country, any other country, where you've been qualified as an expert in orthopedics?
No.
Has anybody other than yourself ordained you as an expert in orthopedics?
I haven't ordained myself as an expert in orthopedics. I have a lot of knowledge and expertise in emergency orthopedics.
Has any authority ever recognized you and qualified you as an expert in orthopedics?
No.
Just you.
I haven't declared myself an expert in orthopedics. I have expertise.
You've seen a lot of car accidents you shared with us.
Yes.
As a police officer.
Yes.
In the emergency room.
Yes.
Perhaps when you were at the ME's office, you saw the consequence of car accidents.
I did, yes.
Are you an expert in accident reconstruction?
Reconstruction? No.
And when you see the different people that come in with overdoses, whether it's alcohol,
This is going to be a whole new trial, y'all.
Yes.
Nothing like the last one.
I'm not a toxicologist, no. But toxicology is a part of emergency medicine. So we have training in orthopedic in toxicology. But no, I am not an expert in toxicology.
I'm not suggesting you're unfamiliar with it or you haven't had experience or some training. I'm asking you if you think you're an expert.
In toxicology?
Yes.
No.
And you've shared with us that you agree you don't have any expertise in DNA.
That's correct.
In fact, you know very little about DNA, don't you?
I would say that's pretty reasonable, yes.
That's what you said.
Yes.
Oh.
But it doesn't mean she doesn't know how it's collected.
You mentioned that
She just doesn't know how to
you are
process it.
Generalizing or approximating the number of dog bite cases you've attended to in the emergency room relative to civilian dogs or domestic dogs. Is that right?
Yes.
And you've suggested that you probably treated about one dog a week over a period of 27 years. Yes?
Yes.
Which is 1,000 weeks in your estimation.
Yes.
You worked for some of the most busiest ERs. Was there a lot of patients every day that you treated?
Yes.
On average, how many patients would you treat in the ER?
Now he's going to say she couldn't give enough time to each one.
Daily, I would think about 30.
So if you're treating 30 patients a day over a course of a week, and you consider that in the context of 1,000 weeks, the amount of
300.
dog bite cases that you treated in the ER is about half of 1%. Wouldn't that be fair to say?
No, you lost me on that.
Okay.
Sorry.
Well, if you had one dog bite case a week, and say you had 20 cases a day, 100 a week,
Mhm.
that would be 1% of your cases.
Oh, it could, yes, yes, but it's the number of cases, not the percentage that was asked of me.
I'm just asking you a question.
Okay, I just want to clarify that.
And so you said how many, 25, 30 a day?
Patients, yes.
So that's less than 1% of the cases that you treated in the ER relative to dog bites.
Okay, that's reasonable, and that's average, actually.
Now, when you treated cases of dog bites in the ER, you said that you would sometimes have the reporter, the person injured or somebody with them, tell you it was a dog bite.
Yes.
Yeah, and sometimes you had communication difficulties, or there was a reason why they couldn't share it.
Yes.
And then you suggested that's how you came to this pattern recognition skill, is that you would have to determine the injury with no help from the reporter.
I was always interested in dog bites, and yes, there were a few occasions when I had to use those skills in order to determine what kind of an animal it was.
Let's talk about those few occasions. Why don't you share with us a story where you met a patient, that you can recall, where you had no idea what the injury may have been because there was no ability to communicate, and tell us about how you determined it wasn't dog.
Well, thinking about a specific case, I can think of cases where I determined it wasn't a dog bite, and it was something else based on the pattern of the bite. And am I not answering your question?
I'm not looking for cases where you couldn't determine the dog bite. I want you to share some of this wealth of experience you have in dog bites. And share with us, if you will, one of the cases where there was no information that it was a dog bite, for whatever reason, and then you, based on your pattern recognition skills, determined that it was a dog bite. I want you to walk through an actual case that you can recall you had with this scenario you presented.
I can't give you a specific case because, again, in the overall scheme of emergency medicine and the frequency that dog bites are to other cases, it's just not a case that I would remember that kind of the specifics of the case.
Interesting in supporting your vast experience you shared with us, the size of these past experiences, and presenting yourself as an expert in pattern recognition. And it's interesting that when I'm asking you to support this general
Objection, Your Honor, argument.
Yeah, so,
I'm sorry.
counsel,
Yeah.
that's okay. In Massachusetts, typically, we don't give the reason for objections from the floor. Your objection sustained, no commentary, Mr. Brennan.
You shared with the court that you wrote a few articles that had to do with dog bites.
Co-authored, yes.
Can I ask you some questions about those?
Absolutely.
Thank you. Now, the first one I want to talk about is law enforcement canine dog bites. Do you remember that article?
Yes.
And that had to do with what you refer to as law enforcement dogs or canines.
Yes.
In that article, you talk specifically about a technique that you believe law enforcement or canine dogs utilize, which is bite and hold.
Yes.
And what you have suggested is that the bite and hold technique is different than typically a domestic dog or a civilian dog.
Yes.
Because it's a trained learning for the dog, correct?
Yes.
There are certain injuries you would expect from a canine dog using a bite and hold technique.
Yes.
When you wrote this or co-authored this article, you didn't actually sit down with people who had wounds and compare the wounds to the dog that caused them, did you?
No. To the actual dog?
Yes.
I didn't, but I didn't.
Just want to know if you did.
No.
Okay. And when you look at these different cases, there was 700 cases. This was what you called or the authors called a retrospective analysis.
Correct.
That means you were looking back at old files.
Yes, but I participated in some of those files. We were just looking back at the data from those files. I participated in the care of some of those patients.
I understand.
Okay.
And so when you went through the files, you didn't have the opportunity then to follow up and speak to any of the participants or the injured victims, did you?
I spoke to many of the victims while I was treating them.
When you decided to write this article, did you go back and speak to anybody?
No.
There's no mention in this article about pattern recognition in any way. That's not what this article is about, was it?
No, that's not what the article's about.
This is about something entirely different than what you've suggested today is your pattern.
Welcome, Angela.
That's correct. I recognized the patterns because I saw the wounds and I saw the injuries and I saw them over and over and over again.
Been live since 7:45 this
and I
morning.
recognized those patterns throughout my career. And so it's just hard to unrecognize something.
I'm trying to ask you about the significance of your study because this is actually something that you published.
Yes.
And I'm trying to determine, or I want you to be able to discuss the relevancy of this article to what you're testifying today. So the question, the really narrow question I have for you is, in this study, it had nothing to do with trying to engage in pattern recognition.
The purpose of the study was not to teach people pattern recognition. It was to alert them to the dangers of this different type of dog bite so that they weren't under-treating them. But in the process of seeing all those patients, I developed the pattern recognition.
Okay. And so there was another article, Managing Law Enforcement Canine Dog Bites in the Emergency Department.
Yes.
Now that only comprised of 4 cases, yes?
It was a case description.
Of 4 cases.
Yes.
And do you know, most studies usually include over 30 cases?
It's not a study.
I see. You reviewed types of injuries relative to civilian or domestic dogs or just canine?
Those were canine dogs.
And again, your position is that the injuries by canine dogs, law enforcement dogs, are different in kind than domestic or civilian dogs.
In general, when they bite and hold, those injuries are different. Sometimes they don't get a complete bite.
And so this article didn't deal with civilian or domestic dogs. It dealt with only canine dogs.
That's correct.
Exclusively on the idea or the perspective of bite and hold injuries.
It was on the perspective of you need to learn how to treat these.
Bite and hold injuries.
These dog bite injuries.
Bite and hold.
Yes, yes, yes.
Okay. Now, again,
I can take that down. We already know.
Identify
Sorry.
wounds or use pattern analysis.
Thank
It
you.
was the treatment
We
of
already
bite
know.
and hold
I forgot
injuries
about it.
from
Thank you.
canines.
That's correct.
Law enforcement canines. Yes?
Yes.
Okay. And then you also shared with us, in addition to these 2 articles on law enforcement dogs and bite and hold injuries, that you did some revising, editing of a book for a doctor. Is it Vati?
I'm sorry, say again?
You said that you revised or edited a book of a
Dr.
friend.
Vail.
Dr. Vail, I'm sorry, Dr. Vail. And when you were asked about what actually you recall about the topics, you don't really remember the topics of that book. You just remembered you edited it.
No, I remember the topics of the
Okay.
book.
In the topics of the book, it was dealing with human teeth, wasn't it?
Yes, but in the article
Mm-hmm.
itself, if you read it, there's mention about dog dentition.
There's a mention of it.
Yes.
Tell us what that mention was.
Well, the mention is that the dog dentition looks different and dog bites look different because of the triangular shape of the dog's mouth versus a rounded shape of the human's mouth.
Well, when they talk about the shape of a dog's mouth, it's not really triangular. It's like an hourglass.
Well, but that was the quote those were the words that were used in the article, and it's relative triangular shape. It's as opposed to a round shape of a human.
Well, in most studies, professional studies by experts, isn't it routinely referred to as an hourglass shape?
I haven't seen that at all.
Well, have you read books on dog bites?
I've read articles on dog bites.
You've read books on dog bites?
No, I have read articles on dog bites.
Have you ever read this book? Do you recognize this as an authority?
No.
So for the record, you need to say what you just showed the
I'm
witness.
showing Dr. Russell a book called Dog Bites, a Multidisciplinary Perspective, edited by Dianne S. Mills.
Is that it? I'm sorry, may I see it?
If the court would let me, of course. May I approach?
Yes.
Thank you.
Thank you. It doesn't mention if any of these people have degrees of any.
Sorry, Your Honor, I don't believe a question's pending.
Sorry, Mr. Alessi, I couldn't hear you.
Thank you. I don't believe a question.
Oh, I'm
is
sorry.
pending for the witness.
Okay, are you moving to strike that?
Yes, I am.
All right, I'll strike that. So, Doctor, I know it's been a long day. Wait for a question, please, okay?
Okay,
All right.
thank you.
You done reviewing the book?
Yes.
You've, through your testimony, attempted to or suggested there's a distinction between canine law enforcement wounds and that of domestic.
Yes,
But domestic dogs can cut the skin,
correct.
cause serious injury,
Yes,
deep wounds.
they can.
It's not just that domestic dogs just nip around the corners. They can bite,
They can.
they can attack,
Yes,
they can kill.
yes,
You've seen it firsthand.
yes. Oh, I didn't witness the attack, no.
Do you doubt that it was a canine attack?
No, I didn't witness the attack myself.
I understand.
Firsthand is what you said.
Okay.
Watch your
You
words.
made a
She's going to take it
firsthand
literal.
observation of a dog bite in the 1970s when you were at a training.
Yes.
And one of the participants was bit.
Yes.
Now, you said you didn't remember the wound. Do you have any memory of looking at what happened after a dog actually bit somebody firsthand?
Objection, Your Honor.
No, I'm going to allow its cross-examination on our test, based on our testimony.
Say again? My question.
Should I repeat, Doctor?
Yes, please.
Do you have any memory of what you saw of when a dog actually bit somebody, a firsthand observation?
From 50 years ago? No.
Right. When people came in an emergency room, you didn't actually see
He's
the
gonna
bite
hammer
or how
her.
the mechanics of it happening. You're treating it after they come and ask you for aid.
That's correct.
Did you ever, in any of those emergency room experiences, go and see the dog?
No.
Did you ever have any other information about the dog, photographs, pictures, anything like that?
Well, I did have other information about the dog.
Oh, give me an example. Tell me.
Well, we had to fill out a dog bite report after a dog bite's requirement in Los Angeles County.
Whether it was Chihuahua, Great
Although
Dane.
most doctors don't have the time to do it, I tried to comply with that rule. So I would question the victim, try to find out the address of the dog if they knew it. Sometimes they did, sometimes they didn't. But I tried to get as much information as I could.
Did you ever get any photographs?
No.
So it was just reporter information from the person who's coming for treatment or somebody that was assisting them?
Yes.
Okay. You provided a CV in this case, didn't you?
Yes.
In your CV, you list out some of your pertinent history and experience.
Yes.
Subsequent to your CV, you wrote a report and you signed it on the 9th of December, 2024.
Yes.
And it was provided to the Commonwealth, on December 10th, 2024, 2 days ago.
Yes.
There are a number of things that you offered in that report regarding your suggested experience that are just not in your CV. Isn't that fair to say?
That could be, yes, of course. You can't put everything in the CV.
Well, you didn't say anything really about dog bite experience in your CV other than your 2 articles, did you?
No, I didn't.
Okay. And you didn't mention anything about this specialized training or expertise in pattern recognition analysis. You didn't mention anything about that in your CV, did you?
Can't mention everything.
I didn't ask if you could mention anything. I'm asking if you mentioned that.
Well, it says brief CV on the top.
Okay. I'll ask you again.
Okay.
Did you mention anything in your CV about pattern recognition analysis in your described expertise in that?
No.
In your report, and let me ask you before we get to your report, you testified at a voir dire in this case?
Yes.
About a year ago?
Less than that.
And you then testified at trial?
Yes.
When you testified in the voir dire and trial, and in your CV, you don't mention the scores of peer review articles on dog bites that you studied, do you?
Ask that question
I'm
again.
sorry. When you testified 2 times before,
Yes.
did you talk about the scores, as you describe it, of peer review articles that you've studied on dog bites?
On the numbers of period. No, I didn't mention that. That's correct.
Okay, and that's not mentioned in your CV either,
You don't usually mention it in your CV about the articles you read.
but I'm asking if you did.
Oh, no, I wouldn't mention that in my CV.
Okay, so let's talk about it now since you didn't mention it. You read scores of peer-reviewed articles on dog bites.
Throughout my career, yes.
Let's talk about the peer-reviewed articles that you've studied on pattern recognition analysis of dog bites. Could you please give me a list of those peer-reviewed articles that you studied?
I don't think there are any.
Well, you
There
said-
are some mentions of pattern recognition in some articles. However, I don't think there's a dedicated article on pattern recognition of
Well,
dog bites.
You said in your report that you reviewed scores of peer-reviewed articles on dog bites.
Dog bites, yes.
Okay, so those didn't really include pattern recognition as you've described your expertise today.
Some of them did, some of them didn't, but that might not have been the major focus of the article.
Which ones did? Can you reference us the ones that you've read and relied upon, in your opinion today, that have to do with pattern recognition analysis?
May I look at my report or my CV?
Sure.
Of course.
Sure. Go ahead and take your time, John.
Thank you.
I mean, some of this stuff was written so long ago, she can't remember word for
Okay.
word what she
There
said.
is, and they might not have used the term pattern recognition, but that's what they're talking about in these articles.
Okay.
There is a article by D. Munick. It's actually listed in my report
Mm-hmm.
under literature.
Okay, I see it.
It's the third one. Yes.
And that deals with pattern recognition analysis?
It's part of the article. There was a lot more in the article than just pattern recognition. And again, they might not have used that specific term pattern, but it's what the subject was discussed in the middle of the article, yes.
What was discussed in this article that you relied upon?
Oh, I relied on the descriptions of wounds. I relied on a lot of this article.
Well, share with us in detail. Could you tell us what you relied on in that article as part of your opinion?
There was a description. There was an area that described wounds and fatal wounds in dog bites. And
You want her to
and
go
how
back and
approach them,
remember
you know,
what
how
she
to-
used
how to
30 years
investigate
ago?
There was an area that described what some of these wounds looked like. And there was actually an area that I believe it was this article that said that if you have this plus this plus this, that it is pathognomonic for a dog bite. Now, it was, I believe that was the article that said that. One of these articles did, but anyways, so yeah. So I think maybe you might want to look at them.
Oh, I did.
Okay.
That's why I'm asking you.
Okay.
And so I'm confused about which one you're talking about.
There was not a recipe book that said, okay, this is the pattern of a dog bite. It might, they might not get a lot of readers for that, but this was a forensic approach as to how to identify fatal dog attacks.
So from your resume, doctor, could you tell me which article you're talking about?
I'm talking about the third one down.
What's the title?
The title of the article is Forensic Approach of Fatal Dog Attacks, a Case Report and Literature Review.
Okay.
Fatal dog attacks oftentimes involve vulnerable areas like the neck,
Absolutely.
abdomen.
Neck, face, head, yes.
That's
Sometimes the abdomen, yes.
okay. No cases cited in there that deal with wounds on an arm.
Because it's a fatal,
Right.
Right. But that doesn't mean that there weren't wounds on the arm. It's that the fatal wounds, like in the case I autopsied, the fatal wounds generally were in the areas that had organs that could be damaged, like or major vessels like a carotid artery, neck. But there could be a lot of other wounds. For instance, my case, there was probably about 60 wounds.
I understand.
Okay, but some of, you're not going to talk about every single one of them because they're not worthy of describing.
Okay. You said that you attended multiple seminars, talks, and lectures regarding wound identification.
Yes.
Okay. When did you attend seminars on wound identification?
Intermittently throughout my career. I can't give you any dates.
Okay. Were any of those wound identifications dog bite wound identification seminars?
No, they were general wound identifications, and they may mention bites.
Was there any of these seminars that focused on dog bite wounds?
That focused on dog bite wounds?
Yes.
No.
How about the talks you went to? Any of the talks focus on dog bite wounds?
There were several talks that focused on bite wounds.
I'm going to ask again. Were there any talks that focused on dog bite wounds?
No.
Lectures. You've cited that you've attended lectures as part of this experience. Can you recall specific lectures that focused on dog bite wounds?
Not entire lectures. There were lectures in emergency department, training sessions, but dog bites were usually mixed in with other kind of animal bites, and discussion would occur because it's not you have to use up an hour usually when you go to one of these lectures, and there were other animals to talk about besides dogs.
In these lectures that you went to that didn't focus primarily on dog bite wounds, did they talk about pattern recognition analysis of dog bite wounds?
Generally not the emergency medicine ones, because that's actually not really a major focus. The focus in emergency medicine is treatment. I'm a bit unusual because I have this interest that I've had for many years.
So it's fair to say none of the multiple seminars, talks, lectures that you attended had any focus on pattern recognition analysis of dog bite wounds?
None of them had any focus. That's correct.
You've shared with us your experience. You've
And
agreed.
Jella,
that
can you
are
share
not
the
an
link?
accident
I want to
reconstruction
see that,
expert,
please.
correct?
Correct.
Are you an expert on self-defense?
Oh, I knew he was going to go there.
So when you give opinions about self-defense, I know you have experience and
Mm.
have observations of what you believe a defensive wounds, but do you have any actual experience as a self-defense expert?
No.
Do you have any specialized training, certificates, degrees in self-defense?
Even the best doctors do not necessarily have self-defense training. Sorry.
When you went to these lectures, talks, seminars, group meetings, do you have any memory of particular trainings that you had on self-defense wounds?
Not
You
needed.
mean defense wounds?
Sure, defense wounds.
Yes, I do. I have particular memories of
Are you in
those
our Discord?
types of lectures.
Okay.
In topic. Oh, yes, I do.
Well, let's talk about a few of them. What was one of the lectures that you went to that was directed at defense wounds?
Well, not only did I go to some of these lectures, but I gave some of these lectures.
Okay.
And they were child abuse, elder abuse, domestic violence lectures. And in the coroner's office, again, mechanism of injury is stressed. And there's a whole training program.
I did it in Discord,
You have
love.
no degree in biomechanics.
No.
Okay. And so when I asked you about one of the trainings on defense wounds, I want you to just give us a little detail from your memory about the training. Share with us how you've come to this knowledge on defense wounds.
Again, okay. So in the clinical setting, I was taught many times, and then I subsequently taught students about how victims of a violent act will instinctively bring up their arms to protect themselves from whatever is being inflicted, whether it be knife wounds or blunt wounds from an object, whatever is being inflicted on them, they will tend, without thinking, to try to protect themselves. And I also think it's common sense, by the way.
So on the outside of the arm, if there's marks.
It won't
that
let
could
me
be a
access.
defensive
Can you
wound?
send me the file,
Yes.
love?
Could it be a different type of wound, not a
Please?
defensive wound, but a wound where somebody punches or hits and it hits a metal or a stationary or a fixed object?
Could those kind of wounds
Sure.
end up there? Oh, yes.
Okay. So just because there is a wound
When you
on the
go,
posterior side of the forearm, that does not make it a defensive wound, does it?
Not absolutely.
Well,
In context, though.
right. So you need to know more information.
Correct.
So perhaps if you saw how that happened, that would be.
okay. If you've done autopsies, you work in the morgue, you go through that training. Don't have to be a self-defense expert when you go through and you have to do autopsies. You've got a ton of training, guys. This man is pissing me off.
Provide you more information.
That would be one way.
But
Thank
if
you, love.
Saw nothing and have really no idea how it happened. It doesn't give you a lot of context of the wound other than it's a wound on the posterior side of an arm.
Well, it does in the sense that it's a common way that people protect themselves.
Can someone incur wounds to the forearm, posterior side of the forearm, if they fall to the ground and fall backwards?
They could, but they wouldn't look like that. That serious.
Have you studied a collection of wounds when people fell backwards onto the ground?
I've seen hundreds of people that have fallen backwards or frontwards and every which way.
Wouldn't you want to have an idea what they fell on or into before you make a conclusion that it would not have looked like the picture that we looked at, Exhibit 5?
Damn.
I've seen, as I said, hundreds, and there has never been a pattern like that ever that I've seen.
Well, when someone hits a moving or a floating object, patterns or dynamics
Y'all don't-
change all the time, don't
If you are in Discord or y'all get this article, don't scroll down if you don't have a strong stomach. That's all I'm going to say. All I'm going to say. Angela, I'm loving this.
They do
Thank you.
during the
Damn.
hitting process. Yes, during that process.
Okay. You talked about your specialized training. You said you had a program in motor vehicle accidents.
Yes.
And I think when you testified before,
I'm going to read
Attorney
this.
Riley had asked you whether or not your training was, I think he used the word rudimentary, and you agreed.
Yes, I believe it was only a 1-week course or something thereabouts.
When you're identifying a wound at the hospital, is it important to know, you said it's important to know the animal because that dictates the treatment.
It may dictate the treatment.
What if you can't identify the animal?
Then then you have to go on clinical judgment, and sometimes we even have to call up the Board of Health. But you go on clinical judgment to determine, well, what was the worst possibility? That's the way I approach movement. What is the worst? Could it have been a rabid animal, an animal with rabies? Or was it an animal that doesn't carry rabies? And then based by treatment on that, sometimes you have to treat broadly, and sometimes you have to, treat people for conditions, even if you know 100% that they exist.
Are there times when you saw injuries that you just didn't know how they happened?
Yes.
It's gruesome, but it's good information. I'll be reading it.
Yes.
Okay. And many times you thought what you saw were bites, but you couldn't articulate the animal, right?
If anybody's interested in the article, I will blur out the images because they are gruesome. If you can't handle gruesome, but if you want to read the article, thank you very much, Angela, for getting that for us. I will be happy to blur it out unless you got a strong stomach.
That happens sometimes.
Okay. Suffice to say, you have
That woke me up.
never, ever been qualified in a federal court to testify as a dog bite expert, have you?
No.
And other than this trial a year ago, have you ever been qualified to testify?
It's always the first time.
In any state court in the entire country as a dog bite expert?
No, the issue never came up.
That's not what I asked.
Okay,
though.
no,
No. You wrote a report in this case?
yes.
Did anybody help you write this report?
I wrote the report. I had some help with some minor edits and rearranging, some paragraphs or whatever, but putting things in the right category.
Okay.
But no, I wrote the report.
Who helped you with your report?
Mr. Alessi.
So did you?
We always
write
have
the
a proofer.
preliminary or draft report, send it for input, and then change it?
No, I didn't change it. I wrote the report, and I would have things in the wrong categories, for instance, like training experience or whatever.
Who said they were the wrong category?
Well, I think that was my conclusion, actually.
I see. And so how would you go through this editing process? How did that work on this report? Would you send
This
it back?
guy's
and
good,
forth?
y'all.
It got sent back
It's
and
good.
forth a couple times.
Okay. Now, this report you signed, right?
Did I sign it? Yes.
Nobody else signed it. You.
I wrote it.
Okay. And the reason why I asked if you had help, a lot of your statements and conclusions in this report are different than the testimony that you gave at both the voir dire hearing a year ago and at the trial. Is that fair to say?
I don't think it's fair to say.
Okay.
I think that
Tell me.
I don't think it's fair.
Okay.
I was convinced, if we would get into specifics, I was convinced of of my opinion back in the voir dire and in the trial. But I think I stated it wrong. I stated it as if I was talking to other doctors. They say in medicine that nothing is 100% in medicine. That's what we learn, when we go up through medical school and residency and whatever. And in my teachings, I always told people nothing is 100%. And that was the number that I was, that I thought I was being asked for. Basically, it was 100%. So that's why I stated my opinion the way I did. But anyways, as I went through material again, I was convinced back then, and I am still convinced right now that these are caused by dog bites. And not only that, but dog attack.
And more so because I've had more time.
Testifying honestly and earnestly before and using doctor speak. Why would you need to change it for today, this report? Why not just?
And that's the other thing. Questions are different.
I came up with this. I became clearer and clearer every single time that I looked at the pictures, and I just realized that I understated the last time, that I misunderstood the question that was asked of me, regarding my opinion.
That happens.
And so I felt that I had to be clearer.
Did anybody point
That
out
happens.
to you that it'd be more helpful to the defense case if you had a more assertive opinion?
No, absolutely not.
So when you went through these days and months since the trial, is there any new information that you looked at that made you realize you underscored the confidence in your opinion?
No.
Okay. Because in your earlier testimony, it's quite different.
I know.
I want to do this gently, but I want to go through some of that.
Okay.
Okay.
In other words, I'm calling
When
your
you
BS.
first testified, you had, how should I say this? You offered opinions that were less than certain about the genesis and cause of the wounds, didn't you?
I think it sounded like I was not certain. However, I was certain. I just didn't express it correctly.
Okay. When you first testified
Nervous.
in voir dire about some of these wounds, you were asked.
Okay, and understand, guys, she hopped in the middle of a trial. She didn't have the time that she's had now to review all the evidence. She reviewed some of the evidence. So I think right now she's got a better grasp of what she's looking at and has had more time to more adequately formulate her opinion, even though it's not changed, it may be a little clearer, in
what
my
kind of
humble
animal
opinion.
you thought caused the wounds, and you said most likely a dog.
Correct.
Right.
I
You
got
didn't
it.
say beyond a reasonable degree of dog bite certainty, did you?
Objection, Your Honor.
Did you send it to me, Angela?
Objection is, he said beyond a reasonable doubt, and that.
No, he didn't say doubt. He said degree of medical certainty.
He said beyond.
Right, beyond a reasonable degree of medical
Toxic.
certainty. So I
I'm
heard
gonna
you didn't
send you
get to
this
the
article,
certainty. You just heard
if it's
beyond
okay with-
reasonable and.
I'm going to send you the article if you think it's okay, Angela. But I will say toxic. This is very graphic. I would suggest you put a warning before anybody opens this because some people can't handle it. I am just saying it's graphic. Okay. So I'll go ahead and I can get it to you. I know people are wanting the article and I don't have a problem with it, but it is really graphic. There you go, toxic. It's there for you. I'm checking right now. Well, this is the same thing I have. I just sent you what you had. Sorry about that, love.
Objected.
It's
So,
graphic.
Based on that, the objection's overruled.
Oh, thank you, Angela.
Let me phrase to make it clear.
Angela.
You didn't say to a reasonable degree of medical certainty that the bites you looked at were a dog.
I did in one of the okay, and maybe in the next one. Okay. But yeah, if I wasn't asked about reasonable degree of medical certainty, I may not have expressed it.
The court herself asked you, do you know what kind of animal? And you said, yes, most likely a dog.
Yes.
Is that fair to say?
Yes.
So you didn't express certainty at that point?
Yes, but again, thinking as a doctor and not a lawyer or or a judge or someone, I'm thinking as a doctor, I'm thinking that it's never 100%. And so that's what I was going by. If I was going to be teaching medical students what those wounds were, or another group of wounds.
She's right.
I tell people never 100% in medicine. So that's where that came from. And I apologize if I confused the court.
I don't think there's any confusion. You use the word likely. The word possibly is even less certain than likely, isn't it?
I don't know.
Well, when you're a doctor and you look at something, you say, well, the likelihood is this is the cause of this.
Oh, yeah. Okay.
That would be a stronger opinion than saying it's possibly this.
Correct.
Possible is even less certain, isn't it? At trial, when you were asked about the cause of the injuries, I'm going to quote you, and I can show you if you'd like. It's the trial transcript, page 19, line 21. What you said is, I believe that these injuries were sustained by an animal, possibly a large dog, because of the patent injuries.
Yes.
Is that your testimony?
Yes.
Very different. I'll just finish if I could. Very different than what you're opining today at this hearing.
I'm sorry that you think it is, and I can understand how you believe
I'm
it
sorry,
is, but
you're right, Ronnie.
It's not different to me. I believed it was a dog. I was convinced it was a dog then, but going by the no 100% in medicine, I didn't say that. I am still convinced it's a dog. The one thing that's a little different is that it's an attack. I after counting the series of wounds and whatever, I am convinced not only was it a dog, striking once or twice, but it was actually multiple strikes by that dog.
Okay, now I want to get back to the testimony we were talking about, your testimony at trial under oath, okay? Your testimony is you believe they were sustained by an animal, possibly a large dog. You expressed uncertainty that you didn't even know or have an opinion about what type of animal caused these wounds at that time. Is that fair to say?
I was leaving room for if there was a, for instance, another kind of animal in the vicinity that, but there's no evidence to that. There's no, paw marks or anything in the ground.
What other animal do you think was in the vicinity that would have caused these?
I don't know, but I was just leaving that, again, being a trained physician, there's no absolutes. And so that's what,
No.
the way I approached it.
Did you inquire to see more discoveries, to see if there was a pack of wild animals in 34 Fairview that would have
Oh my
caused this? Did you
God.
reach
Really?
out to any of the witnesses or the lawyers and ask if there was any reports or information suggesting another animal?
No.
Were you curious?
No.
I did not. I just didn't do it.
Okay. You were asked by Mr. Jackson, trial page 23, line 3. He provided the question, does this appear as it's a pattern injury that you see appear consistent with an animal or a large dog? And you said yes. So you included that this, again, could have been a dog or an animal in your opinion.
Mm-hmm.
Thank you, love.
Yes?
Mm-hmm. I haven't.
So I'm sorry, we can't take a, we need a yes or no.
Oh, sorry.
Doctor.
Yes.
Again, at trial,
I was in
page
shock.
23, line 6.
All
You were
right.
asked, does the number of injuries that you see here relegated to just the right arm, is that consistent with an animal or a large dog? And you said, yes, it can be.
Of course.
Do you want to see your testimony? Because I don't want to just put words in your mouth.
No, I trust you.
And so, thank you. So the question that you were asked was positing that it could have been
Show me.
not just a dog, but any animal. And you were agreeable to that at that time.
Again, thinking like a medical doctor, not a participant in a legal setting.
And she's right.
Not to belabor.
Medical doctors are trained. You never give a 100% because there's always that 1%. Even though you said that 100% they're going to die. Well, we're all going to die 100%, just a matter of when, where, how, and why. But that's something my family member used to say to me all the time. He was in the medical field. Nothing is ever given as 100%, even in the medical field, even no matter what.
To talk to you about them. You were again asked, page 23, line 18, by Mr. Jackson, based on everything that we've discussed today, doctor, is it your opinion, based on a reasonable degree of medical certainty, that these injuries were from an animal attack, possibly a large dog? And you said yes. Correct?
Yes.
Okay. And so your opinions today that this was exclusively an animal attack caused by a large dog, that is much different in kind than the uncertainty and possibility that you admitted under oath during trial, in this case, the first time, or actually the second time you testified about it. Wouldn't that be fair to say?
It sounds like it, yes.
Okay, I think this is a good point to stop because we need to get another date. You're not going to finish in 3 minutes, right? No, okay. All right, so Mr. McDermott, was the date you and I looked at? Was it Jim? Okay. If the witness can step down, but Timmy, she's going to stay in the courtroom without any date. Yes.
January 6th. Okay. January 6th. Back there.
Oh, yeah. Mm-hmm.
Doctor, are you available on January 6th?
I'd be available.
I think after January 15th is cutting it a little too close.
You earlier, that's far out.
So, I mean, the best date for the court is January 6th.
No dates in December, Your Honor?
Will be available.
Tomorrow. Actually, I don't know that we'd be able to do it. We suspended a jury trial today that we told the jurors they'd have tomorrow, and we still have testimony. So I think at best we'd give you a half an hour, and I don't think that does you any good. So.
Call will be available anytime.
Monday we can't do?
No. No, not any time before. I could do the 30th.
Oh.
So what
She
we
should
really
write it
need is
down.
Mr. Alessi.
Your Honor, what is your question for a date? And I'll give
We're now-
you.
January
30th. We're looking at the 30th now.
or the 6th, Jim, right?
I thought the,
Yeah. Doctor said after the 15th.
can you do January 6th?
Can I?
Yes.
I wasn't going to be in town.
Can I ask this? Is the 30th an available date for the court?
Can we move our other stuff, Jimmy?
Oh, I'm sorry.
Back to
Karen Reed's like, boo, I got vacation. No.
January 6th. But I want to be I'm trying to be respectful of the witness.
I'm trying to do that as well, but the witness's best dates after the 30th are after the 15th of January, and that's too late. So I understand that the conflict seems to be Mr. Jackson, but Mr. Yannetti, are you available on the 30th or the 6th?
I could move things to be available on the 6th. There's no chance we could do the 8th, right?
I could do the 8th, Your Honor.
You do the 8th?
Jimmy, that's a full day, right?
The 8th?
I think it doesn't matter.
Jim,
Yes.
I have stuff.
Actually, I could do the 7th, the 8th.
Y'all. Y'all. Okay. And can you pray tell me why you can't do January 6th? I don't know anything about the Orthodox. The Monday.
Where are we up to now? The 8th? Back to the.
That would be the best for us if we could do
The 8th in the morning?
Anytime.
All day.
So I have a conflict here in the afternoon. So I have something that we have to do in the afternoon on that
8th of
Wednesday.
January is
On
Christmas
that-
Eve.
Yeah, Wednesday, the 8th. But if we can do it in the morning, we'll do it in the morning.
We could all do it at 9 o'clock. I would imagine, I guess I would defer to Mr. Brennan if he can finish in the morning. 8:30.
I don't want to limit, I let Mr. Alessi go on much longer than the estimate, and I had no problem doing so, Mr. Alessi.
Okay.
You can't do the 6th or 7th?
I could do the 7th, Your Honor. I cannot do the 6th.
So, Mr. Alessi, you're available all the dates we said, pretty much, right?
I will make myself available for all dates. I'm not presently.
I would like to see.
Okay. Yeah, go do a sidebar. Everybody get together and do a sidebar. Oh, well, that's her Christmas. She can't do it on the 7th, right? Uh-oh. Wait till they all go, we can do it the 7th. She goes, Your Honor, I can't. That's a religious holiday. Oops. You guys, thank you so much for joining me today. I really appreciated it. I didn't anticipate this to go all day. I'm glad it did, though. I think the prosecution's being tough on her, but I would be shocked if Bed said no, she cannot testify. So they're saying that she impeached herself. Mm-hmm. 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 Shouldn't even made it to trial, in my humble opinion. If I was her, and it is a holiday that she's observing, I would have already said, Your Honor, it's a religious holiday. I cannot be here. Interesting. I forgot about the Orthodox and their Christmas being in January. Totally forgot about it.
Last call, January 7th. That sound good?
At 9 a.m., Jimmy.
9 a.m.? January 7th, 9 a.m.
All right, thank you, everyone.
Thank you, Your Honor. Thank you, Mr. Clerk.
I didn't hear it.
Last call, January 7th, 9 a.m.
Oh, snap. What is she going to do?
Thank you, Mr. Clerk.
Jimmy, I'll take this and when you get a minute.
I know, right? When is trial?
I'm good for now. Thank you. I'll come back up.
Goodbye.
I don't think we're gonna make it. We're not gonna make it. No, we're not gonna make it. Nah. Like, all it's gonna do is stress us out.
Yeah, get away from the mic, dude. Hold on, guys. I got a call.
Hi, this is Michael covering the Karen Reed case.
Sorry, they were just confirming my doctor's appointment.
The Karen Reed case? Oh, no. Yeah. Sorry.
I like to kind of watch.
Just wrapped. The judge just left.
Okay. Wrap it up. The judge just left. Okay, we wrap it up. What is y'all's humble opinion? Yes, ma'am. And I'm saving that. Yep, I'm saving it. Let me see what our January looks like. Boy, y'all, we have. So that's 8 a.m. my time. 8 a.m. my time. I'm going to put 8 to noon. So the Karen Reed trial, it's not going to happen on the 27th, but I haven't moved it yet. So who say she was impeached? We can go back and look. I can go back and look. That's no problem. Okay, let's see. I'm trying to get to it. Trying to skim. Get out.
Jimmy, I'll take this and when you get a minute. No,
I'm looking on my different monitor.
Goodbye.
We got a race. I don't think we're gonna make it. We're not gonna make it. No, we're not gonna make it. Nah. Like, all it's gonna do is stress us out.
I'm watching.
Hi, this is Michael covering the Karen Reed case. How are you? They just wrapped. The Karen Reed case. Oh no. Yeah. Sorry. Yeah, just wrapped. The judge just left.
Nope, nothing about impeaching. I don't know. Ooh, interesting. Wonderful. This will be interesting. Okay, guys. It's the end of our day today. It is 4:00 on my time. I've got to go get some blood work before I go to the doctor tomorrow. I have a doctor's appointment at 9 a.m. tomorrow. So we will start live at about noon, or if I get back sooner. Okay, so tomorrow morning will not be alive. We will get going on that at about noon tomorrow. And if something hops up between now and then, I can always pop the live on and leave it going. Okay. I bless you. I hope y'all have a fabulous evening. Yeah, they take like 9 to 10 vials. It's an RA panel. And y'all, thank you for joining me. Thank you for all your comments, your love, your help. You're amazing. And I can't thank you enough. We will see y'all tomorrow, approximately noon. Until then, have a great night. Bye-bye.
Thanks for watching. Please comment, like, share, and most importantly, subscribe. I hope you have an awesome day. Till next time, take care.